everyone, and thank you so much for joining us on our third day of this amazing forum. The past Friday and Saturday have been phenomenal. Today we have even more awesome panels and guests and cameos. Oh, I forgot I was going to say good morning Sunday morning. So there, it's a little late, but I had to do that. So before we get started, thank you so much to our sponsors, March for Medicare for All, Yellow Vest Action, Real Progress in Action, Real Progressives, National Single Payer. You guys are phenomenal. And Indie News Network, the one who's, you can see things on my network and Real Progressives Network, but Indie News Network is holding it all down as well, and they are sharing this far and wide. Also shout out to Andy, who is on the background, who has been our tech guru, who we quite literally could not have done this without. So thank you, and thank you so much to all my teammates behind the scenes, who you don't see on camera, but who made this all happen. Before we get started, and I bring Luke and the panelists in, I want to just kind of do something I wasn't planning on doing before panels, but we, as an organization at M for All, we need donations because we do actions, and it costs money, unfortunately. Being an activist and doing large scale physical events is, needs money, unfortunately. So we really do need your help. For every $20 you donate, like let's say you donate 40, that's two. Each $20 you get a ticket for this raffle basket, $150 in value, plus we will ship it for free. So tons of M for All swag and treats and all kinds of amazing things. So not only will you be helping us tremendously with our actions that we have in the works that we're planning, but you will also enter a chance to win some awesome stuff. So please go to our website where you can donate. We really, really could use your help. That being said, Andy, if you'd like to bring in Mr. Luke.
Hello. How's it going, Joy? Great to be here.
Yes. So what do you think about the forum so far?
I think it's been absolutely fantastic and very informative. I've been quite impressed by the panelists that we've been able to put together here, and I'm very excited for today's panels. And if I could just add on, you mentioned that basket. Also included will be the Deficit Myth by Stephanie Kelton. Anyone who may be not up to date on some at least rudimentary MMT principles, we will also be doing a panel here at 4 Eastern, 1 Pacific, that'll be describing how you pay for Medicare for All and going over some of those MMT principles. So I just, as someone with Real Progressives, I could not help but plug the MMT side of things.
No, and that book, look, Stephanie, we love you. But yeah, yes. I mean, but really, how are you going to pay for it though, Luke? I get it, but how are you going to pay for it though?
With my hard-earned tax dollars, Joy. For those that don't get that, that's a joke. That's a joke. When we will go over that a little bit at 4
That's
Eastern.
why we have to name the panel "How Are You Going to Pay for It?" because there will be people saying during that panel, but really though, how are you going to pay for it? So, please tune in. We have heard, from incredible speakers and musicians all weekend, but today we have so much more. We are going to be doing panels on this one coming up is on international policy. Then I'll be doing one on why single payer must be national. Then Luke, as he said, MMT panel. And then I'll be doing another panel on general action versus voting, how to go forward. And then we have a lot more after that. So please stick around, smash that like button, share, subscribe, do all the things. So Luke, take it away.
Well, we have a fantastic panel here to start the day off. We're going to go over some of the legal framework, the international legal framework for Medicare for All, and how it is a human right. And there is also a complaint being worked on with the UN to basically say that the United States has violated their obligation to provide a basic human right in the form of healthcare. So I'm very excited to get into things today. For those who may not know me, I'm Luke Parcher. I'm a volunteer with Real Progressives and Real Progress in Action. I'm on our leadership team. I'm a student activist and political commentator, and I am just thrilled, honored, and humbled to be a part of this summit this weekend. Thanks to everybody for tuning in today and the other days. And with that, we will go ahead and bring in our panelists so that I can introduce who we're going to be talking to today. We have Martha Schmidt. Martha is a human rights expert and activist, co-chair of the Human Rights Framework Project, a board member of Center of World Indigenous Studies, retired labor and equal employment attorney. She is a former professor of human rights, political economy, international relations, and public policy, past union organizer, from Wisconsin and with the University of Washington. We also have Mary Garish. Mary is currently living in Vermont. Mary has been a healthcare and human rights advocate for many years on a state, national, and international level. Mary was the co-chair of the United States Human Rights Network's Universal Periodic Review Task Force for Geneva, and a nationwide advocate, and also the co-chair for the International Covenant and on Civil and Political Rights in the same arena for the past 10 years. I want to thank both of you so much for taking the time to be here today.
Thank you.
Thank you.
And just quickly for the audience, the way that we're going to format this, we have a few presentations to bring you, and once the presentations are over, we're going to do a Q&A session. So while our panelists here are presenting, if you have any questions that come to mind, please put them in the chat section, and we will have some people behind the scenes checking for questions to ask during the Q&A session. So we're going to start with Martha on explaining the legal right to healthcare. If we want to go ahead and dive into that first presentation.
So this is going to be about the basics of the international human right to healthcare. I'm calling it Healthcare Human Right to Healthcare 101. Next. So the first thing to understand is that a human rights approach is very accessible and can be used by everyone. So this is not just for lawyers. And I want to tell you that international law protects the right to health and includes the right to health care. The right to health is a broad kind of human right. It encompasses social indicators of health, such as having clean air and water, uncontaminated physical environments, affordable and decent housing, sufficient income, and other things. And the cross-cultural research shows that income inequality itself results in inferior health outcomes, such as higher morbidity and mortality. The experience of the pandemic and the problems of our global economy really indicate the need for internationalism here, and for us to reject imperialism and adopt a holistic analysis of the human right to health care. We need to work with everybody who are our allies. The right to health care is a legal duty, and it's owed by a state or a country, the United States, at the national level to all its residents. Next. Now let's just think about what we have here. It's the opposite of the human right to health care. Our whole society is dominated by neoliberalism, and particularly our healthcare system. For example, neoliberal ideas include the following: that market society is natural and a necessary state of humankind, that humans are consumers, not citizens. So if there are no citizens, of course, there are no human rights and no right to health care. Another neoliberal idea is that the inequality of economic resources is just a natural byproduct of capitalism. And inequality is even good because it motivates progress. Then there's the idea that freedom is a negative idea, a negative state, that it's freedom from. And it rests on the idea that self-governed individuals exercise some kind of rational self-interest by buying healthcare. So, for example, buying insurance, and of course, through markets. And every single problem of healthcare systems has a market solution in our society. Also, another part of neoliberal philosophy is that we need to have a strong state. You might read that as authoritarian, to tamp down the pathologies of democracy. This is a core idea of neoliberalism. So our groups asking for healthcare as a human right are considered aberrations and need to be put down. Next. Our movement's mission is to stop this kind of American exceptionalism in healthcare, join the rest of the world, and achieve the human right to healthcare. And let me just say that the US is exceptional. It's exceptionally bad. It's number one for spending on healthcare. It's about 20% now of our GDP, $4.1 trillion in 2020. But we have the worst outcomes in the entire OECD. That's the organization of so-called advanced capitalist countries. We have the worst outcomes for life expectancy at birth, for infant mortality, for maternal mortality. We have the most suicides. Then there's the personal costs of this. 2/3 of our bankruptcies are related to health costs. There's also the incredible medical debt that people have to live with. And people's lives are in ruins, literally, because of the cost of healthcare and having to make choices that no one should have to make. There's also socially the increased inequality as a result of this privatized system. And as a human rights activist, I really have to say that it's especially horrible that what this does, the denial and the privatization of healthcare, negates the entire right to an adequate standard of living, which is a right separate from the right to healthcare and something that hardly anybody even knows about. And it's actually in the Universal Declaration of Human Rights, which goes back to 1948. The other exceptional thing about the US is the profits for the medical industrial complex. 2022 was the highest in world history. And obviously, this system benefits pharmaceutical, insurance, hospital, nursing home companies, and their billionaire CEOs. Next. So let's talk about how we can bring down this private for-profit health industry by using the human rights framework and particularly focusing on the human right to health care. The human rights framework gives us a tool, a legal tool. It's based on international law, and it allows people to participate and claim their dignity. Human rights are actually internationally, legally recognized and based on specific principles of law, sometimes we call them elements, This is something that applies to every single country. So the US just is one country to which these standards apply. This evidence, though, of violations of these principles can be used to make our demands, and we can use this to hold our political leaders accountable. Human rights are considered to be universal, interdependent, and indivisible. This means that the rights apply to everyone, that the rights themselves are interdependent. They have to be all protected, and they have a bearing. Like, for example, the right to healthcare has a bearing on the right to housing, and the opposite. And they're indivisible, that you can't take parts away of the human rights that exist and consider that that is an acceptable public policy. What we see in the US is the weaponizing of human rights. We see that politicians selectively prefer certain rights. For example, free association. They also misinterpret what a human right is. And there are hierarchies given to rights. Just one relating to healthcare is something that the Supreme Court has done. It's given priority to the religion of corporation owners over women workers' reproductive health care. That's the Hobby Lobby case, and I'm sure some of you know about it. Next. So let's focus in on what these principles are. These are the essential principles of the right to health care. First, universal access to all health goods, facilities, and services. Absolutely everybody in and nobody out. And that means universal, not one state getting health care and the rest of the states not getting health care. It's a national project to have a human right. Secondly, there's a requirement that a state have available health infrastructure and services. I'm sure everybody living through the pandemic understands this one really well now. Another principle is the principle of acceptable and dignified care, equal and non-discriminatory care, the highest attainable quality of both physical and mental health, participation in the decisions about your health. This is as an individual or their social aspects. I'm going to talk about each of these a little bit more. Then there's a requirement to have transparency, and that relates to information for patients, knowledge about the healthcare system, information about physicians. And then finally, of course, every human right requires accountability and requires some kind of mechanism for holding those who have control, political control, economic control, accountable to the people whom they're supposed to serve. Next. I'm not going to go into detail over these international law sources, and this information will be available and is available generally, but I just want to say a little bit about these sources. These are treaties. Some of them are declarations, and they start in 1945 with the UN Charter, which actually had a fair amount of language about the purpose of the international system to uphold human rights and dignity. There is also another early attempt to protect the right to health, and that's in the World Health Organization's constitution in its preamble, which actually is from 1946, and that called for the highest attainable standard of physical and mental health. So that that concept is very old in terms of the development of international law. The main sources which are listed here are the Universal Declaration of Human Rights, Article 25, which protects the right to health and an adequate standard of living, housing, water, and income security. Then the International Covenant on Civil and Political Rights has one article that addresses the right to life, which of course is closely related to the right to health. The main treaties that the US has actually ratified, that one, and the Convention on the Elimination of All Forms of Racial Discrimination, also specifically mention life and health. The elimination of all forms of racial discrimination focuses on health and some other social and economic rights. Then we have the Convention on the Elimination of Forms of Discrimination Against Women, which of course addresses women's particular health needs. The Convention on the Rights of the Child, the Convention on, I should say, the Covenant on Economic, Social, and Cultural Rights reframes what is in the Universal Declaration, but focuses very specifically on healthcare. And then we have some other more recent attempts to protect the right to health in the what's called the Convention on the Rights of Persons with Disabilities, protection of the Migrant Workers Convention, which is doesn't give a real full right to health, only for emergency medical care. And the most recent Universal Declaration on the Rights of Indigenous Peoples, which attempts to address some of the cultural and other factors that are left out of some of the rest of the healthcare treaties and declarations. Next. So let's just focus on universal access, which is one of our core principles in the March for Medicare for All and National Single Payer and other groups. So this is so key, especially given our experience with the pandemic. There's 4 parts to the idea of universal access. The first is the universality principle. So this defines residence broadly. So residence in a country is not like residence in a state. It's much broader concept. And for example, in the US, it would include Puerto Rico, which is basically a colony of the US, but people are residents. They have a legal status in the US. But it also includes people who don't have documents, but who are residing in the US jurisdiction. So this idea means that if we hold the US up to international standards for universality, it's woefully inadequate because it leaves out so many immigrants and migrants who are residents. Another part of this universal access principle is affordability. And that means free at the point of access. There aren't any cost barriers. It means also a system that's financed fairly and efficiently and according to progressive taxation. So a single payer finance system like Medicare would meet that affordability standard as long as all the cost barriers are removed, such as co-pays and all the rest of it, premiums. And then it has to be comprehensive. Universal access means that you get everything, the full suite, as they say, of services, goods, and facilities. So everybody has access instead of what we have now, where you have, some silver, gold, platinum, bronze, whatever, brass, color of metal kind of care. Then it's based on universal access includes equity. And equity is a hard concept in the United States. And I'll talk about that more, and I hope we have more discussion on this. But equity means equal access, but it means according to need. So some people need more. So those services, goods, and facilities would be more used by some people. And that's an equitable principle going way back into English common law. And it's really, it goes along with equality. So if you have an equitable system, it systematically addresses the group disparities that, for example, disparities from the existing racism that we deal with in the United States. Next. Another principle is that of availability. So this means that the state invests in and maintains the necessary infrastructure for the healthcare system, and that the facilities and the services and the providers are located near where people live, and that there's not neglect of people in poorer neighborhoods or rural areas. What a system does that meets the availability standard is to have a mechanism such as an incentive to ensure that health services exist in those areas. Also, another problem that's really severe in the US is the absence of primary care physicians and nurses. Most nurses are migrants because we don't allow enough nurses to be trained. So a single payer system, a system that honors the principle of availability, then invests in training, education, and it regulates so that all of those parts of the system are available. Next. Another principle is one of acceptable and care. And I noticed this came up a lot in the workshop, the slideshows yesterday on racism and healthcare. Care is offered freely. It's in keeping with the dignity of each individual, including elders at the ends of their lives and people with disabilities. No one is treated as subhuman or undeserving. Care is also culturally appropriate. It takes into account the nutritional preferences and needs and healing modalities of diverse populations and indigenous peoples. Care is offered, not forced, and individuals, including incarcerated people, are not subject to experimentation. Next. This gets into the area of, I think relates back to the question of equity, but is a really cornerstone part of a system that meets human rights standards, the principle of equal and non-discriminatory care. And obviously those aren't exactly the same things because you might have non-discrimination, but not equality. So it's much more complicated. But both equal and non-discriminatory health care are measured by access as well as outcomes. So no more of this, equal access business, but the outcomes are totally different. That's not acceptable as a human right. Also, affirmative measures can and should be used to address structural racism and other systemic forms of discrimination. So, basically what is known as affirmative action in the US is something that the international legal system embraces wholeheartedly to address disparities. The other thing that's, I think, useful to know for people in the US is that that international human rights law actually prohibits more kinds of discrimination than US law. It's broader and it has the capacity to be even broader than what we have. It includes political or other opinion. It includes property, birth, social origin, And it has what is really useful, an other status category, so that can protect people in groups who may be excluded under national laws. And it includes possible discrimination that may arise in the future. So it has a lot of potential for citizen action. Next, getting into the principle of highest attainable quality of physical and mental health. This, as I mentioned earlier, is an old standard, international law standard that comes from or was first in the World Health Organization Constitution. It's also mentioned in the Millennium Development Goals, which is an attempt globally to adopt development goals for the entire world. And I bring this up here because the US, as a so-called development country, doesn't meet the Millennium Development Goals, which were intended to apply especially to countries that are poor and don't have the same economic resources. So a state, regardless of its level of economic development, is expected to provide each person with a minimum core of essential services. So we're talking about something that is longstanding here, and that was expected even when these treaties were signed by countries that didn't have a lot of resources. And when they ratified those, they were still committed to doing that. But the US has not caught up with the rest of the world. And it requires that states use their maximum available resources. But the US has not, for example, offered free primary care for everyone, which is a minimum core of essential services and part of the Millennium Development Goals. So that's a problem. It also, this idea of the highest attainable quality of physical and mental health requires investment in education, investment in facilities to meet safety and other standards. It requires adequate payment for healthcare providers and of course, regulation, including of pharmaceuticals. Next. Then there are three other principles that are part of the basic elements of the right to healthcare. One is participation. And this is a civil right. It recognizes an individual's power to make decisions. There's also another part of participation, which is a social right. It's a democratic process that people have a right to make policy decisions about the healthcare system. It should not be the province of corporate boards. The transparency principle also is a civil right. It rests on the idea of free expression, speaking, disseminating, receiving information, and while respecting individual autonomy and privacy. And this, of course, is a social right. When we look at the whole healthcare system, involves the rights to associate and assemble. And finally, the accountability principle, which I mentioned earlier, it's based on civil rights to due process of law and having a meaningful remedy so that when the healthcare system fails individuals, they can sue. They can get some kind of remedy. Next. So I want to talk just briefly about the affordability principle and the weaponization of human rights. I think one of the things that we need to do as, activists using human rights is to beware of how those who do not support human rights weaponize human rights. And I'm just going to use the example of the Patient Protection and Affordable Care Act, because that, of course, as you know, includes the word affordable, which is a part of universal access. So in my view, what happened was that was an attempt to co-opt this principle. It grossly manipulates the idea of affordable. Affordable is in the international legal view is affordable from the standpoint of the individual, not from some corporate enterprise trying to get the maximum amount of profit out of individual payments. Means testing is one of the parts of our system, and means testing means a real problem for human rights because it can never be equal with a means tested system because it ranks people according to their ability to pay. And although some people may consider that wealthy people should pay more, it actually is contrary to the idea of a human right, which rests on the idea that all citizens are equal and you have an equal system. And the problem with this from a human rights standpoint is that you have certain categories of people who are worthy and certain categories of people who are less worthy. So it goes against the idea of having a right that is shared by everyone. There's also the issue of how people are divided and conquered with this kind of notion of means testing. It really does also end up dividing people on by the use of charity. And I just mentioned, there's a couple of things that I think are particularly problematic with the charity part of the affordability. One is, that people are supposed to beg pharmaceutical companies to pay for their drugs or give them some special deal if they can't afford to pay, right? That's the solution. Or let's see, there's also GoFundMe, right? That people are supposed to individually raise money for their healthcare needs. But basically what you're talking about is begging rather than having a right. And this is really important, I think, to understand about human rights in general, that all human rights are based on equity and equality, and all human beings are deserving. So if you start off with a system that doesn't accept those principles and work from those, you end up with, among other things, our healthcare system. Next. Then there are actually principles that are specifically applicable to financing the right to healthcare. So this is, I think, germane to the whole issue of single payer financing, because these can be used, and in some ways they're not maybe totally consonant with modern monetary theory, but they're still things that we can use. So the principles require that the healthcare system be financed adequately, equitably, and sustainably. So it seems to me that the way forward is for us to really think about single payer financing in relation to the problem of privatization, which further commodifies our healthcare. The idea that funding for health is a public good and should not be for profit, that we need to have a financing system that provides equity for the most vulnerable, the most people who have the greatest need, not the opposite, which is what we've got. That we need to have a healthcare system that reduces income and wealth inequality, not increases it, which is what we have. And then there's an internationalist principle here, which actually is related to the US commitment and other countries' commitment in the UN Charter. And that is a duty to cooperate with other countries to address global health problems, including the COVID pandemic. And this is this duty to cooperate is something that needs to be incorporated into the healthcare system and the financing. And obviously, this relates very closely to climate disruption, climate crisis. Next. So looking at adequacy of financing, again, the U.S. is required to commit the maximum available resources to fund the right to health care. So everybody knows, I think, that we spend the most of any country, but we have misallocation and underfunding, even though we spend a lot of money, 4.1 trillion, I believe, in the last year. For example, budgets misallocate funding in order to guarantee private profits, not healthcare, such as to Part C Medicare Advantage. I like to call it disadvantage, not Part B Medicare, improving Part B Medicare. There's also underfunding, which reinforces social inequality. For example, the Indian Health Service infrastructure is neglected. It gets lower per capita funding and less secure funding than either Medicare or Medicaid. Of course, the adequacy issue is completely absent from the area of women's reproductive health care, and it's pretty much ignored as far as parity for mental health care. And as I said before, immigrants are grossly underserved and excluded from health care. So it's not adequate in some ways, even though lots of money is spent. Next. Equitable financing. Again, it's related to some of the funding sources. So, for example, we have funding from general taxes relying on income tax and Social Security tax. And income tax is more progressive than Social Security tax, which taxes people on the first dollar they earn. So you can see the kind of burden that exists. There's also, of course, the absence of taxes from capital sources. And then there was the corporate tax reduction by act of Congress in 2017 that reduced the corporate tax rate from 35 to 21%. So that shifts the burden onto the taxes from these other sources, which of course affect your ordinary working people. And then, of course, the most horrible thing of all, which we know so well, is the reliance on user fees, what they call user fees. That also is a total neoliberal concept, that because it doesn't want to recognize common goods, right? You have user fees, and it doesn't matter what happens to users who don't have a lot of wealth, right? But we have, premiums, deductibles, co-payments, and I'll just specifically mention the burden on the individuals in the, lowest 3 income quintiles. And people are just so hard hit by the user fees. And I can speak for myself as a Medicare person too. Anyway, okay, next, the other principle is sustainable financing. So this is a question of what it would look like, really, because we don't have it. What would sustainable financing look like? And first of all, this gets also back to some of the foolish experiments with trying to get state-based health care, and that is that only the federal government has the ability to fund for the long term for everyone, and to have a secure form of funding for every single person in the jurisdiction. Also, there needs to be priority, of course, of healthcare financing. So that is a political issue, and it needs to be nationally secure so that it doesn't get cut back. And we see that some of those issues cropping up elsewhere in the world, and as where you don't have good law and strong, strong movements to defend healthcare, you end up with these kinds of problems. But I do think that if you have a real commitment, a priority for healthcare as a human right in your legal, in your law, that you're going to be in a better place. Obviously, single payer financing is the most sustainable because you get a unified system, you get economies of scale, you get removal of profits, or we need removal of profits and the profit incentives, which would reduce costs clearly, and reverse the commodification of health. I have to say again that profit based on the denial of care is just totally the opposite of the human right to health. So, and the impact of having sustainable financing, a national single payer system, it would remove healthcare costs, the burden of those, and it could have such profound impact on especially people of lower incomes, but it would also benefit everyone. It would increase the standard of living. It would reduce the wealth and income disparities. It would reduce racial and gender inequality. It would reduce morbidity and mortality. It really could have a profound impact on our society. Next. Done.
All right. Hey, I do want to ask, we're starting to get some great questions here. I want to encourage everybody to put their questions in the chat box if they're wanting to ask the panelists any questions. Before we move to Mary's presentation, there was a clarifying question that I thought it would be valuable to get out of the way here, Martha.
Sure.
Can you just, for a lot of viewers, they probably do already know the answer to this, but can you just give a brief definition of means testing for those who might not understand what that means?
Yes. So a means testing, an example is Medicaid, and which of course pre-existed the Patient Protection and Affordable Care Act, so-called. But you have to under the new provision at 200% of the poverty line allows you to get subsidies. So it basically you have to prove what your income is, in order to get benefits. And then the other corollary of that, of course, is if your income goes up a little bit, you get cut off.
Yeah.
Mm-hmm.
And so what you have is a bunch, and this is our whole society, whether it's health, healthcare is intricately connected to all kinds of welfare used in a broad term. And so if people do a little better, they basically start losing things that allowed them to do a little better. So that's what means testing is. It's just poisonous to having a society based on rights.
Yeah. I mean, imagine a system where you make an extra few $1,000s a year and you end up worse off for making a few extra $1,000s a year. It's really insane. I mean, the idea is
and the dignity issue too of having to report, because now in many states, it's like they've got people corralled into reporting monthly. Now, so many people have irregular income from month to month, and doing that that's just like horrifying and actually makes people in a permanent state of anxiety. And then if you earn a little bit more and then you don't get health care, and something else goes wrong. So that's what I mean about lives in ruins, because that's the reality for a whole lot of people in the U.S. of the way the healthcare system works.
Yeah, I appreciate the clarification there. And we're going to move on here to Mary's presentation. She's going to talk a bit about, you said you wanted to kind of drive home the concept of equity. Mary is going to go into some of that stuff, how healthcare is a right and how it's in the interest of the public good. If we can go ahead and get Mary's slides up on the screen and begin her presentation.
Hi, thanks everybody. So even the last 2 years during a pandemic, the only way people could get health care here in the United States is if they had money. And so next we're going to see, we're going to talk more about that and whether healthcare is really a right or not. I know you're all saying, well, of course healthcare is a right. We know that. So I'd like to tell you a little story about when we were in Geneva for the hearings on the International Covenant on Civil and Political Rights. And we were giving a presentation and talking about healthcare and how it impacts marginalized peoples more. And one of our own advocates from this country, who is really a wonderful human rights advocate, said to me, or said to the group, oh, well, the Affordable Care Act has improved people's rights. And somebody else said, yeah. And I said, wait, are we talking about health care or are we talking about health insurance? Because the Affordable Care Act is all about health insurance. We have been so brainwashed in this country that as soon as somebody says health care, there's this little equal sign in our brain that talks about insurance. And so we really need to get rid of that because healthcare is an actual right, as Marty has pointed out. And in fact, historically, the Declaration of Human Rights actually arose from a second Bill of Rights that Roosevelt was working on before he passed away. And his widow, Eleanor, is the one that brought it to the UN. So this was originally this was a US idea. If we want to talk about US exceptionalism, it makes it even more absurd that we don't honor it. The other thing is that the International Covenant on Civil and Political Rights that Marty was talking about, and she mentioned it's a treaty. Now, you may all know this, but before I started doing work internationally, I did not. When we say treaty, we're not talking about, it's not like a derivation of it's an actual treaty. Our government voted yes and then ratified it. And it is a treaty the same as the one that stopped our war with Japan. What would happen if somebody violated the treaties that stopped the wars? There would be public outcry all over the place. Well, this is a treaty. So we need to name healthcare as a right and inform each other about it. And if you're human, you have the right. That's all. There's no other qualifications, nothing economic, nothing ethnic. You have that right. And if we don't keep convincing each other and our friends that it is an actual right, just like anything in the Bill of Rights, okay, then we're not going to be able to claim it that way. We're going to keep talking about insurance programs and, cheaper insurance and cheaper copay. That's not healthcare. So let's take a closer look at this as we move on. So our government has an obligation, as we know, to protect and fulfill our rights and needs. And lately, well, not just lately, for many decades, we've had the pull yourselves up by the bootstraps mentality, right? That's not going to work for someone who doesn't wear boots. And there are a lot of people in this country that are in that situation. So it's ironic too, because again, at one of the last Geneva things, we had a healthcare panel and we had all the people from the Secretary of State, and even a couple of people from the Pentagon. They were high level because that president was cooperating with the UN. And they were talking about healthcare, and all they talked about was the Affordable Care Act. And so several of us said, wait, and they called these healthcare measures that the US has taken. They did that intentionally because they know if they called it a right, we would know they were violating our rights. So they called it a measure, right? Oh, yes, healthcare measures are increasing in the US. And the international community is like, oh, really? And those of us from the US are going, excuse me, why are you using the word measure? Healthcare is a right. And this Insurance Act has nothing to do with our right to health care, not health insurance. And so that they, of course, wouldn't answer the question, but it did make the point to everyone who was in the audience. So healthcare is a right, so therefore it's a public good. And it's not happening because we still perceive ourselves as consumers instead of rights holders. And that's why you're going to hear me talk endlessly about naming it as a human right and claiming it as a human right. And I know it sounds like, oh, yeah, we know Mary. But talk to some of your friends. Talk to some of your associates. Just find out whether the Affordable Care Act or anything like that comes into play, because then you're not talking about healthcare and the right to healthcare. So let's move on. And so we talked a little bit about this, but if healthcare is a right, then it needs to be considered a public good. And the government needs to provide the resources to prioritize that, not waste them or distribute them inequitably. And privatization, which is what the pharmacies, medical equipment suppliers, and insurance companies have done to health care, to turn it around from a care system to an insurance system or a profit system, profiting on our suffering, is not the way we finance rights and public goods. So we'll move on. And this is self-explanatory. Even if you are on Medicare, there are things that aren't covered. Even if you have the best insurance, there are things that aren't covered. And I know this isn't storytelling time, but someone I know from Vermont, when I was writing an article that did tell stories, and I'll give you the brief version, his wife had terminal cancer, and it was an unusual kind. And if the insurance company, and they had the best insurance coverage available, okay, if the insurance company would pay for this particular medication that's very not often used because it's rare, then she might be able to live. Well, their doctor and their hospitals went to bed immediately, bombarding the insurance company with letters saying this is necessary for her life. It was deny. You know, insurance companies, you have to get to the very top. You have to go through all these denials before you get someone who will actually even consider it. Well, what happened was that about 3 days after she died, on his front porch was a package of the medicine that had finally been approved. That is not health care as a right. So let's move on and talk about how we might be able to treat it. Yeah, I'm sure most of you have seen this portrayal of equity and equality before. And equality, by the way, in terms of international law, is a lot different than what we view a lot of kinds of equality as Marty already pointed out. So if we give everybody the same box to see over the fence, the bigger people can see, the little one can't see anything. If we give everybody a box that will raise them tall enough to see over the fence, then that's great. That accomplishes our goal. In reality, what we have is we have an actual chasm between people who can afford healthcare and people who can't get or die from lack of healthcare or pharmaceuticals or medical goods. That's why we need to keep calling it a right, and we need to keep talking about equity. And if we move on, we can see that there isn't a healthcare system in the United States. We don't have one, period. End of story. We need to establish one because insurance is not equitable and it's not a public good, and it only creates profit. So moving along, we're looking here at a bunch of different public goods. Okay, we got ambulances, fire trucks, school buses, and education, food stamp programs. So let's just think about this. Streetlights, another one. So if I call an ambulance because I'm having a heart attack, and they said, let me check and see if your insurance is paid first. And then I died waiting for them to get here. That's not healthcare, but that's essentially what we have when we don't treat it as a public good. Same thing with the fire department. Are they going to not put out my fire because I can't pay them or I don't pay real estate taxes? No, of course not. It's funded from public funds as a public good. Education. Are they going to tell me I can't go to school? You can't go to school because your parents aren't working right now? No, they're not allowed to. Food stamps. And I know because there's been a lot of litigation on food stamps and certain states not letting people have them, which is clearly a violation of those persons' rights. And that has been upheld. And so obviously that comes as a public good. So when we're thinking about public goods, let's move on. And again, go back, and I'm sorry, I know I already said this, but again, go back to health insurance not being health care, because the latter of those, health care, is a public good. So what we have right now is a system where you pay monthly premiums to a for-profit company. Even if you're on Medicare like I am and have a supplement, you still pay monthly premiums to a for-profit company. You also pay at the point of service. There's a copay. It's like I called my doctor's office once and I said, I know I have an ear infection. They said, all right, the copay is $45. And I said, well, it's the end of the month. I don't get my Social Security till the 3rd. They said, then go to the emergency room. Do you know how much that cost? So I'm just saying that is not a public good. And annual deductibles, we all know, $10,000 isn't probably the maximum. I think there's some people have $15,000 and $20,000 maximums on their deductibles. So let's go ahead and think about the people that don't have any insurance because they can't afford all those things we just talked about. So, and these are probably conservative estimates because these are taken from mostly pre-COVID, or at least a little ways into COVID, where 30 million people had no insurance and 71 million people are underinsured. So these are the people like the friend I just described who lost his wife, who paid the insurance premiums, paid the deductibles, and still couldn't get the care she needed because there was no equity in the system. That care wasn't an approved drug by the insurance companies. And 2, it wasn't a public good. So we need to get rid of all of this and go with public good. So moving on, we don't have any cost controls on those insurance companies. We really need to get rid of them entirely. The premiums go up every single year. Do you really think it's because healthcare costs are going up? Well, yes, They probably are, because there's no control on the pharmaceutical industry. People pay more now for insulin than they did years ago, based on the same level of income that was appropriate at the time. Why is that? Insulin is a drug that has been around forever, and yet it's gotten more and more expensive. Why? Because more and more people need it, and the pharmaceutical companies can make more and more money. So, hey, why not? So, and then when we have insurance, people that go to work take home less money out of their paychecks because the employers deduct their payments. Okay. So even with a good job, depending on what insurance company your employer has, you're losing money, and then you got all the other stuff to pay. There are a lot of people who choose between healthcare and rent and food. And the people that suffer the most are those who are marginalized for any number of reasons. And moving forward, what we need to do is we need to remember that healthcare has to be accessible, as in free, at the point of care for everyone. And this includes all healthcare. I'm not just talking about the things that insurance companies cover. Preventative care, yes. Care for any medical condition, including mental health. Equity isn't about, I get the same as you get, as we saw on the earlier slide. It's about, I get what I need to live a dignified life and a healthy life. And that's not going to be the same as what Marty needs or what Luke needs. We all have individual needs, and equity has to take that into account, including long-term care and including the ability to stay well so that you can buy food and pay rent and continue to be well. And that's also called living a life of dignity, which is really what human rights is all about. So let's move forward and talk about some populations that can't freely access health care. African Americans, Indigenous peoples, my peoples. We've seen terrible stuff on the reservations, particularly during the pandemic, but always. Differently abled people. They can't, so many folks can't even, our systems are so difficult to navigate on the internet or on the telephone or wherever, that even if you could afford it and you're differently abled, it's going to be difficult. Say you're supposed to use a computer to sign up for your insurance. What if you don't have one? Or what if you can't see one? Or what if your fingers can't type on one? It's crazy. LGBTQA plus folks. Nope. I'm sorry. No hormone therapy for you. I'm sorry. And if we had equity, that would be someone's individual need. And equity in our health care system would make sure that everybody got what they needed. Women, particularly reproductive rights, one way or the other, whether they don't want to have the baby because they can't care for it or because of a health condition, or whether they do want to have a baby, but they've been involuntarily sterilized because of their differing ability or their ethnicity. So either way, it's got to stop. Immigrants, they can't get anything because they'll be reported and they'll be shipped out of the country and they'll lose their job and probably their families. And any kind of economically disadvantaged worker or non-worker experiences these same problems. So let's move on and think about how the pandemic has highlighted this problem. Racial inequities, if you look at the figures for the people that are getting sick and dying, Black and African American people, Indigenous people, other peoples of colors experience this much more severely than the general population. And economic inequities are evident because those who have a high income, if you look at the figures, aren't dying or getting sick as much at the same rate as those who are poor. And so, and immigrants, of course, suffering at a higher rate than non-immigrants. So that's something in the last 2 years during this pandemic that should highlight on the next slide why we need to use the right for healthcare. It needs to be a public good. It needs to be equitable, so everybody gets what they need. If we don't say this is a right, just like our right to vote, and I know a lot of rights are in question right now, but I'm just saying, it certainly can't hurt if we use the word right with each other, with our friends, when we're speaking, and demand that because it's a right, it has to be a public good and it has to be administered with equity. And Marty's next presentation is going to be how we can let the world know that our right to healthcare in the US doesn't exist. And we can help to claim that. Thank you.
Thank you so much, Mary. And just before we get to Marty's second presentation here, I just wanted to underscore a couple of points. First of all, you made the bootstrap point. We had a panel yesterday about how the profit incentive is really what creates a perverse incentive for the healthcare system to start with. And I just want to make sure the audience understands. The bootstrap thing was originally a literal joke, right? You can't imagine you're laying on the floor trying to pull yourself up by your bootstraps. I mean, it was literally a joke, and then it became all of, the rhetoric on the libertarian sort of side of things. And I also just wanted to share a very quick anecdote. I shared this on Friday at one of the panels, but I think some people don't understand the reverberating effects of Medicare for All in a way that they should. I had the privilege of hearing from somebody who's involved with the union in Las Vegas that covers a lot of the hotel and restaurant workers and things on the Strip. And they expressed to me how much of their resources went to negotiating a decent healthcare system. And how, if those resources were able to be placed on, we could be getting you better compensation, better workplace treatment, more time off, things like that. And I just want to underscore for the audience some of the reverberating effects for working class people that would come from a Medicare for All system. So with that, we'll go ahead and move on to Marty's second presentation here. She's going to detail the complaint to the UN and other things as well. If we can go ahead and throw that second show up on the screen there.
Yeah, and I just want to echo what you just said about negotiating union contracts, having been involved in that, where you spend all your time trying to get better health care and the wages never go up because the employer is always paying more and more for health care. So that would be, that's a good reason why we need health care as a human right in a national system.
Yeah,
so
absolutely.
What we're going to do is what we're doing now, the March for Medicare for All, and hopefully allies, is to take the human rights approach and use it. We're going to file a complaint with the UN Human Rights Council on the right to health care. So this is a little guide that I've developed, and actually I have a few updates to some of these points. So next. So first, what the heck is this? What is this human rights complaint to the UN, and who can file it, and how is it done? So the UN, the United Nations, has a number of parts, agencies, and associated components. But this is going to be about one of those parts of the UN system. So an individual or a group or a non-governmental organization or some combination of these can file a human rights complaint. So as you see, that's fairly broad. It can be filed against any member state of the United Nations, which the US is one of. And as you know, it's a permanent member of the Security Council. The U.S. was a founding member of the UN. And this complaint will be filed with the UN Human Rights Council. So that's the sub organization of the United Nations system that we're talking about. This is what we have to do. We have to show that there's a consistent pattern of gross human rights violations in order to file a complaint. So what this means is somewhat technical, but I think applicable to the right to health care. First of all, the gross violations of human rights require a severity of offenses. So severity could include loss of life, disabling illnesses, shorter lifespan, failure to provide care. All of these are severe. There's also a need to show there's a pattern of violations which are inhuman or degrading. So unpacking that, we sure have a pattern here, don't we? Don't we have a pattern? I mean, the pandemic has certainly shown that. The highest, almost 1 million people dead, the highest percentage of any country in the world because we don't have a decent healthcare system. So we have a pattern. And is it inhuman or degrading to not be able to have health care, to lose your life, to be permanently harmed because you couldn't get care in time? Yes, I think it is. And then there's the question of the violations being repeated. Well, yes, they're repeated and repeated. The right to healthcare, we've been trying to claim this for some time, and we're still, asking for healthcare. So the rights are, it has to be human rights. Well, there's a lot of human rights that are, described in these treaties and declarations, and they surely include the rights to health and the right to life. But they also include the right to be free from discrimination. And so that goes along with this healthcare system. So many of the examples we have, especially during the pandemic, are related to discrimination and unequal ability to get care and to be healthy. So next. So a little bit about the UN system and how this all fits together, so you just have a general perspective on this. So the council, the UN Human Rights Council, a part of the UN, is an intergovernmental organization, and was created in 1945. And as I said, the U.S. is the party to this charter. This is a treaty that the Senate ratified, and we have these component parts of the United Nations system, and one of those is called the Economic and Social Council, and that's a part of the General Assembly of the UN, which you could think of it kind of like it's not a parallel to Congress, but it's a legislative branch. To the extent that there's several legislative branches, but it's a legislative entity. And so that Economic and Social Council created earlier a Human Rights Commission, and now it's called the Human Rights Council, but that is an arm of this part of what's called ECOSOC, Economic and Social Council. And so you can see there's a little bureaucracy here, but bear with it. It's not too elaborate. And so the membership of the Human Rights Council is elected. It's elected by the whole General Assembly. So that's all the members of the United Nations, which I think are 198 countries. and maybe a couple of observer states. So the membership now of the Human Rights Council is 48 countries. And the United States is now part of the Human Rights Council, by the way. The headquarters of the UNHRC is in Geneva, in Switzerland. So Mary was talking about the various meetings that she's been part of civil society groups, NGO groups from the US, going to Geneva to monitor these meetings and hearings of the UNHRC. So it has, besides these periodic reviews, which Mary and I worked on the last one for the Universal Periodic Review, which was in 2020, and we worked on the issue of the financing of healthcare. There's also this special complaint process for complaints of gross violations of human rights. And I've just mentioned that there was a human rights complaint filed in the early 50s by, and it was called We Charge Genocide. There was a petition. African Americans brought the killings of Black people in the US to the attention of the United Nations. And it didn't end up in any kind of successful response from the UN. And we can talk about that. But I think it was a really important historical development. And it gives us a little bit of historical perspective on the use by people in the US of this procedure, even though it hasn't been invoked by a US group since then. Next. So I'm just going to go through the mechanics of this so you understand what the process is. And, I think we can talk about what does it actually mean and how do you build a campaign around doing something like this? Because it is very specific and it's not necessarily everything that we want, to do in our movement, but it offers us a pathway to trying to hold the US accountable. And that's what this is all about, is using the human rights violations to try to hold the US accountable. So the first phase is the initial screening. So after the complaint is filed, it's reviewed by the secretariat. That's the staff of the Human Rights Council. And they have a working group on communications. So I guess that's called that because basically it's a communication from somebody to the Human Rights Council about gross violations of human rights. So it goes there first. And the chairperson of the communications group and the staff do this screening, and they look to see if the complaint is admissible. So it has to be admitted by them. So these are the criteria that they have for admissibility. And some of these are, people might find them humorous, but I just put them all down. It must be in writing. It has to be in an official UN language. There's 5 official languages, and one of them is English. It has to describe relevant facts. So, we're seeking stories, as we'll discuss further. It can't be more than 15 pages. So to me, as a lawyer, that means lots of footnotes and links. It can't be politically motivated. I interpret that to mean partisan, not because everything has a political dimension like this. So it's not, it can't be designed to get rid of your political enemies or whatever. It can't be based solely on mass media reports. So that suggests that you can have obviously research, scholarly research, economic research, health policy research, but like a bunch of news articles, for example, would not do it. So I think that's what we're talking about here. It can't be a matter addressed in separate proceedings of the United Nations or of a human rights intergovernmental organization. So that is really designed to keep people from filing, or organizations filing with a lot of different organizations. Like there's also an Inter-American Commission and Court of Human Rights. So somebody might file something there and with the UN. So they don't want to be one of many, you just have to go to them. Obviously this is, you're not supposed to use insulting or abusive language. That's why I say some of this is humorous, you can't ask for individual remedies or compensation. So you're not asking for damages. What you're asking for is basically a remedy to fix the system. We're asking for systemic change. And the question of what we ask for is also something we should talk about. But I'll just mention that in our periodic review report, shadow report that we filed, the 4 organizations, Mary's 2 that Mary's connected to and 2 that I'm connected to for the 2020 review, we asked for a national publicly financed dialogue on single payer financing and universal health care, as well as their recommendation that the US adopt such a system. And that's not so crazy at all, because the UN Secretary General Ban Ki-moon back in 2016, I think, actually advised the US to adopt a single payer system. Mm-hmm. Anyway, so I don't really, but we will be figuring out what we're going to ask for in terms of a remedy. And of course, they would be looking at trying to convince the U.S. government to do what it's supposed to do. One other thing that is important to mention is we have to show that domestic remedies have to be exhausted. So that's it, or they're ineffective or unreasonably prolonged is the language. Well, what they see as exhaustion, in some countries they have human rights courts or constitutional courts that actually adjudicate human rights issues. Yeah. I realize this is very strange for a U.S. audience to hear, but that is in fact one of the situations that might exist in some other places. Also, a human rights institution, and I'll just mention that at this last review of the United States, when the Biden administration came back in the final response to us and the recommendations, they said they were never, or they didn't say never, but they said they were not planning and not going to establish any kind of human rights institution. So they made that really clear, and we'll be using that against them. Let's see. Then if these criteria are met and the complaint is admitted, it's sent to the U.S. government for its response. So that's the next step. Next. So then at phase 2, the complaint goes to, in the communications group, there's 5 members. And in 2022, the membership of this group is Spain, Russian Federation, China, Egypt, and Peru. And the president, or the coordinator for the group is the person from Spain. And there's 2 meetings this year. The 29th session, which actually got postponed, it's going to be in April. And then the other one got postponed. The 30th session is now going to be in October. So what we're trying to do is get our complaint filed by July so that we can be timely enough to be considered for the 30th session. The communication group reviews the complaint for its admissibility and for its merits. And so it has, and I'll talk about the merits, and then it can dismiss the complaint, keep it, or ask for more information, or send it to the next working group, which is called the Working Group on Situations. So the merits now are, this is when it gets really into the details. And the merits threshold is whether the complaint by itself or in combination with other complaints appears to reveal consistent pattern of gross and reliably attested violations of human rights and fundamental freedoms. So as I see that, you could even have multiple filings because they would look if the complaints are germane, if they're related to each other, they will be looking at them together, for example. But they will be looking at the consistent pattern of gross violations, and they're going to be wanting to make sure that the evidence shows that is when they say reliably attested, they want evidence. So that's the issue with that phase. Next. So the situations working group, so this is like looking into, beyond 2022, obviously, because by the time you get to this procedure, it's late in the year, maybe probably 2023, but each year you have a different composition of these committees drawn from the Human Rights Council, and the work situations group is elected from different regions. So the regions that there are only 2 members right now. I think that the other, let's see, there's one is from Belgium, and the other is from Indonesia. And then, so there's 3 other members to be designated. So who knows what the group will be for 2023, but in any event, that it's not really going to be related to getting the complaint to the first, at the first level, which I think should be our focus here, is the communications working group. But just so that people understand what the process is, then this group, situations committee working group, does a report. They do a report and make recommendations to the full council. So they can either, suggest discontinuing the process, keeping it under review, getting more information, or sending it to the full Human Rights Council. So ideally, I think we'd like to keep this thing going, and have the full Human Rights Council. But practically, there are some issues because of U.S. imperialism and the economic power it has. The question of, how much we're actually going to get out of this is an open question. So happy to discuss that. But anyway, I think that, and again, the composition of these working groups, is interesting. I think the fact that Russia and China are on the committee is, it's probably bad timing given the war situation. But on the other hand, a lot of countries are afraid to criticize the U.S. You can see that in the periodic review process by some of the recommendations. So I think that, we want some people who are actually going to look at what we have to say. And we are so counter to the international trend that there's hope that other countries will say, hey, you just need to, this is not okay. So next slide. So if it went to the full Human Rights Council, they do have this confidential process. So they can either, and again, they can discontinue it, keep it under review, get more information, the same old. Appoint an independent expert to monitor and report back. That's kind of interesting because that's often done for situations that really require some additional information, or maybe because they're really controversial too. They can also make it, make the complaint public, make it and the report public. And then I think this number 5 is actually rather amusing when I think about how the U.S. wields power in the United Nations. They can recommend that the Office of the High Commissioner for Human Rights provide the U.S. with technical cooperation, capacity building, or advisory services. I'm not sure what that would look like, because it seems like it's not really technical cooperation we need. Capacity building, maybe, and maybe advice, but it's kind of interesting, and in some ways reflects the the way the UN is used in some ways to shape the behavior of smaller, less powerful countries and not the powerful ones. But nonetheless, this is what's available to us. So this is what we intend to try and see what we can get. Thank you.
Yeah, absolutely. So we're going to start the Q&A session here, but I actually wanted to just kick it off with a question of my own, just for the audience's sake. If either of you can go ahead and take this question, I totally understand why the verbiage is important as we discuss these things, to use the word right. I'm curious if one of you can explain, though, like what right really actually from a legal framework means. It's a little bit different than, I like the takeout place up the street. I don't have a right to the takeout food at the place up the street. Can you just explain what a right really means in a fundamental sense?
Sure, I'll go for it, and Marty can add to it because I know she has a lot of background on this issue. But so a right is something that our government has an obligation to, this is legally, to honor for each person that has that right. And so when we're talking about the right to health and human rights, we're talking about every human being. So it's something that the government literally is required to honor and not interfere with, is the best summary. Marty probably has some more technical details she can add.
Yeah, under international human rights law, that it's kind of broken into 3 components. Each right, there's a right to respect it, a right to protect it, and a right to fulfill it. So there's kind of different gradations of accountability on the part of the state. Obviously, if you have a right, you have a remedy. So that means you can sue the government if it denies your right. Like now, if we tried to, that's why one reason why, we could say we can't we can't exhaust any domestic remedies because we don't have any right? What are we going to do? Go file a lawsuit? Actually, you'd be, if you were a lawyer, might be disciplined for filing a frivolous claim. So it's, there's a lot of, there are arguable ways to raise it in U.S. courts, but not in a broad way like this, because it's a systemic problem. But so anyway, you do have a remedy. A remedy means you can get, some kind of legal relief. For example, if if like just denial of care, say, you didn't have access to hospital. I mean, that person could file a lawsuit if you had a right, and for whatever damages, happened to them or their family if the person died, if you had a right to health care and you were denied access.
But I also think there's an important concept involved because so it's not just the legal remedies that are available, but when we are, for example, dealing with elections, if we can convince our electeds to talk about healthcare as a right instead of insurance, there's something in our minds that makes it more powerful. So I just wanted to throw that in.
Yeah, and actually, if you guys could just elaborate very quickly on why that rhetorical tool. I don't mean that to be demeaning at all. It's very important that we use the right language as we discuss these kind of things, right? I talk a lot about modern monetary theory, and one of our big things is using the right language about federal financing,
Right.
that this is about resources and not actually about the money.
Right.
So along those lines, can you talk about how important it is in terms of convincing the public of our position to use the right language?
I think it's crucial because when we're talking about or equating health insurance with health care in our own minds and in other people's minds, all that's really coming up is cost aspects, okay? They're not thinking about the quality of life issues. They're not thinking about human dignity. They're not thinking, whereas if they're calling it a right, that brings with it, in our country particularly, a certain concept. People are always, it's my right to do this and to do that, and whether or not I agree with them, if it's their right, it's their right, And so I think that gets us past some of the divide in terms of, we're not talking about the Affordable Care Act and whether to expand it. We're talking about treating healthcare as a right. I don't know if that's what you were asking for, but
what I would like to say is the reason I have laid out the principles that undergird the right to health care is exactly this question, because a right, the U.S. uses rights all the time, human rights. It weaponizes it. It's all about every other country except the United States, right?
Yep.
And
Yep.
Right, wrong. But the reason we bring out these specific principles that make up the legal standard, universal access, acceptable and dignified care, and so forth, the ones that I've laid out in my slides, is that those are the standards, not what the U.S. says, not what governmental spokespeople say or some misinformed person. So what is really important for people to actually take those elements and figure out how to use them in the work they're doing, and frame the work they're doing in terms of whether whatever is happening meets all of those standards, not one, because you're just going to pick one little thing. Like now with ACO REACH, the latest scheme to deprive seniors of Medicare, they use equity. They've got, they love using equity and misusing equity it's going to be about denying care. And anyway, so what we have to do, and we have to be really savvy about those principles. We have to call them out when they use equity and they don't mean equity. They're just lying, and we have to show how they're misrepresented. Same thing with universal, and same thing, as I said, I tried to unpack a little the whole issue of affordable. What affordable means. It's affordable from the point of view of the individual, not this language that they used in the Patient Protection and Affordable Care Act. No, that's not affordable. Affordable means that you can enjoy your other rights. You don't have to give up your right to housing in order to have health care, or your right to an adequate standard of living. You never have to give up another human right to have your right to health care. That's a cornerstone of human rights analysis and just the foundation of the legal project.
Absolutely, yeah. And I'm reminded of an anecdote that Bernie said when he was confronted with the term access to healthcare, and he said, "Well, I have access to a private jet. Is there any guesses why I don't have one?" And I think that's a kind of a good way to put it. So I'm going to read a couple of questions here. I apologize for looking down, but I'm going to read these off my phone here. The first one is from Jonathan Cadman, who's one of our fantastic writers at Real Progressives. Just a quick shameless plug for those in the audience. Go to realprogressives.org if you want to read our fantastic content. Jonathan asks, with the fundamental governing principle of the UN and international law being the inalienability of sovereignty, how can any government be held accountable for their commitment to these rights or even for taking them seriously? If either of you wants to go ahead and dive in on that.
Yes, well, that is a challenge. That is the UN system. It's an agglomeration of states, and the US, has pretty much been the most dominant state for a long time, but it still gives, what we're dealing with is the court of public opinion. We're dealing with trying to use this in our domestic work. And so that's another thing that I should stress, that we use this in the US because the parts of the US system who don't want to fulfill our human right to health care have evaded any kind of accountability. And we use this in all ways at the local level, throughout the US and in an international forum to try to embarrass, shame, whatever we can get by showing that the US is totally inconsistent and just lying, So,
And the other thing is that when each of these sovereign nations joins the UN and enters into and signs on a declaration or whatever, they have, to a certain and limited extent, given up their right to say, I'm a sovereign nation, you can't say anything to me, by entering in to the UN process. So they, in other words, have to listen. Doesn't mean they have to do it, although there are remedies that for people getting censored and stuff like that. But yeah.
I see. Next question here. This is from Dan Gallagher, who was one of the organizers that put all this together. Huge thanks to Dan. He says, without strong advocates, family paid caretaker in our current for-profit healthcare system, patients' needs in many cases are either ignored or denied. Do you believe national improved Medicare for all would lessen the need for a patient advocate?
Oh, I definitely do. As I was saying, I think a lot of the problem. All right, so going back a while back, when a woman has a baby and the insurance company tells her that his expenses in the hospital aren't covered because he's not listed on her policy, even though they paid for maternity care, like that happens. So that's just sort of a crazy situation. And it's definitely something that this applies to. Marty, I'll let you go ahead too.
Well, yeah, this whole question, I think, of how the system actually functions. And I would just add, that even now, even if you have an advocate, I'm not so sure that advocacy always works either. I've had my own experiences with my father, end of life care, not being in pain because of the unwillingness to prescribe drugs to a person who's dying, and having to advocate and feeling totally ineffective about that, because although I did it repeatedly, each time it was new, right? The cycle was not, because of the system was not recognizing the dignity of the person who chose, who would, are the family, really not recognizing the need to give comfort and ease pain. And although that might not be the best example, I think that the problem is really the profit motive in a lot of this, because the needs of the patients, which have to be advocated by the advocate, are often not what the profit-driven system wants to do. And so if you remove the profit incentive and profits, you can have at least a much better system. And I certainly saw that. I was in Cuba in November on a health delegation and saw the Cuban healthcare system. And I didn't hear any discussion, which is, a very fine system that really does meet human rights criteria in all ways. And I did not hear of any particular institutionalized advocacy system. My impression was that the system was built into the way the system functioned. But anyway, I do think that it has to do with the profit making.
Absolutely.
deviation.
Absolutely. And one thing that gets left out of Cuba is they pump out more doctors per capita than any other country in the world, by my knowledge. And a lot of those doctors end up in Doctors Without Borders and programs like these that actually help nations that might not otherwise have access to certain care. We have a question here from Stephen Katz asking, which instruments of international law has the U.S. agreed to that speak to the human right to healthcare, if any, I suppose?
Yes. So the Universal Declaration, the U.S. supported, and that's considered customary international law, even though it's not a treaty. But that includes the right to medical care in Article 25. And then the U.S. has signed the Covenant on Economic, Social, and Cultural Rights, which in Article 12 has the right to health care, but it has never ratified that treaty. However, the UN reviews the U.S. on the right to health care and health every single periodic review. And the U.S. responds with, to the recommendations, as it did this last time, by saying it didn't have to progressively realize the right to health care yet in the United States, that it doesn't need universal access yet. Let's see, that came into effect in 1967. So how many years is it since? Anyway, it's just absurd that we don't have, there hasn't been enough time elapsed for the U.S. to be held responsible. So the other treaty, International Covenant on Civil and Political Rights, has a right to life and right to non-discrimination. Those are also applicable to healthcare. The U.S. has ratified those, although with reservations, and it always reserves. One thing I should tell you about how the U.S. deals with treaties is it always claims that it doesn't have to do anything in addition to whatever exists, that it doesn't have to change anything. So it won't ratify a treaty unless the existing domestic law already requires it to do that, which might be why the U.S. is the only country in the world that hasn't ratified the Convention on the Rights of the Child, which also has the right to health care. But those are
They'll sign them, but not ratify them, right, Marty?
Yeah, well, some of them they haven't even signed. And then, the Senate actually rejected ratification of the Convention on the Rights of People, persons with disabilities, and that's more recent. But this is another whole area of work, but I could go into it more because I've been involved with the Children's Rights Convention and getting a resolution in Washington State, but it's very difficult. So I think we just bypass the bypass the treaty issue here by saying that the right to health care is a customary law right. And the U.S. has to comply with customary international law. You're muted.
You're muted, Luke.
Thank you. I wanted to ask you both. I know this is a topic that's kind of been a main theme here over the last couple of hours, but I'm really fascinated by sort of the way that a lot of the language is co-opted by those who get to profit off of the system. And I'm curious if either of you have some advice for the audience on how to recognize that language and digest it in the right kind of way, I suppose you could say.
I guess what I would say is that when you hear a word like that, and I hate when I see a television ad by an insurance company and they use a word that they're co-opting from our movement, correct? And it's very difficult because, I mean, I recognize it, but a lot of people wouldn't recognize it, which is one of the reasons, again, going back to calling healthcare a right, that I think then we can emphasize to everybody what equity really means, okay? Not what they're saying it means, and what public good really means. So, other than sort of maybe putting out talking points about, did you know that pharmaceutical companies are co-opting our language, blah, 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 with talking points on it. It's something I've been struggling with for a lot of years. So it's a very good question. I'm sorry I don't have a better answer.
And for me, I think that this is why I think it's important to go beyond the word human rights to actually look at what the principles are, because if you look at the principles and compare them to what is being said, you can actually bring them, you can actually take them apart. So like with affordable, for example, and people can just say, this is not affordable. This is, it's a fraud. It's a fraud. I think also that it is hard because it's just amazing how much human rights and democracy, all these, these words are misused, right? I mean, the people in power understand the value of using that. But so I do think you have to delve deeper. And that's why, I really feel strongly about just nailing down what those principles are so that people can actually do that themselves, because it's accessible, that information, and can be used, and people can they could do their own work, with that principle and look at what's happening in their own, neighborhood or whatever, or to them or to other people, and explain how it is. For example, this is not affordable, and put the data together themselves. I mean, people know what's going on.
Absolutely. Well, hey, I want to thank both of you so much for taking the time to do this panel. I think this was a fantastic discussion. I do want to briefly plug, I was supposed to do this earlier. I apologize. Anyone interested in getting involved with this complaint to the UN, M for all at m4mforall.org. And the fours are the number 4. M for all at m4mforall.org. And if you have a story you'd like to share, you can share it at stories@m4mforall.org. Want to make sure to plug that. And I also do want to thank, once again, our sponsors for this summit, M for All, obviously the March Group, National Single Payer, Real Progressives, Yellow Vest Actions, and Indie Left Media. Thanks to everybody who's worked behind the scenes to put this on. And with that, I will thank Marty and Mary so much for taking the time. This was a fantastic panel. I appreciate you both being here.
Thank you.
And thank you, Luke, and thank you to everybody who's joining our cause.
Indeed.
Absolutely. Yes, absolutely.
Onward.
Yeah, yep. So from here, we are going to go ahead and pass things back to Savage Joy, who is going to conduct a panel on why the bill must be national, why it needs to be a federal bill instead of. Oh, There was Andy for a second. There's Savage Joy. Okay.
The man behind the curtain makes us.
I was like,
Aw.
yeah.
But
Joy
like,
changed
for
her
real,
appearance quite rapidly.
for real, those two women, oh my gosh. Like,
Yeah.
okay, so like, I know these people, okay, but I am learning so much.
Yeah.
I'm like taking notes like left and right. Oh my gosh. And then to hear from an Indigenous woman as well, that is such a huge part of all of this. And they brought up a great point. Health care is a human right, not health insurance. So we
Yes,
really,
yes.
it may sound like semantics, but we really need to be cognizant of our words, because if you're in Canada or another country, you don't even show a card. You
No.
literally just go in and get service. It doesn't
Yeah.
even matter if you live there.
Yeah.
So
Can I,
we
if I
need
could just
to-
share a very quick, I don't know how many people might remember this, but when Donald Trump was running in 2016, he went on, I think it was David Letterman. It was one of the late night shows. And he told this story about his friend, and he did his Trump thing. He said, my friend was in Scotland and he, got really sick and went to the hospital and he was treated. And when he left, he asked, where do I pay up? Do you send me the bill? And they were like, no, what do you mean, Bill? What are you talking about, right? And Trump, I don't think Trump realized what he was endorsing by telling this story, but it's a very useful story, right? That we have this concept in America that, how do I pay for this? How do I pay for this? And in the rest of the world, that's not a thing. That's not a thing at all. I think it's a very important thing for people to understand.
Absolutely. Right on. And great job, as always. Thank you, Luke.
No problem. I will be back here in a couple hours to conduct the MMT panel, and I'll pass things over here to Joy for the national panel.
Are you going to talk about how you're going to pay for it?
Oh, my God. Oh, you're going to give me a coronary. With the hard-earned tax dollars, Joy? With the hard-earned tax dollars?
That's why we need healthcare.
Yeah.
All right. Thank you, brother. So our next panel is incredibly important. It's about why national improved Medicare for all must be national, not state by state, not incrementalism, not means tested, national. Everybody in, nobody out. Period. End of story. And we're going to discuss some of the real damaging effects and a lot of the tropes that are used to mislead and outright lie to people of why, state by state is more feasible and why it's better. We're going to be addressing all of that. So before I bring the two panelists in, or the three panelists, I can add, I swear. I want to give a shout out to our sponsors as well, and also ask you guys to please, if you can, donate on our website. We have a raffle going on. Every $20 donation, meaning if you donate $60, you get 3 tickets. Every $20, you get a raffle ticket. And one person will win this amazing swag bag of, tons of M for all stuff and treats and all this fun stuff, shipping included. So please help us out, help us with our future actions, as well as getting a chance to win some really badass stuff. So thank you so much for everyone watching as well. So Andy, you can bring in the 3 panelists. Hello, everyone. Oh, Steve, look at that background. Look at that.
Yeah.
Thank you so much for joining us, all 3 of you. Dr. Anna Malnow, we had Friday night, so you may recognize her. Kay Tillow, and Steve Grumbine, who gave me my start in this crazy live stream, career, if you want to call it, almost 5 years ago. So always great to see you, Steve, as well. So the way we're going to do this panel is we're going to give each person an opportunity to share their thoughts. Then we're going to open it up for a discussion and go from there. So Dr. Malinow, if you'd like to go first.
I think that Kay is going first.
Oh, I apologize. You're right. Kay, if you'd like to go first, and also, please introduce yourselves more thoroughly than I can, because you have a lot of credentials, all three of you. So before you speak, please let the audience know. But yes, Kay, take it away. Thank you.
Thank you. I'm excited to be here. I am a retired union person, spent my life working in the union movement, mostly with healthcare workers and with nurses. And that's how I ran up against our non-functional healthcare system, which didn't treat the workers right at all, nor the patients. And I have now been working for about 30 years on trying to bring national single payer to our country. And I did a lot of work in getting unions to endorse national single payer, HR 676, which was the bill at that time. We got over 600 unions, including, I think it was 44 state AFL-CIO federations in support. So that's some of the work that I'm happy to be doing. But I'm glad to be here and to talk about this really, really important issue, because we have to get it right in order to make it happen. In the time that I've been working on single payer, we've had 2 go-rounds where it seemed possible that we could get healthcare reform. The first one was in the early 90s, and that was during the Clinton administration. There was a strong single payer movement. We did tours across the country. Here in Louisville, Kentucky, we wrapped red tape around the Humana building and talked about the administrative waste. And we ended up with Hillary Clinton proposing a plan that kept the insurance industry in, turned everything over to HMOs. And we were told at that time that we have to do this because your single payer plan is not feasible, and this one is, and we're going to be able to do it. The reality was that they couldn't even get that to a vote, and that opportunity for healthcare reform slipped away. The second go-round was during the Obama administration in 2009, 2010. And Obama, who had promised in front of the Illinois AFL-CIO that he was supporting single payer, ended up, when he was running for president, not supporting single payer, and indeed supporting a plan in which he included all the insurance industry and all of the pharmaceutical companies, making everybody happy, and bringing us a plan called the Affordable Care Act, which I will refer to as the ACA. Each time we get close to healthcare, they impose something else in between, and they assert that the plan that they're imposing is going to do exactly what single payer would do, except it's feasible. And I contend that what they impose is always a plan that maintains the profits in healthcare. And indeed, it's the profits in our system, the profits in the insurance industry and the hospitals and nursing homes, the for-profit industry, that makes it not work, that makes it cost so much, and that produces the barriers that keep us from getting to the care. So that's the key thing we have to look at. If there's profit in it, it won't work. If there's profit in it, there will be barriers to care. And that's because there's a basic contradiction between a profit-based system with insurance industry that is, under US law, responsible for producing the biggest profit possible for its stockholders, and the interest of the patients who get denied care because that produces more profit. The insurance companies have put in all of the barriers to care, the co-pays, the deductibles, the pre-authorizations, the narrow networks. You go down the line, everything in the way of getting care produces additional profit. So it's the profits that have to go. The profits in healthcare are diametrically opposed to the interests of the patients, the interests of the people, the interests of the nation. That's what single payer has to do. Remove the profit-making insurers, the profit-making nursing homes, hospitals, etc. So what we find in addition is that they tell us, well, you can't do single payer, but you can do little tiny steps and somehow we'll get there in the end. We're going to take tiny, tiny steps and we're going to get to single payer. And the problem is none of those tiny steps help us in any way to advance the cause of getting to single payer. You may do something that helps some group of people, but you won't take out the for-profit system that is denying the care to the nation. And there are many of these incremental steps that are proposed. They propose expand Medicaid, patch the Affordable Care Act, improve Medicare by adding glasses, dental, etc. That might be a good thing, but it won't get us closer to single payer. And then there's the proposal for the public option, which everybody was for, and then it went away. But the reality is the public option or a Medicare buy-in doesn't do it for us either, because you will then have a public plan operating in a market-based system. And I think the closest thing that we have for showing what will happen if we do the public option is what we're experiencing now. We have the Medicare Advantage plans that are the private Medicare plans that Joe Namath is selling them. I'm sure you've heard it. And we have traditional Medicare. And we see that this public plan operating alongside of the private plans doesn't fare well. It ought to. Medicare has a 2% overhead, the private plans at around 15%. But it doesn't do well because there's no such thing as a level playing field. The insurance companies cherry pick. That means they get the healthiest people into their plans. They're more profitable. They lemon drop. They remove the patients who are the sickest and they get thrown back onto the traditional Medicare, and they cheat. They upcode, which means that they pretend patients are sicker than they are. They increase the money that comes to them. We've overpaid Medicare Advantage in the last 12 years by $140 billion. We can't leave them in. The for-profit insurers have to go. We cannot incrementally get to this solution. And I think that the solution that is proposed by many people, we need to deal with as well, and that is that we should do it state by state. That is more difficult, I think, difficult for us to handle, but we need to know the truth about it. So let me lay out the case that those who advocate the state-by-state system make. They say it's too hard to win Medicare for all nationally. So let's do it a little bit at a time, win one state, then everybody's going to see how well it works, and they're going to want it too, and so there'll be another state and another state. Eventually, we'll have the whole country. The nation will finally see it, and then they point to Canada and say Canada did it in Saskatchewan, in one province, and then others did it, and it became expanded to the whole country. Well, let me just start with Canada. Number one, when Canada did their Medicare for all, they did not have any national healthcare programs. Healthcare was a provincial responsibility. In our country, we have a multitude of national programs already in effect. 60 million are in Medicare, close to 80 million are in Medicaid. There's many millions more in the federal health insurance, in the federal health insurance plans, in others like the Indian Health Service and the VA, etc. So the basic premise of single payer is that you get the funding into one stream, you cut out the profits, you have a public funder in one stream, you simplify, and therefore you save the money in administrative costs and profits that allows you to use the money to make everybody's health care better and to extend it to those who don't have coverage. Well, if you can't get it into a stream because it's controlled at the federal level and the state doesn't have access to it, you can't do it in the state. And that's the problem. You can't get Medicare money into the state. There's no such thing. I mean, the people say, well, we'll just get a waiver. Well, there is a waiver that people can get for the money that's in the Affordable Care Act. That can go to the state. It's a section of the law that says that. But there's nothing that gives Medicare money to the state. And it's a problem that we shouldn't try to solve by busting up Medicare and turning it over to the states. So that's one of the big problems. That's why many of the people who advocate actually for state plans still say they can do quasi single payer, or they put single payer in quotes. This is a pathway to single payer, because the reality is, and many people working on it don't know, that you can't do bona fide single payer in one state. You can't get the funding into one stream. There are other problems that are involved as well. Another one is something called ERISA. And without getting into the woods on that, it's a federal law that says the Congress, the national government, has a right to make the laws that govern employer benefits and employer health care, et cetera. And states can't make laws about that. So those laws basically are blocking the ability of a state to control what employers do, even to tax in a way that they might be able to raise the money. So ERISA is a huge problem, in addition to the Medicare problem, for you to try to do a state plan. And then I think we should also look at what happens if the money gets allocated to the states, and if we could do it one state at a time. And let me just take you through what's happened with workers' compensation, which I'm familiar with because I've dealt with it over and over. The taxing system is different state to state. Workers' comp, while it's a federal, the states determine the taxing. And that has led us for states to fight each other over who's going to get employers to locate in their state. In trying to attract jobs, one state after another says, well, we have to lower the workers' comp because the tax rate's too high, and we get into a race to the bottom because we're in a fight because the rates are different in different states. I think if you look at not only workers' comp, but we can look at a couple of other things that are really, really important that we can't leave to the states. Look at voting rights. It doesn't help us to get voting rights in Illinois if you can't get voting rights in Georgia. It doesn't do it. You have to legislate that on a national scale to actually make it just. And we can also look at reproductive freedom. You know, we're now going through a situation where the right to get an abortion is threatened throughout many, many, many states, and state by state can't fix it. We have to fix it nationally. We need national legislation that's going to put that in place, and that's what we need for healthcare as well. We, in many ways, kind of a states' rights plan is a backward plan, and it's always played that role within our country. So it's not good to divert federal money to the states, and it's not good to break up Medicare. And I think that one of the biggest difficulties is that states, in trying to do single payer, and I don't doubt the good intentions of many of my friends who are working on those state plans. But the problem is, because the barriers are greater on the state level than they are on the national level, they are likely to lend credence to the assertion that single payer doesn't work, because in fact it doesn't work state by state, and it doesn't work in one state. And I think there's one more thing, and that others will talk about. The funding is more difficult. States have regulations that they have to balance their budgets, and you have to balance the budget. You're going to have healthcare fighting against education and a lot of other problems with being able to fund it on a state basis. So what I would encourage people to do is come together and talk about how we can do it on a national basis. And because you see, some people have gone so far as to say, well, we should drop it nationally. It's not going to happen nationally until you get several states. And that sets up a precondition that we can't accomplish, and that means we never get there. So I think we can say, yes, it's difficult to do this on a national basis. Nobody's saying that this is easy, but it's much easier if we could get everybody in line and working on it and continuing to press for it and building the support. We indeed have majority opinion within our country, which many people have been working on for years. There's majority support for this idea. We have to help the people to understand that the profits have to be removed, that we can't make a compromise on leaving the insurance industry in. That will destroy our ability to get it done. And I think we recognize that we pay more than double per capita what other nations spend, and we're not getting our money's worth. We are 4 years behind in life expectancy. We've suffered more than other nations through this pandemic. And it really is the time to rally our people around getting a bold and beautiful plan that combines what we know in terms of the data and the research with a movement that is strong enough to make it happen. They'll try to impose in front of us an insurance-based plan, but we'll be ready for them, and we'll have the experience and the understanding to make it happen.
You are so right. Everything co-sign. I just want to say it's so incredible that, some of our panelists Friday night and you and so many others, you have been doing this for 3 decades. Like, I am not ashamed to admit I got my free education in 2015 with Bernie Sanders, as many of us did. Like, it took me till my late 30s to realize just how bad this is. So props to you. And you have touched on something so important, that if you take, women's rights state by state, if you take, even civil rights state by state, if you take Green New Deal state by state, this is incrementalism. That's what this is, and it doesn't help everyone. And you are so right. You nailed it. Dr. Malnow, you are up.
Thank you, Joy. And you know what? It's never too late. So I'm so happy you're here. So yes, my name is Anna Malnow. I'm a retired pediatrician from University of California in San Francisco. I've been a pediatrician for almost 30 years and just retired in December, so very recently. I am past president of Physicians for a National Health Program, And that's an organization of 25,000 physicians that and health providers that support national single payer. I am also the co-founder many, many years ago, like over 2 decades ago, of Healthcare for All Texas, also Doctors for Change, the Pittsburgh chapter of Physicians for National Health Program, and most recently here in National Single Payer, involved in that, and the movement and privatization of Medicare. So lots and lots of organization over the years, and it's a real pleasure to be here today. And I want to thank Kay for an incredible and inspiring call to action. You've answered the question why we need a national single payer bill and why we can't do it state by state. You explained why healthcare activists need to commit to a national movement rather than 50 separate movements, and why it's impossible to fight for one and stay committed to the other. I will say out loud what no one wants to say or even whisper. We have taken the bait from the Democratic Party and divided ourselves, diffused our efforts, and sabotaged any promise of achieving single payer. We cannot ignore the inherent contradiction that committing yourself to a state bill precludes fighting for a national bill. There are, after all, only 24 hours to the day. The next question becomes, do we have a national single payer bill worth galvanizing around? So how is the current Medicare for All bill deficient, and how can we create a model bill to galvanize a national movement? So a national healthcare program, which is what we're talking about, can only be achieved at the national level. It assumes redistribution of wealth, critiques profit-driven healthcare, promotes healthcare based on need and not on the ability to pay, is anti-inequality, anti-concentration of wealth, and anti-racist. For all these reasons, as we will see, the system must be national and not state-based. We've heard plenty of evidence this weekend to understand that our current profit-driven healthcare system is broken. If nothing else, the COVID-19 pandemic has laid bare the inequities, inefficiencies, ineffectiveness, and frankly, the indifference of our healthcare system. If there was ever a time for reform, this is it. This is our crisis moment when we can galvanize people to dream big, join a grassroots movement that unapologetically and radically demands a national health plan, and really only radical here in the US, sadly, not a plan that we can stumble into along the way after a few innovation states get single payer. We cannot leave healthcare or any human right to the whim of states, just like Medicaid expansion, which leaves millions of poor people out, just like abortion rights, which jeopardizes the lives of women, voting rights, which threatens our democracy, and the rights of transgender children, which can result in children being taken away from their parents. All current and past national proposals and bills for a national health program start with moral coordinates, what I called in my presentation on Friday non-negotiable principles, grounded on the belief that healthcare is a human right and that the system must be universal, comprehensive, sustainable, accessible, and free at the point of care, high quality and evidence-based with equal outcomes, gender-affirming, anti-racist, respects dignity, and is equitable. I'd like to spend a few minutes describing how we arrived at the current Medicare for All bill in the House and suggest how it can be improved upon. It started with the National Health Program for the United States, a physician's proposal written by David Himmelstein, Steffi Wohlhandler, whom we heard from on Friday, and the writing committee of the Working Group on Program Design at Physicians for a National Health Program, which was first published in 1989 and updated in 2015. The proposal is based on the expansion of Medicare to the entire population, but understands that we need corrections for deficiencies found in our Medicare system. The two most important elements of the proposal are: one, the elimination of investor ownership of healthcare providers so it removes profit-making from the system, and two, banning of private commercial insurance that duplicates public coverage. These two elements alone would be enough to revolutionize our healthcare system, but they go on to require universal coverage and comprehensive benefits, including prescription drugs and long-term care. It authorizes Medicare to negotiate with pharmaceutical companies and subsidizes the medical education of health professionals and personnel, eliminating medical and nursing student debt. The proposal creates global budgets to fund hospitals, taking away the incentive to overprice and overutilize, and proposes a funding mechanism through progressive taxation, folding all public healthcare funds into the National Health Program or the budget. The physician's proposal was the basis for H.R. 676, also known as the Conyers Bill, introduced by John Conyers in 2003 and every year after that while he was in Congress. H.R. 676 turned the physician's proposal that we just heard about into a bill by including all the elements that I just mentioned and adding a few important components, including the following 5 points. 1, a mechanism for the conversion of investor-owned providers. So he answered the question, okay, so you ban for-profit facilities, but you don't want to eliminate the nursing homes and the dialysis centers because we need them, but just, without the profiteering. The bill spelled out all the benefits and portability in the system, meaning you could move to another state and still retain your benefits, including primary care and prevention, approved dietary and nutritional therapies, inpatient care, outpatient care, emergency care, prescription drugs, durable medical equipment, long-term care, palliative care, and mental health services, but left out women's reproductive rights and abortion. 3, it proposed a progressive funding mechanism for the bill. 4, it established an employment transition fund for displaced workers, including salary parity benefits, retraining, and job replacement. 5, finally, recognizing that we had waited long enough and we did not need to do this in baby steps, the bill would become effective 1 year after the law was passed. Now, when Conyers stepped down and Representative Pramila Jayapal took over the bill, she introduced it as 1384 in 2019, and then again as HR 1976, the Medicare for All Act of 2021, which many of you, I'm sure, have heard of. The original bill, the original Conyers bill, 30 pages long, was converted into a more detailed 131-page bill. It retained most of 676, except for some critical items, as we will see in a minute, elaborated on much of it, and added important protections, including more comprehensive benefits that include substance use treatment services, laboratory services, oral health, audiology and vision, rehabilitative services and devices, necessary transportation for those needing it, complementary and integrative medicine, and importantly, comprehensive reproductive, maternity, and newborn care. It also gave more funds and emphasis devoted to health equity, medically underserved in rural areas, health disparities, people with disabilities, and long-term care. It created an office, or it creates an office of primary care to expand the number of primary care practitioners, registered nurses, mid-level practitioners, and dentists. It has more robust protections against compensation based on patient utilization, such as value-based payments, incentive payments, bonuses, and other compensation schemes that we're hearing out of the DCEs and the REACH and Medicare Advantage and the accountable care organizations, all those that erode the patient-doctor relationship. And finally, it creates reserve funds to respond to epidemics, pandemics, or natural disasters, including a 365-day stockpile of PPE and contact tracing, which of course makes a lot of sense to us today. Now, while a strong bill, HR 1976 has 4 major deficiencies. 1, it allows for-profit institutions to remain in the National Health Program. To make this clear, today, more than 90% of dialysis centers and 80% of skilled nursing homes are investor-owned. For-profit hospitals cost more, deliver lower or no value care, and have the highest readmission rates for every condition. For-profit dialysis death rates are higher and are responsible for 3,800 excess deaths per year. For-profit home care delivers lower quality care at higher cost. For-profit nursing homes provide less nursing care, have more deaths and greater hospital readmission rates. And finally, private equity nursing home takeovers, which sounds terrible and is terrible, harm patients and raise costs. Knowing all of this, why would we want to give these profiteers our tax dollars? 2, HR 1976 does not have a robust program to take care of displaced workers. It is estimated that about 1.7 million individuals will lose employment because of a national health program. In 1976 sets aside 1% of the budget for 5 years without any concrete salary compensation. Now, amazingly, 1% of $4.1 trillion is still not going to be enough. And so it will not suffice, if only for political and strategic reasons. And because it's the right thing to do, the bill needs to include income parity to guarantee buy-in from individuals who will become unemployed because of the passage of the bill, and a robust transition to pay for it. 3, HR 1976 does not include a funding mechanism. As we learned on Friday, the national health expenditures for 2020 was $4.1 trillion. The economic reality of single payer, despite what all its detractors say, is that even after accounting for the increased costs of coverage expansion, remember the 30 million underinsured and the 70 or so million, the 30 million uninsured and the 70 million or so underinsured will need more medical care and deserve more medical care. Under a single payer system, we will spend less money than we do under a current system of no system. Savings will come from paying hospitals and physicians either a global budget or a set fee schedule, savings from lower administrative costs and profits, and negotiated prices for prescription drugs and medical equipment. Now, as Dr. Woolhandler showed us on Friday, existing sources of federal government revenues already currently fund 2/3 of healthcare spending. So we will likely need to come up with approximately 800 to 900 billion annually. Now, with deference to MMT and, with or without it, creating a fair, progressive tax mechanism will increase solidarity for the program and protect it from being gutted in the future. HR 676 proposes raising personal income taxes to the top 5% earners, a modest progressive excise tax on payroll and self-employment income, and a modest tax on unearned income and stock and bond transactions, and this would make up the difference. And finally, HR 1976 would be implemented over 2 years using a complicated and expensive Medicare buy-in option that takes over 10 pages in the bill to explain. This promotes the false assumption that we must move incrementally. It endangers the bill by adding complex administrative steps that will increase costs and not recover savings of single payer, giving ammunition to our opponents. The buy-in disrupts solidarity around the bill because it would create winners and losers. The buy-in option endangers the bill and should be removed. And while 1 year might not be a long time to wait, after all, we've been waiting over 100 years, 35,000 people will die unnecessarily that year due to being uninsured. So these are the changes that are needed to improve HR 1976. A model bill would prohibit for-profit institutions and investor-owned facilities and create a mechanism just like 676 for conversion of those facilities into not-for-profit status. A model bill would create a fund to protect displaced workers and include 2 years of salary parity up to $100,000 per year, or we can make that more, and priority and retraining and job placement. A model bill would include a progressive funding mechanism as outlined in 676. And finally, a model bill can be enacted in 1 year. Remember, in 1965, Medicare enrolled 20 million seniors in 11 months using index cards. I think we've got this. Now, this does not turn HR 1976 into a model bill, but it does come closer. A model bill would fully protect the rights of immigrants and undocumented people to health, support gender-affirming care, include complete free medical education and canceling of health professional student debt, battle homelessness, properly fund a public health infrastructure, as well as the Veterans Health Administration and the Indian Health Service, and denounce incremental approaches. Once we have a model bill, the next step is to use this bill to build a national movement to achieve national single payer. Now, we can expect resistance from all sides, as Kay mentioned. Every time there has been a movement towards universal healthcare, that has been an equal and opposite reaction. Right, for the passage of Medicare, that's socialized medicine. Clinton's plan, Harry and Louise ads. Obamacare, death panels. Bernie Sanders in the 2020 Democratic primaries, public option or Medicare Advantage for all. And now, national single payer with 60% popular approval and Democrats in all 3 branches of government. Let the states be single payer laboratories. Now, reading Public Citizen's Roadmap to Single Payer, Steps to Enacting a Unified Universal Healthcare System at the state level, reminds me a bit of the Steve Martin joke. How to become a millionaire. First, you get $1 million. So according to Public Citizen, it's an organization I highly, highly respect. But to get state single payer, first you pass a law. Then you obtain a waiver from the ACA. Then you integrate a state coordinated system with Medicare, then with Medicaid, and then with CHIP. You figure out a way to deal with workers' comp, address other federal health benefit programs. You avoid getting struck down on ERISA ground, just like Kay mentioned. And when you've done all that, determine how you're going to pay for it. It's honestly easier to pass national single payer. Now, very briefly, Representative Ro Khanna introduced the State-Based Universal Health Act of 2021 that would offer pass-through federal fund waivers, including Medicare, Medicaid, TRICARE, the exchanges, and the federal employee health benefit dollars, to states that have plans to provide comprehensive health benefits to 95% of its residents, and the residents were defined as citizens or lawfully residing immigrants, so not undocumented, within 5 years. Now, the words single payer are nowhere in the text of the bill. I checked several times. There is nothing in the act that precludes giving Medicare money to private insurance companies, strengthening profit-driven companies to pursue obscene profits, deny care elsewhere, and buy more politicians to oppose national single payer. Now, the bill has 25 co-sponsors, all co-sponsors of HR 1976. I suppose they're hedging their bets, if not federal, then state. But the fact that it doesn't have more co-sponsors is a good sign. Maybe Congress is waking up to the realization that we can't really do it at a state level. Well, that's my polite explanation. The health of a nation's people is a foundation of their well-being. As we have seen during the pandemic, our country has failed to provide measures that would address everyone's well-being equally or equitably. Unnecessary and excessive profits and administration inflate the cost of healthcare, drain public resources, and enrich corporations at the expense of the nation's health. Healthcare is a human right and a national responsibility. It cannot be left up to the states. As Steffi, who was on our panel on Friday, and David Himmelstein wrote in 2008, at the beginning of another global catastrophe, it would be shameful to squander the present opportunity on yet another round of reforms that are politically realistic but economically chimerical. Let's write a bold, beautiful model national bill. Then let all activists in every state use it to achieve national single payer, national improved and expanded Medicare for all. Thank you.
Joy?
Sorry, I had to try and find the mute button.
But you found it. Good for you.
You have a blind chick hosting all these panels, okay?
You're doing great.
You so much. Again, yes. I do want to talk to you as an immigrant. One of the things that I, find especially frustrating about this state by state is because, let's take Washington State, for instance, 4% Black, median income $77,000. So when you're doing it state by state, there absolutely is a connection to sexism, ableism, classism, and racism. So I kind of wanted your take on that because you touched on it slightly, but I just want to kind of delve in a little further from your perspective.
So if I'm understanding your question, so if Washington gets the bill, then it doesn't necessarily mean that that it's a pretty homogeneous state. Is that what you're asking?
Exactly.
Right. Well, that's true. I mean, absolutely. It does mean that only the population of Washington would have the right to health care. You cannot call that Medicare for all. Honestly, you can't. It will be health care for all of homogeneous Washington state. Yeah.
Absolutely. All means all, people. All means
everybody
all.
In, nobody out. Mm-hmm.
Exactly. So thank you so much for that. We are going to pass it to Steve now. Steve, take it away.
Yeah, thanks, Joy. And Anna and Kay, you guys both really humbled me with your knowledge. Really appreciated your understanding of the healthcare system. My expertise is less in the healthcare system itself and more in understanding the economic framework and the neoliberal structures and power dynamics that take place behind the scenes. So I'm going to go ahead and focus my presentation talking about exactly that. And first of all, let me introduce myself for those of you who do not know me. My name's Steve Grumbine. I am the founder and CEO of both Real Progressives and Real Progress in Action, a 501c3 and C4 respectively, as Jamarl Thomas will often say. I am also, and I have an MBA, Master of Business Administration. I have a Master of Science in Technology Management. I have a Bachelor's in Information Systems Management and a bunch of certifications and so forth, which put me great in the IT space. So technically speaking, I don't have any expertise in this category at all, other than the fact that this is what I devote 100 hours a week of my life to, is learning about this movement and trying to understand how to make these things come to be through the lens of modern monetary theory. And so what I want to do right now is just take a step back for a second and talk to you all about something that was raised by the previous, in particular, Kay, about the race to the bottom. So the states, all of our states, are what we call currency users. Every one of the states receive money from the federal government. They don't create money of their own. So all of them are dependent on the federal government to do its job. And so what happens is that the federal government and our entire worldview is that of what we call neoliberalism. And no, that is not shorthand for corporate Democrat. That is an entire ideological position that goes across Republicans, Democrats, and it's around the world right now. You see it with the IMF, you see it with the WTO, you see it with the World Bank, you see it around the world. Whenever the global South is taken into consideration, we see the global South raped and pillaged for its real resources. And so a lot of what's going on in the Medicare for All discussions has to go with that understanding that we are living in a world of mass privatization, a world where the politicians, the corporate interests are all focused on the idea that the market, the free hand, the free will of the market, the invisible hand of the market, going back to Adam Smith, this whole concept is about markets and the ability for corporations to maximize profit and maximize shareholder value. And so when you look at our states, many of the states, when you look at their fiscal position, they are hurting. The vast majority of states in this country do not have their pension plans fully funded. States like Kansas, for example, were so bad, they had deprived the public purse so much of tax revenue that they were using school books that were falling apart. They couldn't open schools. Kids were not able to have any of the basic services they need. And so what states like Texas do, Texas puts a big old sign up and says, hey, we're ready for business. All you corporations, come on down here to Texas. We'll take the tax away from you. We'll take good care of you. And so there is this race to the bottom where the states are literally competing with each other. So what happens when you have a state that is, I don't know, they have a major employer pick up and move and leave, say, Detroit, Michigan, and go down to Dallas, Texas. You leave a hole behind, a donut hole behind, where people are literally left without any kind of funding. And so the state revenues, the local revenues dry up. The schools dry up. The roadways can't be fixed. All of the aspects of the local economy are in jeopardy. Okay, this is why when you look at when there's a national disaster, we have a FEMA or a federal emergency, right? Federal, right? Because the federal government is the creator of the US dollar. And people don't realize this because you've been propagandized to believe that it's the Rothschilds or it's some weird nefarious thing with private banks funding the federal government, which isn't how it is at all. And the panel after us will talk about funding, how this stuff gets funded. But I want to talk specifically about the dynamics that make this funding really super important. If you have a healthcare scare, like, I don't know, a pandemic, and you have that go throughout all the states. First of all, let's just say hypothetically, you were able to get states like New York and California to be able to provide this. They have unique economies that are very, very large, larger than some of the countries around the world. And so based on their ability to bring money into the state, they may be able to survive some of these ebbs and flows. But the vast majority of the states are underwater. The vast majority of them have huge deficits, and they start horse trading. They start trying to find new ways to fund things. In the state of Pennsylvania alone, there was a $600 million shortfall, budget shortfall a few years back before the pandemic. Their answer to supplying that shortfall was to cut services, number one. And number two was to begin to allow fracking companies in the middle of a climate crisis to begin fracking throughout the state of Pennsylvania. Because it is a purple state, you have a lot of differing opinions about how that tax revenue should be spent, because at the state level, it's all about taxes. States are heavily dependent on tax structures. And so what ends up happening? Those local states fight with each other. The counties fight with each other, etc., for revenues. People, though, have a different perspective. What do the people with money do? They want to live in a low tax area. So you have what they call flight. And when people move out of those areas, you're left with a tax hole, a hole in revenue. It's really, really dangerous and damaging to all the other social fabric of that community, not just Medicare, but everything from pensions to roadways. Think about our bridges and infrastructure in this country. Many of them are D-rated and below. So as you begin to think about why the race to the bottom is so important, begin to realize all the things that the state is responsible for. Unfunded mandates from the federal government are huge. There is massive, massive, massive unfunded mandates that are pushed down to the states. So what do they have to do? They either have to raise taxes, or they end up not in compliance. And then the federal government has, penalties, and they don't provide the services that they were going to provide. There's different acts like Act 89 and stuff like that in Pennsylvania. Use Pennsylvania as a perfect example, where monies from the federal government are provided for roadway infrastructure, but they are encumbered, meaning they are specific. They have to be targeted to do a specific thing. Well, that doesn't mean they can use that as a general fund. So all the other services of the state end up drying up. They've got to find things. So what happens? Look at places like Ferguson, where they use fines, fees, and penalties on the poorest Americans to fund their police, to fund their social services, to fund their schools. They have cops at every corner waiting to get people with speeding tickets, trying to fund their local and state initiatives. This kind of behavior, this kind of model is the absolute opposite of what we want our country to be like. This is not how we want things to go. And so you bake in inequality right off the bat, because every single state ends up being in that position. Now, there are a few states out there, obviously, that have taken on the role of being the let's just slash and burn all the taxes and bring business down there. They have the employment. The people that are doing really well do really well, and the people that are doing really bad do really, really bad. Now, why does that matter? There's 26 states in the United States that have ballot initiatives right now, 26. So of the 50 states, 26 of them could even put a state-by-state approach up on their, to vote for, right? But you start getting into situations of how do we have what we call a scalability, or the ability to provide care at scale, to be able to make sure everyone has care. And they can't do it. It's fundamentally impossible for them to do it, because one of the most important things is not just the money. It's how do you resource this initiative? How do you make sure you have enough doctors, right, for the increased load? How do you make sure you have enough nurses, gurneys, x-ray techs, phlebotomists? How do you make sure you have enough clinics and care facilities around to support this new influx, right? And so now you've got to account for not just the payments of the premiums, but you've got to account for creating the actual real resources to provide the care. Now, a state that doesn't have the planning mechanism to bring in the care for all that is also setting everyone else up to fail, because they're pinning their hopes on one state getting it and it becoming this watershed event where everybody suddenly becomes enamored with it and suddenly everybody has Medicare for all. It doesn't work that way, and it will never work that way. Okay. Only the federal government has the ability to do this. But one of the most important things, and this is one of the dangers I heard, and I've just pushed general pushback of the last speaker, Anna, is that when you think about Social Security. Social Security, FDR made a deal with the devil to tell everyone that Social Security was funded by your FICA dollars, right? That you're investing in your FICA. Well, this is a lie. It didn't happen. That's not the way it happened, but he had to do it for political reasons. But here we are now in the year 2022 with still previously people like Paul Ryan coming out there in Congress talking to Alan Greenspan. Wouldn't it make Social Security more viable if we had private accounts and we were privatize it through like 401k plans, stuff like that? And thank God for a moment of actual honesty from King neoliberal Alan Greenspan himself, where he said, no, it wouldn't make it more. The key here is, can we create an economy where the real resources are for sale for purchase? Okay, so what FDR did by making this FICA thing happen, created the most regressive tax possible to fund a service that should be just a benefit of living in this country, an investment in our elderly, and provide the COLAs that are required. Because the one thing the federal government absolutely can never run out of is US dollars, because it creates US dollars out of thin air. Okay, now I'm going to take you on another journey here real quick, and this one is an important one that many people may not understand. The CBO, we always talk about the CBO scoring and things like that. One of these key metrics is GDP. And when you think about GDP, it's gross domestic product. It's basically the balance sheet, all the money that the country made. Doesn't matter how it made it, just whatever economic activity creates that GDP. And so this indiscriminate number called GDP is held up as God. But what happens when you make Medicare for all? Once you make Medicare for all, you eliminate all those insurance companies. You eliminate all the extra nonsense that has been put in place to deny care as opposed to provide care. And so all that economic activity, all that meshuggah right there is washed away. And that nonsense right there is part of GDP. And once that GDP is eliminated, you end up with recessionary conditions. Now, all of a sudden, you end up with a situation where instead of raising taxes, you need to cut taxes. Counterintuitive, I know, for all the folks out there, and there are many who believe that taxes erroneously fund spending. But taxes literally are deleted. So if you're taking money in for taxes to pay for things, well, number one, you're lying to America. You're lying to every citizen in the country. That's a lie. We don't want to do that. We don't want to start off baking a policy to provide health care founded on a lie, because there's nothing worse than a lie, because it comes back to bite you like FDR's lie did with Social Security. So we want to eliminate these concepts of trust funds. We want to eliminate these concepts of pay-fors, because the fact is that if the government isn't covering all of it, then it's left to somebody else to believe they're covering it, which means that it's not really a right. Now it's dependent on a tax dollar. And that should never be the way it is, because affordability is the one thing we've got to eradicate from our mind. We got to stop thinking of how we're going to pay for it. That needs to be eliminated from all conversations, because we need to understand how the currency is spent into the economy. Okay? So when you think about the state-by-state approach, you already know that with more than half of the states really struggling to fund even their pension programs, how in the world could they take on the burden? And it would be a huge, unnecessary burden at the state level. They would have to slash and burn. They would have to raise taxes. They would create situations where the big taxers, the people that are actually funding their local governments, would say, no mas. They'd pick up and leave. This is called white flight. We see it all over the place. This has happened and left communities of color destitute, as the inequality baked into that model is so severe, so harsh, so absolutely exacting, that if you don't understand this, you might be inclined to advance a model that would create that very condition. And I'm here as my role in this thing to make sure that that doesn't happen, to make sure that you understand that taxation literally is deleted. So in the bathtub of our economy, okay, we have a spigot coming in, that's federal money spending into the economy. And over here, we have another spigot, and that is private debt pouring into the tub. Right now, private debt is rising through the roof. We can see it in our federal student loans. We can see it in all these things, all this nonsense. It's a burden to regular people. But down at the bottom of the drain is where the taxes come out. Private saving, we call that leakages. And so those leakages are not funding anything. Do you understand? They're not funding anything. The only tax dollars that fund something are your local and your state taxes. Federal taxes are literally deleted. Social Security FICA dollars are literally deleted. The FICA score, that little sheet you get in the mail that says how much you paid all of your life, that's a numeraire. It's merely an accounting identity to say, yeah, you paid. But those dollars are deleted. There's no fat stacks rolled up at the Federal Reserve with Granny's old wooden nickels or Buffalo, none of that stuff. There's no hay pennies in there from yesteryear when they were saving up. It's all gone. It's all new money every time the government spends. But states can't do that. States have to raise taxes to pay for things. And what happens when people start moving to different states and all of a sudden they leave the poor really, really destitute? This is a problem that has implications way beyond Medicare for all. This is a problem with a Green New Deal. This is a problem with college for all the different things that we crave as progressives. And so when you see media on television sitting there lying about taxpayer money, or when you see alt media pretend like these aren't issues that should be talked about in every single live stream, not just some, not just when the MMT is on, but every single one, that they're abdicating their role in this movement by not talking about it every single time. Okay? When they don't do that, they are setting the stage for more misery. And they got blood on their hands. So this is where we've got to get smarter. We've got to really begin to recognize that the parameters of Article 1, Section 8 of the United States Constitution, while it was built for capital, it was built to protect capital, this one area, Article 1, Section 8, gives the power of the purse explicitly to Congress. Now, we can go one step further. We know that lobbyists have control of our government right now. We know that our government is largely captured by special interests. So this is where the state-by-state crowd gets their oxygen, because there's valid case there to be made. This is why it is important that we understand the economics, we understand what's at stake, and we organize at a national level to take this thing down. And we have to be ready to sacrifice. We cannot just be, well, it's a little inconvenient, don't really feel like doing that, it's a little, I don't know. We've got to really understand that we are in a war, and it's a global war, because while we're fighting to get single-payer healthcare in the United States, our U.S. government is busy exporting neoliberalism to the UK, who already has a national health service that they're now trying to privatize. In Australia, they have a healthcare service as well that the United States is there to say, we're here from the US and we're here to help you privatize your stuff. And the World Bank and the IMF are doing it around the globe. So while we're trying to fight this battle here, they're fighting it the other way to dismantle what they have outside. So you must understand this war is not just a single issue war. It's a bigger war. And so this is where the MMT angle comes in. And if you see an MMT post, you start hearing people talking about this, make sure your ears perk up. This is for you. You need to know this, because as a warrior to make this stuff happen, if you're not prepared with the tools of the trade, if you don't understand what's at stake, you're likely to make a really bad mistake. And you'll watch as the California folks ignored the MMT message. You watch as the Washington State folks ignored this message. You watch as the New York folks ignored this message. They clung in groups that self-fulfilled, yes, state by state is the right answer. And then they found other people that were opportunists to make them feel like it was the right answer. But the truth is, there is no wiggle room. There is absolutely no wiggle room. The race to the bottom isn't just happening in the US, it's a global thing. And we must be aware of this battle. We must embrace this paradigm so that we can fight back. And that, my friends, is why I'm telling you right here, right now, the only way forward is a national-based approach. But you must understand the powers that be are fighting you for far more than just Medicare for all. They're fighting you for the very belief system that there should be no public property. There should only be private property. And this is the battle. This is your class-based struggle. This is the entire shooting match right here, my friends. And so I hope that you'll take the time to learn this stuff, because these wonderful women that were on the panel with me have brilliant ideas of how this needs to be done. That ain't my specialty. But I'm here to tell you that this global scourge of neoliberalism is going to make it a challenge that you didn't even anticipate until you see the broader inputs, outputs, tools, and techniques of that entire mindset. Once you embrace that and you stop skipping it so you can be friends with everybody, once you take a tough edge and you realize how important this battle is, you probably lose a few friends in the process. I'm not going to lie, but it's worth it, because we're going to gain a lot more, because this is the battle. This is the battle. You've got to embrace it to move forward. So, Joy, that's what I got here. You're muted. You're muted. You're muted, Joy.
Okay, no lie, every panel I've done the past 3 days. I've only done a show for 5 years. I don't know how it works. So I want to actually talk about one of the, I'm not going to be generous. One of the lies state by state people push is cannabis. Steve, I'll go to you first. Just for people watching, I want you to really, really think about this, because we hear, I want it to work like cannabis. Cannabis worked on a state-by-state level. Well, it was introduced in 1994. There's still less than 20 states who have passed it. That's the first thing. Second thing is, medical cannabis is not even legal in all 50 states. Okay. Another thing is, cannabis actually brings revenue. Medicare per state would cost revenue. That is a very, very different thing. So Steve, touch on that a little. When you hear people say, well, it's state by state, it's going to be just like cannabis monetarily. Touch on the difference of the bringing revenue and costing revenue.
Well, first things first, it's not a spending bill. You're just allowing a business to come to be. And so there's no funding issue there, right? The only issue is where the legality is. Was it a federal law or state law preventing it? And there's federal legislation, sadly, that has this stuff marked as a schedule, whatever drug. And so that's really what you're dealing with there. But that could even be solved with a pen stroke by a forward-thinking president, an executive order. That wouldn't be forever, because an executive order only lasts as long as the president is in office. But it's totally not the same thing, because, like I said before, our Constitution, which I despise, but our Constitution nonetheless is the law of the land. And it says Article 1, Section 8 gives the power of the purse to Congress. And so funding for Medicare for all and things like that is really what the issue is here. The whole concept of state by state. Well, yeah, every state's going to have their own little pitch battle as to whether or not they want to let gay people marry each other, whether they want to let, trans kids exist or be harassed, whether, all these different aspects of inequality are baked in. And that is decidedly a Dixiecrat, freaking scumbag, Civil War level, 10th Amendment kind of nonsense that, has really been the bane of our existence for an awful long time. It's largely why the 14th Amendment had to be invoked, as far as the equal, the clause, the equal, whatever clause. I'm butchering that, but you get my point. I think it's really important to understand that the state by state approach is decidedly playing off of states' rights. And it's playing off of a role that has been used as a cudgel against the poor, against black and brown people, against gay people, against every other aspect of society. And you see the fact, to your point, that marijuana is still not legal in all 50 states. And there's federal legislation that still hasn't even played a part in it. The only thing they're doing is making a decision to not prosecute. They could still go after everyone, even though all this stuff is going on. The executive branch is choosing not to execute the law as written. If they did, these people could all go to jail right now. It's very precarious as it stands. So very, very different. Just drastically different, like comparing apples and oranges.
Absolutely. And then to expand on that,
Commerce
to the
clause,
ladies-
sorry.
Oh, no, people need to hear this. And then to expand on that to the ladies, something I've noticed, and many activists have noticed, that we run the risk that when states legalize cannabis, they don't really fight for it other places anymore. It becomes even unconsciously, it becomes a very I got mine. And that would be a huge risk by state as well. When you have your state in the title of your organization and things like that, are you going to continue to fight for national if you already have it, or even on close to the same level? We have not seen that with things like cannabis. So to the ladies, we can go. Kay, if you want to go first, you want to touch on that?
Well, it's hard for me to imagine that a state can do it, because I think that the barriers are there. So if we can never get it passed in the first state, and we see states as essential to a chain of getting to a national, it means that we never get there. But I mean, it's true. Once you get it in one state, it's not going to mean automatically it happens everywhere else. And we see that with voting rights. I mean, that's a huge problem. And winning at one place doesn't fix it. And people don't say, oh, that looks great, let's do it nationally. That's something that has to be done nationally. And the same thing with abortion rights. You can't fix it state by state. We have to fix it nationally. And, if states could actually do it, I don't know if it would help or not, but they can't because of the barriers. There is no law that says you can get a waiver to put the Medicare money into the state. So you can't really do a bona fide single payer. You can't get the full savings. And, single payer is based upon we save by removing the profit makers in the insurance industry, and then we use that, to expand the care to everyone. So it just doesn't work. It may work with other things, but it's certainly not going to work with healthcare.
And that's a good point as well. If it would pass by a state, which gives those elected reps sole control over that, establishment Dems, Republicans, everyone will be looking at those flaws and for reasons why we shouldn't do it anywhere else. And that would just be a given. Look, there's problems here. This happened with that, and now we shouldn't implement it anywhere else. So that's another, risk that would come with that. Dr. Malnow.
So, as important as cannabis is for a lot of people's health, it's not the same thing as health care. So some state people might say, well, people aren't fighting for cannabis at the national level because it's not all that important to everybody. But, healthcare is certainly going to be important to everybody. So we will be able to galvanize, once we get one state, other states will follow suit. To me, the best example of not using healthcare at a statewide level is the expansion of Medicaid, and which under the Affordable Care Act, it was supposed to. So the expansion of Medicaid was supposed to be for every single state, and what happened is that I think like 24 states sued the federal government, and it went all the way up to the Supreme Court, and then the Supreme Court ruled practically all aspects of the ACA constitutional, but it ruled that the expansion of Medicaid was constitutionally coercive. So we have precedent that if one state decides for healthcare that I am sure that other states will take it to the Supreme Court, and it will probably be ruled, against, for the state against a national program. And as a result, there are 12 states today that have not expanded Medicaid, and I do not expect them to expand Medicaid at all.
Absolutely. Great point. And another panelist said, I believe it was Friday, that some of the Medicaid expansions will be up very, very soon because of the pandemic. Some were extended, and then many will be dropped.
So that's a little different. So that was me, but that was a different point. That's a different point. All the expansion from the pandemic has been in states that expanded Medicaid. And so even in the states that expanded Medicaid, they expanded further, but those are going to be restricted, and up to 15 million people in those expansion states will lose Medicaid, including 6 million children. Yeah.
Incredible. Kay, you touched on something that I definitely wanted to talk about, and I'll open it to the panel then. But we hear about Canada a lot. Well, they passed it there. But a few things I wanted to mention is, and I got some of this information from Karen on our second panel Friday night. So it still took about 4 years for Canada to pass it. Since it passed province by province, very much like state by state, because of that, some don't have dental, some don't have sight, eye care, things like that. There are also certain provinces that are trying to repeal it, and they very well could, which means I might have it, you might not, your neighbor might have it, you might not. And so it's not an all situation. It is the same way it would be state by state. It is a single entity that could be changed by itself. And then, the arbitrary borders, are going to make a difference. So there's that aspect. But also, Karen was saying that some provinces, even because a lot of the doctor appointments are virtual right now because of the pandemic, if you have an appointment after 6 p.m., you pay out of pocket. Nothing, no insurance, no nothing, except it. Out of pocket. So, they're allowed to put these certain contingencies when it is province by province, as it would be state by state. So Kay, I just wanted to start with you and kind of get your takes on the danger of being able to put quantifiers on, people's healthcare.
Yeah, I think that, Canada's so much better than we are that we tend to think that it's pretty good because, in fact, people basically get their health care. But, I have friends in the union movement in Canada, and they are terribly critical of their system. They are screaming that it's underfunded, we have to put more money into it, we're not getting adequate physical therapy, et cetera, et cetera. So, I think the battle continues even after you win it. They haven't been able to take it away because there's massive Canadian support. You ask any Canadian, do you want the US system or do you want Canada's? And they're going to say, we prefer ours. And then if you ask them, well, are there changes you would make? They have lots and lots to say about that. But varying from province to province is not a good thing, having benefits in some areas. I think the dental varies. I've heard the union folks talk about, I think maybe the kids are covered, but not, they negotiated for working age people in some of the provinces. And it's a variation, and it's not a good thing. I know Karen Palmer wishes that they had a national system so that they didn't have to win things one province at a time, and they could actually get some control over the planning and make it more effective. But it's still so much better than ours that we can use it as an example of something better, where at least people don't die because they are unable to walk into a physician's offices because of their copay or their deductible.
Absolutely. Dr. Malinow.
So I think the example that Karen Palmer was talking about is that it's Canada's telehealth since the pandemic has opened up. And so, for example, the benefits in Canada are portable. So if you as a person go from Saskatchewan to British Columbia, you can still go to British Columbia and get healthcare there. But the interesting thing about telehealth is that you are in Saskatchewan and it's 6, or let's say British Columbia, and it's 6 p.m. or whatever. Well, I can't get the time zones right. Okay. But basically your doctor closes, you're in Saskatchewan, your doctor closes, and then you want to get telehealth from somebody in British Columbia because it's only 6 p.m. there. And yes, you can get, because their doctor's office is still open, but then because the doctor is not in your province, you would get billed for it. And I think I'm understanding that correctly. If you had a national program, then you could get, healthcare from any doctor in where you are, right, through telehealth without getting billed for it. So there's just no guarantee that if you have a state-by-state system, as Steve was talking about this, it's the capacity is going to be commensurate to the amount of money that you put into it, right? And so yes, California will probably have a good system, as will New York and maybe even Washington, because they have a pretty homogeneous population. But if Texas should even get there, it's not going to be the same, nor will Alabama, nor will Louisiana, nor Mississippi, nor, even West Virginia, with all their wonderful, great intentions because they expanded Medicaid. If they're a poor state, it's just not, it's going to be very, very, very unequal healthcare.
Absolutely.
I want to test drive. I want to test drive it's okay. I want to test drive a thought with this concept that we're talking about here. So, when you see downturns in the economy, we have things called automatic stabilizers that kick in without anybody passing a bill or having any hand wringing. They just happen, right? So we have a drought, we have automatic stabilizers that kick in for farm subsidies. We have unemployment. We have automatic subsidies for unemployment. We have all these different factors that kick in to insert money back into the economy to prevent a recession. We have buffer stocks. We have all these things. We don't have funding for them. We don't set aside $50 million for these things. What happens is they just spend whatever needs to be spent when those automatic stabilizers kick in, period. Okay. So if you think about the concept of healthcare as a right, get all the Medicare for all out of your mouth for just a second, set it over to the side, and just think about Medicare or healthcare as a right, as an automatic stabilizer. When things are needed, the money is there, period. There is no, it's not affordable, we pay less for this, or who cares? At the end of the day, the government is the controller of all that money. Okay. And this is a really, really super important thing, because you have no idea when the next pandemic is going to hit. And you have no idea if some spill is going to happen that's going to create a lot of cancer or any number of things. We have no idea what climate change will bring in terms of healthcare crisis as well. We just don't know. And so why would we budget that? It's like the most ludicrous thing I've ever heard in my entire life. And this makes the state by state even more redonk, because they have to be budgeted, because they have a law that says they must have a balanced budget. So they're going to be leveraging themselves like a lot of these states that have been gutted by vulture capital, where they go out and buy all these bonds, they invest in private, just anything to make money, because they're so strapped. And so if we don't have an understanding of an automatic stabilizer approach to healthcare, where the money just is inserted, where it doesn't matter, I don't need to know, it needed, spend it, right? Now, the real regulation has to be on price controls and patents and stuff like that outside of the care. The care should be irrelevant. We shouldn't even have to worry about that. Let the federal government, who has the impossible task of managing and regulating all these different interests, let them deal with that. Let us have health care and not worry about the cost. We shouldn't have to pay a nickel for care. We shouldn't even have to pay a penny. Okay. And if you think about it as an automatic stabilizer and get rid of that budget mindedness and cost savings here and cost savings there, if you think about it that way, and that's really what it would be if it were a federal program, because they're not going to cap off healthcare expenditures. Oh, well, shoot, guys, we hit our healthcare budget in March. We can't spend anything for the next 9 months. We're over budget. They're not going to do that. That's not how it'll work. The program itself would have to be basically serving as an automatic stabilizer. And there's no state, not California, not New York, not Washington, that could handle it as an automatic stabilizer. So if you put it in those terms, changes everything. And this is my first time saying this, but it makes so much sense now that I understand the mechanism. Why in the world would we not want to have it that way? Why in the world would we want to get wrapped up around the axle of how to pay for it? Just insanity to me.
And Steve, as a fellow Pennsylvanian, how bananas is it that you and I, could have a doctor over the hill in New Jersey and have to pay out of pocket because we can't, it's out of our state? That's bananas. Like, people really need to think about this. If you get state by state and you move, goodbye, buy healthcare. Or you are on a border and your doctors are in the next town over, pay out of pocket. Like, this is how unequal it is. I want to kind of touch on the vote harder, well, we can do it with politicians because that's working so great. Pelosi supports state by state. That's enough for me to be like, no. But let's look at California. Okay, so we have the gentleman who is literally the head of CalCare vote against it. So, first of all, I recommend everyone read the CalCare bill. It is not Medicare for all. People label it that, and it is not. There are plenty of caveats for that money to come in there. And how much easier is it to buy one politician, as we just saw, than buy Congress and Senate who have signed on? There's a lot more than one person who has signed on to Medicare for all. So one way you're buying one politician, and in another way you'd have to buy all of Congress, all of Senate. So even though money in politics is, Beelzebub itself, still, which one is easier to get by? And we saw that in California. Kay, what were your thoughts on California's bill and the fact that people are calling it Medicare for all, and also the fact that it blatantly failed?
Well, I'm struggling as a Kentuckian to understand California. It's extremely difficult for me to understand. I know that in 2006 and in 2008, they passed some form of thing that people called single payer, and then it was vetoed by muscles. Schwarzenegger said no, and it seemed to me that maybe they passed it because they knew it was going to get vetoed. But even back then, there was no funding in it. So they passed a bill where the key thing is that you have to replace this employer funded system in a state with some form of tax system, and they didn't put any money into it. So I still don't understand it. And I've seen then, I saw that this guy named Rendon,
Yeah.
he did it earlier,
Yeah.
and then he withdrew the bill. And then when this other guy, what's his name, Cash Kalra, is that it?
Ash Kalra.
Yes.
Kalra did it. When he withdrew it, then Rendon condemned him for having withdrawn the bill. And, I'm befuddled. I don't know how, what the movement there believes that it can do, because it seems to me that they've been working at this for a very long time and they don't have anything in place that is hopeful that they can accomplish it in one state. So, and you see people, there was just an article in The Nation that we're going to go after it again. I don't know. It's I'm puzzled by it, but I don't think that they're going to be able to fund it on a state basis or to accomplish that. So I wish we could get that whole California movement helping us to go after Nancy Pelosi and all of the, what does California have? They have what, 50 or so in Congress?
So close. So I'm actually in California, so I can tell you it's very interesting living here and living through AB 1400. In fact, there were two bills. One was sort of like a companion bill to the single payer bill, and the second bill was the funding bill, which didn't go anywhere because the initial bill didn't go anywhere. But the second bill, the funding bill, was for a constitutional amendment, because in order for California to raise the taxes necessary, you need to have a constitutional amendment, right? So that was going to be their funding mechanism, because that was the argument last time, that they didn't have a funding mechanism, and now they do, which is basically, okay, well, we'll just put it up for a vote. But I think the real problem, well, first of all, as Kay, you just mentioned, yes, there was an article in The Nation that said, basically rinse and repeat, right? We're going to just keep doing this. We're just going to keep doing this. And that gets, I think, to the heart of the problem, because, and I have to say, many of my health activist friends are state single payer people, because in California, that's pretty much what you are. And, I hope that they still consider me their friends after today, but it takes all activists away from the real effort. It just completely sucks out the energy in the state for anything national. And so you're absolutely right, Kay. Yes, I wish we could get all of these activists to push on Nancy Pelosi to bring this HR 1976, as imperfect as we're seeing, to a floor vote, or to push Dick Neal to have a hearing on it. But it's just not happening, because the people in California are all consumed by AB 1400, and they lost. And a lot of them put in a ton of work, and I'm so sorry to see that for them, really, because my heart goes out for anybody that works so hard. But they're going to do it again.
And that's a great point too. You cannot trust that reps from single states are going to support. Like, we see when Bernard introduced it in 2017, who signed on? Kamala Harris, Kirsten Gillibrand, people who then ran for president.
Corey,
outright said Elizabeth Warren. No. What, they ran 2 years later, and all of a sudden, no, I don't support that, because they only had 15 signatures then, and they knew it wasn't going to pass. So look at me, I'm so progressive, I'm signing this bill. And then what happened? 2 years later, they run for president. They show their true colors. That could absolutely happen on a state-by-state basis. We have no reassurance people like Elizabeth Warren are going to sign on to the Massachusetts bill that is being, talked about being formed. Steve, what would you like to add?
Well, what I'd like to add is a just an observation, right? Just an observation. When you see California and you see the gatekeepers and the progressive movement there, the headline activists that kind of keep in their own little echo chamber in their own little bubble, and it's just this kind of like popularity contest, like in high school almost, and they literally only focus on their things. And if you say anything that distracts from that echo chamber, you're excommunicated, you're canceled, you're done. And I'm feeling for Anna, because I mean that's the culture. And it's not just the culture there, though. It's this state by state approach. I mean, it's everything from public banking and not understanding the role of the federal government of the currency issuer. They don't hear anything but what they hear in their own echo bubble. And so it's penetrating that somehow or another, getting past that walled garden, that membrane that blocks out any contradictory information, and somehow or another getting someone on the inside to say, hey guys, eyes up here. Let's deprogram the cult of California or deprogram the cult of New York and start getting you to think at a collectivist national level. And unfortunately, this state by state approach, this 10th Amendment approach, is being passed off as progressive, and it is not progressive. Let's be clear. It is not progressive. Progressive, if you think about a union motto, what is one of the most key union mottos? An injury to one is an injury to all. That is a progressive class-based issue right there, right? When you say, hey, an injury to one California is an injury to all Californians, but not the rest of the country, I got a real problem with that. And unfortunately, penetrating that very, very tough membrane that is the echo chamber is a real challenge. And you saw that in the first March for Medicare. As you looked at the California talkers, they weren't talking about national health care at all. Everything they talked about was their state approach, which really hurt the movement, quite frankly. I really haven't quite forgiven them for that. And it's the same with whole Washington. We actually sat down, just to be clear. I had Fadl Kaboub, let me say it clearly, Dr. Fadl Kaboub. I've had people like Dr. Bill Black, who is a law professional as well as an economist. I've had Poti, who is an economist, a PhD doctor who understands this as well, from Virginia. We had them all talking to these individuals in whole Washington, trying to explain this stuff. And it was like, you can't know that. You can't know that. No, I can know that. That's the thing. That's the beauty of understanding economics. I can know that. I literally can know that. It's not debatable. I'm not wondering. It's not a question in my head. I know it. And it's not just me that knows it. It's the people that actually done the homework. This is why I would never push back on anything about policy and prescribing how to deliver health care, because I'm not an expert in that category. I'm not really an expert in anything. I'm just well informed, and I'm carrying the message forward as an activist for the funding aspects of this. And the people that know, and they have said point blank that while it's noble, and we certainly understand the frustration of trying to deal with a national thing, with all the problems that are facing us, in terms of actually getting past the lobbyists and getting past the money in politics, and really understanding the Constitution wasn't written for democracy. It was written to protect moneyed interest. It was written to protect capital. Hey, have as many slaves as you want, have as much land as you want, create as much carbon as you want, do whatever you want. As long as you're the capital owner, you're good to go, man. We're here to protect you. But us, we the people that are begging, like Tiny Tim, please, sir, give me some porridge. We have no standing with that government. So I think it's a fair thing to say that wherever we go, we are facing this dynamic. So it's very important to organize strategically and with massive numbers, and be disruptive. Don't be kind and gentle and sweet and death is not sweet. Dying of cancer, bankrupt, is not sweet. There's nothing kind about it. There's nothing gentlemanly about that. Neoliberalism and austerity are murder. And so until we stop playing patty cake and worrying about bombs in Ukraine and start realizing that there's more bombs to go off here by the power of economic malfeasance and ignorance, worse, the ignorance, the economic illiteracy that is pervasive in our movement and pervasive in alt media and pervasive in our regular media. And I'm not even sure that it's ignorance on the regular media. I think that they genuinely are carrying the water for this lie. Okay. But I think alt media is just straight up ignorant about it. And they're like California. They're in their echo bubble. They don't want to hear anything other than what their echo bubble is. And so they stay insular and they say things that each other say. They repeat what each other says. And this is a real challenge for any movement to be built, for any kind of movement for this kind of bill at a state or national level. We've got to penetrate the alt media bubble and get people to stop pretending like this is some secondary issue that's boring. It's the most important issue. It's the issue because we get nowhere without it. So that's my take.
And you're so right. I mean, yes, Twitter can be like the devil, but at the same time, it has good things. It's good for organizing. It's good for support. But yes, when you say, why do you support only state by state? We support national. When's the last time you posted about it? I see nothing on your pages about national. Well, that's ideal, but we're focusing on the no national. Stop saying all and then hashtag state by state or things like that. It's hypocritical. And as a disabled person, I'm not a fan of you saying I'm only fighting for disabled people within these arbitrary borders. Sorry, Joy. Sorry about you and the millions of other people who are disabled. I can't. That's too much work. I'm just going to focus on my state.
So let me bring up one thing. There is a person, Catherine Lewandowski, who has been posting throughout this thing, and I'd like to bring this up. She says, Andy, if you can bring up, there are plenty of economists, Steve, that do not agree with you. Can you bring that comment up for just a minute, if you don't mind? Because what the concern here is this: neoclassical economists throughout history have disagreed with any kind of heterodox thinking. But the fact is that MMT is the only coherent, legally truthful, and coherent set of conjectures and understandings of the way federal finance is done. It's it, period, full stop. And so whether they disagree with me or not, their careers are paid to be in disagreement with me because they've written for the last 40 years lies and propaganda and tons of books, garbage, trash, that has killed more people, that has created austerity, has created sound finance, that has murdered more people on the lower end of the spectrum than any war we've ever had. So if you want to hearken over to those other people, be my guest, but I put you in the camp with those murderers. That's the deal. The fact is that economics is a tool of murder or it is a tool of life. It is ultimately a way of distributing real resources. And if you're holding back with lies about scarcity and pay-fors, then you are a murderer by policy. You are a murderer by social inequity. You are a social murderer. And there's a study in London that shows that austerity is murder. I've been saying it's my tagline on Twitter, and I'm not afraid to say it. People that advance the scarcity narrative, this idea of taxation and funding, literally are playing into a murderous paradigm that specifically makes the money to be the scarce thing instead of the real resource. You can disagree with me, but I'll go toe-to-toe with anyone. National stage, public, I don't care. Anywhere you go, bring it. I got it.
And I think that, that everyone, please stay tuned for our next panel because people need to understand MMT isn't something that needs to be implemented. It's something that literally already exists. It's already here. It's how we work. It's just getting people to understand, how money works in actuality.
So can I interject, Joy?
Sure.
Can I just interject something to respond to Steve? And that is, so Margaret Flowers once wrote that the problem at the federal level is not the ability to fund programs, it is the political will to fund them. And I really do agree with Margaret there.
She is 100% right.
Yeah. And man, I mean, unfortunately, she's dealing with some personal things, and we wanted her on this panel so bad. So love to you, Margaret. You're amazing. You're inspiring. We will talk to you anytime. And please follow her to learn her thoughts on state by state, because she as well, brings up some really great points. Unfortunately, this panel could be 5 hours, and I know I've been saying that literally every panel all weekend, but I want to go around and give everyone last thoughts, where people can find you, if you have anything to promote, anything like that. So we'll go around in the circle again. Miss Kay.
Oh dear. Well, if you want to see the unions that have endorsed national single payer, you can go to unionsforsinglepayer.org. And I am also active in the Kentuckians for Single Payer Healthcare, which is our state group. We do have a state group, and our state group here in Kentucky pushes for the national bill. We have no thoughts that we might be able to win this in Kentucky. We've got to win it for the nation. So that's kyhealthcare.org. And we appreciate anything people can do. Come see us on our website.
Awesome. You're wonderful, Kate. Thank you so much for joining. Dr. Malinow.
Well, first of all, it's been a real pleasure to be on this panel. I learned a lot from Steve. I have to say that my understanding of MMT is minimal at best, but I'm very willing to learn and know more about it. So thank you for teaching me all of that. I just want to say that again, that healthcare is a human right, and it is a national responsibility. It cannot be left up to the states. We are given this incredible opportunity right now. This is a crisis moment, and we really should not squander it. So it is our moment to rise up and demand healthcare as a human right. I believe that we do need a bold, beautiful model national bill. And I hope that the activists in this call are going to help us write that, and then find a congressional co-sponsor or sponsor to introduce it. I think that at that point, we can have all activists in every state use it to achieve national single payer improved and expanded Medicare for all. And for more information, you can go to our website, which is nationalsinglepayer.com. Thank you.
Thank you so much. And Steve.
So the big thing for me is understanding how to resource, to prep the runway for all of these plans that we have. It doesn't happen when we pass a bill. We've got to get ahead of this. We need to understand that in order to have enough doctors and enough nurses and enough all the other services, buildings, clinics, you name it, there has got to be prep work done. These are things that take years to develop. Doctors, and we may have to import people. We may have to bring in immigrants to serve in these roles because we don't have enough in this country right now to take care of everyone. So it's important that we figure out what the real resources are and build plans around that, irrespective of cost, and really begin to make that case and realize the tie-ins with the Green New Deal, a job guarantee, and all the other aspects of Medicare for all, that it's not an island, it's not orphan politics, it's literally a part of a whole. It's a part of an ecosystem we need to build for everyone. Now, as far as where you can find me, I'm on Twitter at Austerity is Murder. You can find me SD Grumbine. I'm also the founder and CEO of Real Progressives and Real Progress in Action. Find us at our website, realprogressives.org. And of course, go to our YouTube channels and so forth. And my podcast, which I think is must listen to if you want to learn MMT and all the adjacent aspects of it, is called Macro and Cheese, and you can find it on any podcast platform.
Awesome. Well, much love to all three of you. And Kay and Anna, thank you so much for helping to organize this event as well. There are so many other people who, are behind the screen and things like that as well, that it took many of us to bring this together. And just thank all three of you so much. And I think to sum it all up, I think so many important points were made during this panel. But I think to sum it up is, if everyone who says they support Medicare for all pushed for national as a priority, as the number one thing, not just, well, I support that, but as a number one, talk about that the most, push that the most, get petitions for that the most, fight for that the most. If we all did that, you would see an uprising. People would say, well, it's not going to happen. That's because you're focusing on incrementalism. Just like Kay said, don't be defeatist. Don't say, well, it's not going to pass that way. Well, if all y'all stop pushing and human progress and fight for national, we have a much better chance. So if you take anything away from this, just take the fact that national should be our priority, whether you support state by state or not. Focus on national. So thank you all so much. Again, much love to all three of you. And Andy, you can bring in Luke for our toss-off. Also, I'm going to give the spiel again. So we need your donations for future actions. Badly. So if you can, please go to our website. We are doing a raffle. For every $20 donated, you get a raffle ticket for a badass basket of M for All merch and all kinds of treats and fun stuff, and we will include shipping. Look at all that fabulousness. So you can help us. You can help volunteer activists fighting for humanity and have a chance to win some awesome stuff. That's a deal, right, Luke?
That's a win-win. That's a win-win. And hey, they were talking MMT on the last panel. We're going to talk MMT on the next panel. I just want to make sure everybody knows that a copy of The Deficit Myth by Stephanie Kelton is included in that basket. Encourage any readers who might not win the raffle to also read that book, as I'm sure it was plugged a number of times.
That's for damn sure. We love you, Stephanie. We love you. Well, before we get to a cameo that Fadl Kaboub sent us, I want to, Luke, any comments on the awesome panel we just had?
I thought it was absolutely fantastic. Obviously, I might be slightly biased. I work with Steve on a pretty regular basis at Real Progressives. But I thought that was very informative. And to pair a couple of people who have such an intricate understanding of the policy itself with somebody like Steve, who has this sort of big picture view of the economics, I thought that was a really fantastic pairing. And I thought the panel was outstanding. If you say that you support state by state and your reason is that it will get to national, then just support national. Let's just go for it. Let's prioritize what we all say that we want. I thought that was an incredibly important panel. Thanks to all of the panelists there. That was great.
Absolutely. Don't be saying everyone in, nobody out, and then hashtag state by state. Don't do it.
Yeah.
Don't do it.
100% agree. Yeah.
You want to help humanity? Help everyone. Period. It's that simple.
Not part of humanity. Humanity. Yeah.
What's that?
I said not part of humanity. All of humanity. Yes.
Well, I mean, humanity within these arbitrary borders.
Yes.
More important. They are more important, these people, than all the millions of other people. Yeah. So, obviously I joke, but that panel was so necessary. And we're going to have to clip that stuff up so we can just respond that way on social media and stuff, because also,
it's critically important stuff.
I did do I went on Graham Elwood's show Thursday and I didn't know I was going to, but I did a huge breakdown of some of the problems with state by state. I wasn't expecting to, but it just kind of came out that way. So feel free to tune into that. We're going to give it to Luke, but first and stay tuned. We have more panels after this MMT one as well. But first we are going to go to a cameo by Dr. Fadl Kaboub, who is a incredible ally to us, to MMT, to economics, to progressive ideals, and just a freaking awesome person. Like,
oh, he's great. He's absolutely great.
Awesome.
Yeah, he's great. And just one more shameless plug. I know that Steve floated his podcast. Fadl is a regular guest on Steve's podcast and on all of our platforms. He's absolutely fantastic. Yeah.
He is. Much love, Fadl. So, Andy, if you want to play that.
Hi, my name is Fadl Kaboub, and it's my pleasure to contribute this short video to this wonderful event. My purpose today is to simply provide an economic policy framework, modern monetary theory, to explain how we pay for all the major national priorities, not just a healthcare system, but a federal job guarantee, universal public services of all kinds. And the key message that I want to deliver here is that this is something that the federal government can do, and this is something that states, municipalities, local government offices cannot finance. They can logistically organize the delivery of these services, but they can't have the finances necessary, but the federal government does. So what is MMT? How do we pay for all of these national priorities? And the starting point here is that we can afford all of these national priorities. And I always want to think of these national priorities that we can afford in the US. We can pay for all these things without bankrupting the country, without causing inflation, without any of the scaremongering, fear-mongering that you frequently hear about Medicare for all or any of these universal services. So the first thing we need to deliver is universal public services, green infrastructure, Medicare for all, housing for all, education for all, childcare. All of these things, we can afford them without causing inflation, without bankrupting the country. Number two, this is the second layer of public policy, a federal job guarantee with decent wages and benefits for anybody who's ready, willing, and able to work. So this is for people who actually want to work and can't find decent employment in the private sector. The third layer of this public policy system is a generous income support system for people who can't work or shouldn't work for health reasons and other reasons. So think of it as a three-layered cake with universal services that are provided for everyone. The second layer is job guarantee for people who want to work and can't find anything else in the private sector with decent wages and benefits. And the third layer, kind of the safety net for anybody who can't work or shouldn't work, a generous income support so that nobody's left behind. So the big question is, how do we pay for it? The MMT framework is what I'm offering here for us to consider. MMT highlights the concept of monetary sovereignty, and the sovereign in the US is the federal government, not states, not municipalities. And MMT tells us that there's a spectrum of monetary sovereignty. The US is one of the countries that enjoys one of the highest degrees of monetary sovereignty in the world, like Japan, like the UK, Australia, Canada, and so on. So today I'm not going to focus on developing countries or countries that have very limited monetary sovereignty. The key features of monetary sovereignty, or a high degree of monetary sovereignty, we're talking about a federal government that issues its own currency, the dollar, taxes the public in the same national currency, the US dollar. It's the federal government that never issues debt denominated in foreign currencies. So all the national debt is denominated in US dollars and US dollars alone. And number four, the federal government doesn't fix the value of the dollar to gold or silver or any other foreign currency. So we have a floating exchange rate system, and that flexibility is very important. So we do enjoy one of the highest degrees of monetary sovereignty. Now, does that mean we have unlimited spending capacity? We should print money left and right and spend on anything? Absolutely not. And I'll give you the constraints here in a minute. So the question is, how do we pay for these national priorities without causing inflation and so on? The ultimate constraint is inflation. So the mainstream perspective tells us that we should tax somebody or borrow from somebody in order to pay for these national programs. And once you're constrained by tax revenues and borrowing capacity, you've already canceled half your national priorities, because you're not going to be able to generate enough tax revenues to prepay for all of these services, which is what states and municipalities must do. But the federal government has this additional spending capacity, that bright yellow space. That's not infinite, but it's much larger than what most people think. And it's constrained by that red bar. The risk of inflation is what really limits how much the federal government can spend. So the big question for us becomes, what determines the risk of inflation? And for me, it's two things. The risk of inflation is determined by, number one, the productive capacity available to us, the logistics, the supply chains constraints. All of that tells us that if we hit that limit and the government decides to spend more, then we will have inflation. The good news about this risk of inflation is that productive capacity is producible. We can hire millions of people to expand our productive capacity. And when we do that, we push the risk of inflation further and further out, and we increase that bright yellow space, and as a result have additional spending capacity. But that's only one side of the equation. The other side of the inflation risk is what I call abusive market power or price setting behavior. And here, think of your large corporations that dominate key markets in the economy. They raise prices simply because they can. Think of Wall Street, think of Big Pharma, think of your telecoms, think of price setters during the pandemic that we're seeing right now, oil and gas companies and so on. And that kind of inflation risk is not going to go away by spending less and not having Medicare for all and not having childcare for all. That risk of inflation can only be tamed and eliminated when we tax and regulate their market power out of existence. In other words, we democratize those markets, we make them more competitive, and universal healthcare is one of the key features of democratizing the healthcare system and taming and eliminating the abusive market power of pharmaceuticals and the healthcare industry in general. So once we know what to target in terms of where the lack of productive capacity is, where the abusive market power is, then we turn to our elected officials, the 535 people we sent to Washington, D.C. Their job is to spend strategically to expand productive capacity and to tax and regulate abusive market power out of existence. And now this becomes a question of democracy. Do we have a government of the people, by the people, for the people? Or do we have 535 elected officials in DC brought to you by super PACs, working for super PACs for the benefits of the price setters and the companies that dominate the system? And that's why this question of affording all of these national priorities is a question about inflation, and inflation is fundamentally a question about our productive capacity and corruption in the system. And now we can call their bluff when they say we can't afford it. So this is the paradigm shift that MMT provides for completely shifting the conversation at the national level about all the things that we can afford. So to conclude here, we're facing a systemic crisis on multiple levels. We have a climate change crisis, inequality, poverty, socioeconomic exclusion, and injustice. And all of these crises call for bold and urgent policy action. The problem is that these gradualist and incrementalist policies that we've been pursuing are too weak, too slow, too expensive and ineffective. They don't even work, both at the state and local level and at the national level. So bolder, more radical, transformative policies are possible, desirable, and affordable. And with that, I'm happy to answer any questions via social media or some other format. And I apologize I wasn't able to join you in this event for prior commitments. Thank you very much. Have a great day.
What a fantastic clip from Fadl. And I just want to encourage everybody to look into Fadl's work. He is a professor of economics at Denison, and he's also the president of the Global Institute for Sustainable Prosperity. He does a lot of work on research pertaining to the Global South and talks a lot about MMT. And again, shameless plug, you guys, he's a regular guest on a lot of our shows at Real Progressives. Please don't miss out on Steve's podcast or our other content that often has features Fadl. So for those who have yet to be introduced to me in these panels thus far, I'm Luke Parcher. I'm with Real Progressives and Real Progress in Action. I'm a volunteer. I'm on our leadership team. I'm a student activist and political commentator. And I am just honored and humbled to be a part of this summit this weekend. I think this is incredibly important stuff, and I'm grateful to be a part of it. Huge thanks to everybody who helped put this together behind the scenes. There are so many people who worked so hard to make this happen. And once again, want to plug our sponsors, M for All, National Single Payer, Real Progressives, Yellow Vest Actions, and Indie Left Media. Huge thanks to everybody who participated in making all of this happen. And with that, we can go ahead and bring in our panelists for this discussion.
Hi.
Well, we got Jeff. We got one panelist so far, I suppose. There's Rohan. Okay.
I have multiple voices in my head, so that counts as more.
Yeah, and I think Yeva will be with us in just a moment, so I'll go ahead and do the introductions here. Rohan Gray is Assistant Professor of Law at Willamette University, the President of the Modern Money Network, and a Director of the National Jobs for All Network. His research focuses on the law of money in the in the Internet society. Jeff Ginter is a longtime activist. He is a certified medical assistant and knows the healthcare system as a worker, consumer, and angry human. And that's a fantastic way to close a bio, by the way, Jeff. That's just wonderful. Some of you may recognize Jeff from the tirade that he put Tom MacArthur through years ago, who was a representative in New York there. If you haven't seen that clip, I encourage everybody to look it up. And Yeva Nersessian is a PhD, is Associate Professor of Economics at Franklin and Marshall College and a research scholar at the Global Institute for Sustainable Prosperity. Her research interests include monetary theory, financial instability, and regulation and macroeconomic policy. I want to thank all three of you for taking the time to be here today.
Pleasure.
So just so the audience knows the way that we're going to format this, we're going to let each of the panelists speak briefly here. We're going to start with Jeff, then we're going to go to Yeva, and then we're going to finish off with Rohan. And at the end, we'll have kind of more of a discussion format to build upon the things that the panelists talk about today. So Jeff's going to give us a little bit of an introduction as to why you all should care about the economics here. I know that for a lot of people, they can be passionate about politics, but the economics can seem very dry and boring. I really do sympathize and understand. Jeff's going to help us understand why everybody should at least have a rudimentary understanding of modern monetary theory. And Yeva's going to go into some of the economic details, and Rohan will round things out at the end. So Jeff, if you want to go ahead and dive in.
Okay. So as far as I'm concerned, if you are an activist, if you are a citizen, and you have any interest in any kind of policy of any description, it is a requirement that you understand, at least in principle, the differences between the federal government and what their powers and therefore their possibilities are versus a state or a municipality or a corporation or an individual. Individuals, corporations, municipalities, and states, they use currency. They don't create it. They don't control it. They use it. And they use the currency that is created by the monetary sovereign. As Fidel Kaboub was mentioning just previously, they use the currency of the national government. In our case, that's the US dollar. And there is no such thing as scarcity of US dollars. Why is this important? we have needs and desires, and wants in this country surrounding healthcare, education, military spending, housing, you name it, not to mention, of course, environmental catastrophe, looming down upon all of us. And it's going to take not money, but resources to take care of these things, no matter what your policy position is, whatever your goal is, you need the resources to be able to get it done. The more resources you have at your beck and call that are available to you to use, the greater the chance of your success. And the fewer resources you have, the greater the chance of your failure. So, if you are financially constrained, if you are an individual and you want to be able to buy a car, you have to be able to earn or borrow that money to be able to do it. The more money you can earn or borrow, the more expensive a car you can have. In other words, in order for you to get the resource, the automobile, you need to worry about your finances first. Same thing with a corporation, same thing with a municipality, same thing with a state. Anything they want to do, from construction to hiring teachers to doing anything that they want, they have a financial consideration in advance of them wishing to be able to accomplish the output, the goal, in order for them to be able to utilize the real resources of technology, of materials, of labor. In order to use these things, they have to be able to purchase them. That means they have financial constraints. To the degree that they could raise the money to be able to buy these things and therefore utilize them, they can accomplish their goal. To the degree that they can't, they will not be able to accomplish their goal. Either that means they'll have to put it aside, such as the state of Vermont trying to do its own single payer system. They voted for it. They couldn't come up with the money, so they scrapped it. Or they're going to do a smaller version of whatever it is they happen to want to do. But they're always going to have financial constraints first. The federal government, on the other hand, has no purely financial constraints. They are the creators of the currency. They do not borrow money to be able to pool it into a central place and then dole it out. They don't need to find the financing first. They want you to think that they do, but they don't. And to the degree that you believe that they do, to the degree that you believe the lies, and they are lies, the lies that a federal government is just like a household, only on a larger scale. Every time you hear a politician or a pundit say that the federal government has to tighten its belt, has to get its financial house in order, they are lying to you. There's a possibility that they're just wrong, but the end result is the same. They are wrong and or they are lying to you. The federal government never has to organize the money first. They have to find the resources to be able to get it done. For example, if we want to get single payer healthcare, national expanded Medicare for all, everyone in, nobody out, everything covered, top to bottom, womb to tomb. From pharmaceuticals to dental to vision to mental health to end of life care to palliative care to primary care to cardiology, everything. We have to make sure that we have the resources to be able to do that. We could lower the age of Medicare from 65, where it is right now, down to 0 and have everyone enrolled in Medicare. We can do that now. But if we do that, do we have the real resource capacity to be able to get everyone a doctor who needs to see a doctor, to go to a hospital and find a bed if they need one, to go to a dentist and have a dentist be able to say, here's a chair, I'll be with you in a minute. If we don't, then we're going to have people that have cards, that have a card that says they have a right, but there are simply no resources. We don't have enough already. We have people leaving the healthcare profession as it is because of the way it's set up, it's run. People are getting burnt out. I'm getting burnt out. I can't stand working in healthcare anymore. What started off as a sickness of pharmaceutical companies and insurance industries has metastasized into doctors and hospital organizations. It is finances don't trickle down, but evil and corruption does. So there's a lot of people that want to leave the healthcare system if they haven't already. So if we gave everyone Medicare for all right now, we're going to have problems because there won't be enough doctors, nurses, hospital beds. People will be flooding existing facilities to be able to find services that they have a right to because they have the card, but they're not going to have enough output. There's not going to be enough places for them to go. But as Fidel Kaboub says, those are producible resources. So if we're going to be responsible, we don't want to hear politicians saying how expensive it is. That's immaterial. What is material is, can we pay for a doctor for everyone that needs one right now? If we can, if there is enough doctors, make the payments. That's not a problem. If we don't have enough, then the question becomes, can we produce them? Can we import doctors from other countries? Can we educate more doctors? Can we build more hospitals? Can we build more clinics? These things are producible. And for as long as we can do that, then we do that. And when we're ready, then everyone gets Medicare for all. And maybe we can reduce the age of Medicare slowly as we bring these resources online. And only when we get to the point of we don't have enough resource capacity, there's no one left to hire. There's no more bricks that can be made. There's no more steel that can be mined and utilized. Only then do we have our first real constraint. So if you're saying that Medicare for all, that healthcare is a human right, it cannot be a human right if there are financial restrictions preventing you from accessing healthcare. It can only be a human right when we have the resource capacity to create that system where everyone gets healthcare, equal quality healthcare, the greatest quality the world has ever seen. We give gobs of money to the military so that they can utilize our vast resources. I don't care that they get money. I care that they take all our resources. So if we can do that same sort of thing, throw all kinds of money, whatever it takes, to get the resources in place to give the best healthcare for everyone, then it can be done. And no one will get that if they think the federal government is just like a household. We will never get the Green New Deal. We will never get education for all. We will never get healthcare for all because we've been trying to do that for the better part of 100 years. And we hit the same roadblocks every time. We win the moral argument every time. Every time we win the moral argument. But we always fall down on our asses when it comes time to actually implementing it because people who otherwise agree we should have healthcare for everyone. I absolutely agree. And then some politician somewhere says, yeah, but it's going to be really expensive. Do you know how much your taxes are going to have to go up? Oh, well, now suddenly someone who would have been an ally becomes in opposition. Even if their only opposition is passive, they won't vote for it. They won't fight for it. That's still opposition. But if everyone who believed in the policy, if everyone who believed in the morality stood up and fought for it, and more people will when they stop being afraid of how expensive it is. If they got up in front of politicians and pundits everywhere and said, absolutely not. I do not subscribe to the I should be afraid of how expensive it's going to be. I know where the dollar comes from. I know who creates it. I know what causes inflation. So you can sit down and shut up, sir. If you're either going to get it done or you're going to get out. If we had people like that, if we had citizenry who was engaged and knowledgeable like that, then nothing would be able to stop us. Nothing. We outnumber them. The only thing we lack is the education. So when Eva starts talking and when Rowan starts talking, please pay attention. There is nothing more important than what they're about to tell you. Because literally, our lives hang in the balance. And I do not use hyperbole. Thank you very much.
Thank you so much, Jeff. Yeah, I think that MMT once Stephanie Kelton put it as when the MMT coin drops, you realize the suffering is gratuitous.
Yes.
And I think that's a very key thing for people to understand. It's like I was angry enough about politics, and then once I understood MMT, it was like, oh, this isn't mismanagement and incompetence. This is an out and out choice. And
it's a corruption.
Yeah, exactly. And that drives a different, to have that understanding, I think, is incredibly important. And the only blockade that we seem to run into is the how are you going to pay for it question. I appreciate you breaking that down.
And with one more aside, when we talk about, corruption, I want to just take 2 seconds and drive this home, because I know a lot of people, when they talk about this, they'll say, oh, Medicare for all, it's socialist. This is socialist. This is socialist. It leads to communism. It leads to there is suffering under socialist regimes. There is suffering under capitalist regimes. Suffering does not get alleviated because of the ist you put after the ruling party. It's corruption that's the problem. If you want to have capitalism, fine, but you're going to have to deal with corruption. That's on you. If you want socialism, that's fine, but you're still going to have corruption, because the people that populate both socialist and capitalist systems are human, and they're prone to corruption. And the only way to get around that is to make sure that there is engaged and educated citizenry. So whatever the citizenry says they want, I want capitalism, great, but there are some things that capitalism cannot touch: healthcare, infrastructure, education, military. And there are some things, corruption. Whatever it is you want. If we want democracy, we get to decide what kind of government we want, but we have to be engaged after that happens. We have to be informed. We have to keep them in check, or we're not doing our job, and you don't deserve what you don't fight for.
Absolutely. Well, somewhere Tom MacArthur is shaking in his boots, worried that he's going to have to confront Jeff at some point in the future. With that, I'll go ahead and pass things over to Yeva, who's going to explain some of the economics of Medicare for All.
Yeva!
Thank you. So I guess I'll just do a brief intro to MMT, even though Fidel spoke about it and Jeff spoke about it. And I can try to use some of what I do in my classroom with undergraduates to drive the point home. So there are two ways to think about how the government spends: the financial way, which is the mainstream approach, right? Where are you going to find the money to pay for the spending? And then there is the MMT way, which doesn't ask the question of where you're going to find the money. It focuses on what you're spending on and whether there is stuff to buy, right? That's the important question. We can't find the money, but can we find the stuff to buy, or the resources that Jeff was talking about? So the mainstream approach of where we're going to find the money just equates the government, the national government, with a household. Of course, everybody knows that households have to find income or borrow to be able to spend. And the same thing is said about the federal government. So we have to raise revenue through taxation, or if we can't do that sufficiently and we're running a deficit, then we have to borrow, we have to issue government bonds. In other words, we're running up the national debt, and there is going to be a reckoning time for that. Or worse, we're leaving this debt to our grandchildren who have to pay it. So we're spending today and we're leaving the debt to them to pay. So it doesn't sound like a good scenario either way. So then that limits what your government can supposedly do, because there is a limit to government raising taxes, and then there is the limit of being able to borrow. Well, MMT reverses that and notes that there is a major difference between a government and a household, and that the government is the currency issuer and households are currency users. So users have to find the money before they can spend. And for the currency issuer, it's the exact opposite. You have to spend before you can get the money back. So I have a classroom currency that I use in my classes. I call my currency the Franklins because it's Franklin and Marshall College. And so the first day of class, I walk in and I tell my students that they now owe me a tax of 25 Franklins. And of course, they then wonder how they're going to pay this tax. And the tax is basically for their participation. And I tell them that they have to participate, they have to basically work for me, the government, and they have to sell services to me, so attend lectures or movie showings, etc. And they will be earning those Franklins along the way, and at the end of the semester, they can pay them. If I insist on that first day that they have to pay their taxes that day, none of them can do it because they don't have the Franklins to pay their taxes. So I cannot collect those taxes the first day of class. I have to first spend them. So I have to buy the services from my students, and I have to spend those Franklins into existence before I can then collect them at the end of the semester. So this shows the important point that the issuer of the currency has to spend that currency into existence before they can collect it in the form of taxes. And so spending has to come before taxes. For me, as the issuer of Franklins, of course, there is no limit to how many I can issue as long as I don't promise to convert them into dollars or something else. And the same is true for our federal government. There is no limit financially on how much it can spend. There is, however, the limit with real resources, which is what both Fidel and Jeff were talking about. There is a limited amount of stuff at any point in time that we can buy. So if the government wants to buy more than what's left over after what the private sector wants to buy, then that can lead to inflationary pressures, because the government can always outcompete the private sector precisely because they don't have financial constraints. So they can always pay a higher price, and that way they can get hold of those real resources at the expense of the private sector. And there are situations when this might be justified. You can think of a war, for instance. Of course, we did that during World War II with rationing and price controls and a whole host of other measures. You could also argue that trying to fight climate change could be a good reason to justify those kinds of resource shifts. But that's not really the norm for our economy. Usually there are unemployed resources left over. Capacity is not fully utilized. And of course, we always have, in even best of times, about 4% unemployment. And that's the official unemployment rate, which can understate the actual employment situation. So resources are usually available. We usually leave them underemployed rather than overemployed, right? We don't usually hit that constraint that Fidel was talking about. And of course, that constraint is not fixed. We can through investments, we can expand that as well. But there is an important role for taxes to play in situations where we do hit that limit or we're close to it. Taxation can withdraw purchasing power from the economy, thus creating room for the government to try to get access to resources to pursue its priorities, to pursue the public purpose. It doesn't pay for spending, right? It's not there to pay for the spending. It's just used to create room for non-inflationary spending in the economy. And it's important to understand that when taxes are paid, what the government gets back is its own IOUs. So in case of my Franklins, right, what I get back when taxes are paid are my own IOUs. And I don't need to save them to pay the students next semester, right? There is no way for me to save them. It's all electronic entries, right? I just, do that all electronically with an Excel spreadsheet, and I don't need to save them. I cannot save them. In fact, because they are my IOUs, there is no way for me to save it. I do another exercise with my students in the classroom. I tell them, okay, take a piece of paper and write, I owe the presenter of this note $20 and sign it, right? And now put it in your pocket. So your own IOU in your pocket. Are you richer than before? And of course, the answer is no, you're not, right? Your own IOU in your own pocket is worth nothing. The same way when IOUs, the government IOUs go back to the government when taxes are paid, they're really worthless. And so, there is no way for the government to save its own IOUs. So it's important to understand that money is a tool that the government uses to mobilize resources and to hopefully fully utilize them and to pursue the public purpose, the national priorities that Fidel was talking about, whatever they might be. Now, how does all of this apply to Medicare for All? When you approach it from this mainstream taxes pay for spending approach, then you say, of course, obviously the government is going to spend more, so we have to raise taxes to cover that spending. But if you approach it from a real resource perspective, you actually come to completely different conclusions. So from the real resource perspective, one issue, which is what Jeff mentioned, was the availability of resources needed to provide healthcare. So doctors, nurses, medical assistants, equipment, drugs, hospital beds, and so on. So all of that is important. And those resources might not be there in the first instance. And so the question then is, how do you create them, right? How do you ensure that we do have hospital beds and doctors and medical assistants and whatnot? But another issue is whether with Medicare for all, we're, as a society, we're going to actually need more resources, or whether we're going to need less, right? We will need more specific kind of resources, such as doctors and so on. But overall, the question is whether Medicare for all represents an increase in total spending, or it's actually a decrease. And I would argue that it's actually going to decrease the total demand on resources. How? Well, if you look at how much the US spends on healthcare, we spend about 18% of our GDP on healthcare. The next comparable country is Switzerland with about 12%. So they spend 12% of GDP on healthcare. And after that, it's France and Germany, and they spend something like 10 to 11% of their GDP on healthcare. So 18% versus 12 or 11% of GDP, right? So we are spending a lot more than our peers in Europe, for instance. So you could say, well, maybe that's because we're getting more real stuff, right? So we get more hospital beds and more doctors and nurses and so on. But study after study shows that that's actually not the case. We don't get more real healthcare services. We just pay more for the same amount of services that other peer nations are getting. And of course, the drug prices, that's no secret for anybody that we're paying a lot more for the same drugs here than they're paying in other nations, including European nations. So that's well known. But it's not just about drugs. It's also about compensation in general in the healthcare field, which is much higher, sometimes 1.5 to 2.5 times higher in the United States than in other comparable nations. So that's another thing that's driving it. So costs in general, prices are higher here, and that's what's driving our increased spending. So we're getting the same amount of real stuff, but we're paying more for it. That's one issue. The other issue is higher administrative costs. And this is where our private insurance system comes into play. So we have this middleman that intermediates between those who seek healthcare and those who provide healthcare. And this middleman is, of course, earning money in the process. And that adds to the administrative costs of our healthcare system. And so with a Medicare for all, you would be eliminating this middleman, right? For all practical purposes, you would be eliminating the private insurance industry. So you would be cutting your spending that way. So think of all the people who are employed in the private health insurance system. They would lose their jobs. They would become unemployed. They would lose their income, right? And we'll come back to this question. So in other words, this would lead to a decrease in spending and not an increase in spending, right? So that's that. And there's also the question of hospitals and doctors' offices having all these billing departments because they have to deal with different payers, private insurers, and the government and the individuals. And so they're spending a lot of administrative costs there too, that they have to hire these people to get the money for the services rendered. And just to give you an idea, we spend about 8% of our healthcare spending on administrative costs, and other nations spend between 1 and 3%. So they spend between 1 and 3% of their healthcare costs and administration. We spend about 8%. So if we can cut the prices, which a single payer system would do, and if we can cut administrative costs, which again a single payer system would do, then we will actually lower how much we're spending on healthcare. So if we conservatively say estimate and say we're going to go down from this 18% somewhere in between us and Switzerland, right? So let's say we're going to bring it down to 15% of GDP, which will still be higher than every other nation that's comparable to us, right? So even if we're spending 15% or 14% of our GDP on healthcare, we would be high up there, but that means that we would be lowering aggregate spending in the economy by about 3 to 4% of GDP. Okay, so we're not going to spend more as a society, although the government will be shouldering more of that spending. As a society, we will be spending less. So in a sense, Medicare for All is deflationary rather than inflationary. It's going to release resources on aggregate, right? So all of those people who will now be unemployed, you can then use them to pursue other priorities, such as greening the economy and whatever else you want to do. That then means that if you want to raise taxes, which is the conclusion you come to from this financial approach, then you are doing the wrong thing, because raising taxes is freeing up resources, right? And you raise taxes when you need the additional resources. In this case, we are freeing up resources by implementing Medicare for All. So if you, on top of that, you also raise taxes, you're going to do the opposite of what you need to do. So all else equal, you could say that a Medicare for All would lead to the need for a tax cut rather than a tax increase, because of the deflationary impact that it has on the economy. So just to give you an idea of this 4% of GDP cut that we could conservatively expect from a Medicare for All, the Biden Build Back Better, the original form, the two plans together, right? Social infrastructure and hard infrastructure bills together, they were a little over $4 trillion over 8 years or 10 years, something like that. So that came to about 4% of GDP, more or less, per year for, say, 8 or 10 years. 4% of GDP, right? And an increase in spending. So if you were to lower spending with Medicare for All by 4% of GDP, then you would be adding that additional 4%. If you implemented the complete Build Back Better, then you would be offsetting this decrease in spending with an increase in spending. But I'm just mentioning Build Back Better because that was seen as such a huge program of spending, right, that we couldn't afford, that we didn't have the resources to do it. What I'm saying is that if you combine that with something like a Medicare for All, you would actually be finding the resources needed to implement those spending programs. So to sum up, when we look at government spending from this financial pay-for perspective, we can actually come to the wrong conclusions about what needs to be done. And a Medicare for All is a perfect example of that. Financially, we can afford it. The government can pay for it just like it pays for everything else, just like it paid for those stimulus checks that we all got, right? One day you just woke up and there was more money in your account. Well, how did that happen? Well, it happened because your bank increased the number in your account, and the Fed increased the number in your bank's account at the Fed. And that's how all government spending happens, right? The Fed, Congress, Treasury, they are all involved in this process, and there is no financial limit on that. The real issue is resources, and whether we have the right kind of resources that are tailored for the healthcare system, such as the doctors, the nurses, the hospital beds, and so on. And this is where you might say, well, a comprehensive approach like a Green New Deal is even better, because if you include subsidized education there, then you kind of solve your problem to some extent of not having enough medical professionals, right? Or not needing to pay them as much because they have all this student debt that they have to pay back. And that's why, their salaries have to be higher to compensate for that. So I'll stop right here, and I'll be happy to address questions later. I'll just conclude by, reiterating the point that money is a tool that we can use to mobilize resources to pursue our national priorities, and that's the right way to think about money.
Yeah, I think there's a lot of misunderstandings about how Medicare for All would be deflationary, and I appreciate you breaking that down. I think that the conversation surrounding tax policy with programs like Medicare for All is often a treacherous conversation, to say the least. So Rohan, if you want to go ahead and kind of fill in any blanks that you see here.
Yeah, sure. First of all, thank you for having me. It's a pleasure to be on a panel with Yeva and Jeff. I think the first thing, and not is just to sort of unpack why it is, I think, beyond just the economics, which Yeva just laid out, the framing around taxpayer money is so problematic. I'll get into specifics about Medicare for All in a second, but I think the first thing is just to think about what it is when we say taxpayer dollars, what we are implying here. There's a couple of things. First of all, we're giving the impression that before we can conduct any coherent, rational discussion of an investment program or a spending program, the first thing we need to address, the most important political question, is how to find the money. Not necessarily how to ensure it's inflation neutral or how to ensure that it's the best place to find the money, but if we cannot identify a single pay for, we actually can't go ahead with the policy. And I think this is wrong. There are plenty of policies that we propose, and certain questions are not worked out until later, or they're not worked out until after we've got agreement that the general policy is worth doing. Just to give an example, we've had public education systems, universal right to education systems going back to the mid to early 19th century. And the question of what we're actually teaching is an evolving question. It's still up for debate. If somebody said back in the 19th century, I think we should have a universal right to education, and someone said, what does that mean to you? And then they sort of listed the specific curricular requirements of any high school in the country right now, they would look at you like you're crazy. But that didn't stop us from being able to have a debate about what a right to education looked like back then, or to say that we should have it and have it to be administered through public institutions funded with public money. And the reason this is important is because what we mean by Medicare for all at the sort of filamental level, at the level of particular people getting particular amounts of healthcare, is going to be up for debate. How we administer it, how we provide that service to people, is going to be a matter of debate. And we are not saying that we should hold off on advocating for Medicare for all until we solve all of those questions in a specific way. We acknowledge that this is an ongoing, iterative, experimental process. Yet when it comes to the financing, the assumption is we need to have one fixed answer for where all this money is going to come from. Otherwise, we can't do anything. And I think what the MMT analysis shows is if you want to pay for something, as Stephanie Kelton says, if you have the votes, it's paid for. Now, does that mean the economic effects are going to be optimal? Maybe not. Maybe you want to be constantly revising, assessing, experimenting with how to best manage the economic effects of that program. But the idea that we cannot go ahead with a commitment, the idea we cannot start enacting Medicare for all until we've resolved every possible eventuality regarding inflation or anything else, I think is just wrong. It's not how we decide whether or not to spend on the military or spend on any other national priority. And it shouldn't be when we're talking about something so important as healthcare. The other aspect of the taxpayer narrative is that it's overly narrow in its framing of how demand and sources of spending actually affect inflation. And what I mean by that is that right now, and for most of, for example, US history, but certainly the history of other countries, the default state of being is that the government is running a deficit. It's injecting more money into the economy than it is taking out. That is increasing the net savings of private actors. It's accumulating elsewhere in the world with foreign outflows. And nothing is unsustainable about that net deficit position. But we get confused that the deficit is financed or is accompanied by the issuance of bond sales. And as a result, think that what we're doing when we run a deficit is fundamentally different than creating money and injecting it into the economy. We're not creating money, we're just borrowing money, which means it's somehow only using the existing stock or the existing supply of money, so it kind of doesn't count. And I think that's wrong, and that's what one of the things that MMT shows is wrong, is that whenever you're running a deficit, whether the instruments or the funds that you're spending into the economy end up staying there in the form of reserves or physical currency, or more commonly perhaps bonds, the effect is largely the same. Printing yellow money in the form of bonds or printing green money in the form of reserves, as Stephanie Kelton says, doesn't have too much difference. So when we're looking at the question of how to fund something, at least in my opinion, the default presumption should be we just spend the money into existence. And then we can look at whether or not that has effects we want to mitigate. The other thing is to think about the fact that at any point in time, there are all sorts of sources of credit-led demand in the private sector that have an equivalent economic effect to creating and injecting money. Not in every sense. There are ways in which that can be more destabilizing and have distributional effects. but in the sense of generating purchasing power. And the example I use is if somebody goes to a bank and wants to get a loan to fund the development of a new casino, say in Nevada, you're going to have to get bricks and electrical engineering capacity and construction labor and all of those kinds of things to make that casino, just as if you got money from the government to build a school or a hospital. We don't look at the source of private credit and put it next to the source of government spending when we hit real resource barriers and say, oh, there's too many bricks being used. Maybe we should have less casino loans so that we can keep the same amount of schools and hospitals. We say, oh, there's inflation. We should be spending less on government spending programs. Meanwhile, all of these sources of private investment stay invisible. They stay invisible to our narrative. They stay invisible to our number crunching that goes on the news and all those kinds of things. Why this is important, I think, is because when we're looking at questions of real resource capacity and what is laying claim on real resources, there's a tendency, even I think for people who've heard the MMT 101 story, to assume that the only place to look is with the public spending side of things. Whereas in reality, at the point we start coming close to real resource limits, we always and must look at both the private investment and public spending channels in parallel and evaluate where our respective priorities are between what those two systems are doing. The last thing about the taxpayer money point is just that when we think of money coming exclusively from taxpayers and not from A, the infinity sign in the sky that the government has access to, or B, private credit always being generated out of private relationships in that sort of negative space between creditors and debtors, we center the taxpayer as the sort of dominant social actor at the heart of our fiscal system. If we don't have the ability to tax people enough, if we don't have the ability to extract more resource space from taxpayers, then we don't have the ability to do anything. In the sound finance narrative, that's literally money. But even in a sort of crude MMT narrative, that's the idea that the first place that we should be looking to free up real resources is on individual taxpayers. The reason this is a difficult starting point is because oftentimes the very, very rich are not consuming the resources that we might actually need to build core public infrastructure. So if we're talking about freeing up resources through taxation, that might actually mean suppressing the purchasing power, consumption power of those most in need of having that protected, the very poorest people. And we're seeing a sort of example right now with the fact that the COVID response actually helped protect a lot of incomes at the lower end. And as a result, a lot of people had purchasing power that they invested in things like goods that were suffering shortages that we're now seeing price pressure in. And one response to that is, well, we should, raise taxes to suppress demand. But raising taxes on Elon Musk and Bill Gates is unlikely to stop the demand for second-hand cars, for example. So if we're really talking about suppressing demand in that context, we're talking about taking money back away from the very kind of people that might be in a position to purchase goods, which really means the people whose incomes we were trying to protect in the first place. So when we center the taxpayer themselves, what we're often doing is centering those with the ability to pay and saying that they are the sort of goose that lays the golden egg that we always have to modulate their ability to pay in order to free up real resources. But in fact, as I just said, in the long run, it's that new expansion of purchasing power. It's the ongoing sources of government deficits. It's the ongoing sources of private credit investment that are not taking from somebody else, but are actually just expanding sui generis not out of thin air necessarily, but out of individual relationships. That is the most important long run source of additional demand and purchasing power. And the fight over that, I think, is a much more constructive fight than the fight over pure redistributionist policies, especially when they're likely to hit real people. Second point is about this idea of real resources. And I think one of the challenges here is when you think of dollars, it's really, really easy to treat them as fungible. You need more capacity over here. You take it from over there. How do you know you've taken the right amount from over there to increase spending capacity over here? And the answer is that the dollars are the same. You need $1 billion over here. Well, you just tax $1 billion from over there, and then look, the numbers add up. What MMT encourages us to think about is the fact that those numbers are not always equal. And then again, a simple example I use is you give $1 billion to a school lunch program to provide free milk to kids, and you take $1 billion away from Bill Gates. Is that likely to have a neutral effect on the price of milk? No, of course not. Bill Gates is not spending $1 billion on milk in his household every week. And similarly, the Mississippi Lunch Program is likely to put all of that money into milk. So the effect on specific prices is likely to be quite different depending on where you send that money. As a result, when we think about real resource capacity, we need to not think of it as a purely fungible sort of abstract ball of demand or ball of productivity, and think about it in terms of specific resources, specific needs. And what that means is, if we are looking at real resource constraints in the healthcare sector, for example, we need to have a very targeted set of policies designed to increase that capacity. And I'll just give a couple of examples. The first one, the most obvious one that I spend a lot of time thinking about, is intellectual property. We currently have a regime where copyright, patent, and to a lesser extent trademark and other things play a very large role in the distribution of wealth, income, and power in sectors like healthcare that rely a lot on knowledge and rely a lot on technological advancement for productivity increases. Currently, we have a system where a huge amount of public money, both through universities and through other research investment, goes into private research that then the results of which are allowed to be captured by those actors and turned into intellectual property goods that they can then monetize and charge rents on, even when the initial investment comes from public money. The National Institutes of Science, National Institute of Health, university grants, all those kinds of things that are using public money end up creating privatized goods. The result is that we monetize and commodify a very large part of the knowledge commons in ways that, even if we spend, even if you pay, drastically alter the ability of others to build on that knowledge and to grow from it. And to give one basic example from the world that I come from, it will often cost $30, $50, even $100 to access an academic article through one of the publishing houses like Elsevier. Now, the effect of that is that most people do not have access to that information. Whether or not most people are going to use it is a different question, but the number of people that might have a brilliant breakthrough or have something to contribute to that conversation that currently don't because they're excluded is very high. Now, one way to fix that would be to give every university and every researcher access to a paid Elsevier account, subsidize it, give everyone a sort of a research library access credit. The other option would be to attack the patents, the copyright system that allows Elsevier to charge those prices in the first place. They have very, very different effects. Just as promoting open patents or an alternative way of conducting pharmaceutical research is very, very different than letting private actors conduct that research and then trying to buy the products at market prices or at some sort of price that is set within markets but subject to the government's strong bargaining position as a monopsony buyer or something like that. So what that means is that if we really want to think about real resources here, we need to go beyond just saying we're going to sort of tax demand and free up space to actually look at how we are going to revitalize that ecosystem so that the resources are not being constantly privatized. Another example from where I come from, Australia, we have a public healthcare system there. It's a hybrid system with private healthcare. But even with that public healthcare system, we have been dealing with questions of bottlenecks and shortages, particularly in specialized areas. We're a small country with a relatively small population, even though it's quite highly educated and skilled. And a colleague of mine who works with the Shadow Health Minister and talks about this a lot, which is that the access to specialist qualifications is largely restricted on the supply side by the existing specialists in those disciplines. So if you're doing, thoracic heart surgery or something, to be accredited as a thoracic heart specialist, you need to do your regular medical training and then go through specialist training and then go through additional specialist training. But then you might have to sit an exam, and the passage rate on that exam, the passing level, is set by the board of thoracic surgeons, who decide they only want 3 to 5 new surgeons a year. Because if there are more than that, then the price of their living, their profession goes down. The value of the services they provide, or the ability that they can have to charge higher rates, goes down. So you can have free healthcare training. You can have medical school be largely free. You can have a free healthcare system or a public healthcare system and all those things. But as long as you have this bottleneck at the very top of the thoracic surgeon profession, you're going to have an undersupply of that particular service. The same is true for all sorts of other highly specialized areas. And there isn't really a demand-led solution to that. It requires, again, a sort of change of the regulatory regime, a change of the industrial structure, and potentially picking a fight with the very healthcare providers who you're going to need to have on the other side actually providing these services. This isn't an easy challenge to overcome. This isn't an easy political problem to deal with, but it does require us to understand that the problem here is nothing to do with whether we can pay for it, but rather the process by which people will take prices and will let people into specific professions. The last point on this is just when we think about price stability itself, the same problem emerges, which is that we can't simply press a button and make more hospitals or make more doctors. It takes time, and it takes a reorganization of existing resources, which in the meantime can be destabilizing, or can require the sort of disemployment of resources in certain areas before it will show up in other areas. Right now, we don't have perhaps enough people becoming nurses or social workers or other things like that. But one of the reasons for that is because there's a lot of other industries that are attracting people into them with promises of higher incomes and more stable careers and better quality of living and those kinds of things, which, as long as they exist, will always be there as an alternative to doctors and to nurses and social workers. If you promise to make social work training free and increase the pay available to social workers, that doesn't mean that's instantly going to sort of make it an adequate alternative, as long as other industries might be able to, again, outcompete or often even higher wages for the kinds of people that we need to become social workers, nurses, things like that. The effect there means that we need to think very carefully about not only making sure the money is there, but making sure the broader social structures, values, culture, and things are there, such that people can feel safe and feel accepted and feel successful in becoming part of this new program. And just to give one example of that, and then I'll close up, the Civilian Conservation Corps in the 1930s was responsible for planting millions of trees. It's one of the examples that myself and other MMTers often talk about as a great example of how a job guarantee could help with a Green New Deal or a sustainable transition. But one of the ways it did that was it took a lot of 18 to 21-year-olds, often men, people that otherwise might be joining the military or something like that, and had them live in camps, very far away from their homes, often sort of the equivalent of a long distance, a long-term hiking or something like that. They were kind of on the road doing this work, living with others in almost like barracks situations. A lot of people might not want that kind of lifestyle today for various reasons, or if they were going to have that lifestyle, we would have to make sure certain amenities were available to them. The same thing is going to be true when it comes to something like a public healthcare program. If you're looking for example, people to go into rural areas or to provide services that might be available 24/7, requiring people to work night shifts that otherwise might want to be connected to their children during the day, or connected to broader social services that are only available from a 9 to 5, those kinds of things. Right now, if you work those kinds of night shifts, then you accept that you might not have access to all of those services and amenities. But if we really want to make them attractive in the future, then we need to be thinking about that broader conception of resource allocation and production beyond simply the direct services we need for provision of healthcare, but rather making universal, permanent, all the time service availability something that our entire economy and society is geared around. All of which is to say that the question of how to pay for it is a very complicated question, but has much less to do with money than it does to do with social structure and industrial structure. And the quicker we can get away from centering the taxpayer as the sort of goose that holds the golden egg of money, and more towards the questions of labor and industrial structure that are really going to affect how we provide healthcare, I think we're going to be in a better place. Thanks.
Thank you so much, Rohan. Fantastic presentation there. I wanted to actually ask Jeff about to tie in what Rohan was talking about first there, the taxpayer rhetoric, and kind of closed on. Jeff, can you for the audience, can you tie that into the political discussions that we are often stuck in, and why? I think old habits die hard, and a lot of people have just been so used to saying taxpayer dollars, this and that. Why is that harmful to progressives arguing for policies like Medicare for All?
Okay, well, there's two reasons, and Eva and Rohan, those were amazing talks. Thank you very much. But in addition to the taxpayer myth being counterproductive, as Rohan was saying, it's not about finding the money. That's not how you organize. You got to organize the resource capacity. You got to realize what the actual constraints are. To being able to get what you want. It's material, it's labor, it's technology. If you have these things, you're good. If you don't have these things, can you build them? And part of building them is enticing people to join. This is a huge part of the conversation, but we never get to that conversation because taxpayer dollars, taxpayer dollars, taxpayer dollars. We also have, progressives who buy into the taxpayer dollar myth are also knowingly or unknowingly, willingly or unwillingly, are buying into the racist, classist issue of taxpayer dollars. Taxpayer dollars has been used down through the centuries to mean some people are worthy and other people are not. I pay more in taxes, ergo, I am worth more than you are. I deserve more resource capacity than you do. Even if my tax bracket says I only pay 5% tax, I'm rich, but I paid more monetarily than you do, ergo, I deserve more. When we speak about taxpayer dollars, it's been shown that when we think of taxpayers, we think generally white men. We don't think women. We don't think people of color. It's a very sexist, classist, racist trope that says some people are deserving and other people are not. So in addition to it being functionally counterproductive to everything progressives say that they want, because that's not how federal finance works. If you're talking state-based, sure. But if you're talking federal-based, where the policies we need to create rights must originate, then not only are you totally counterproductive, that's not how it works, you are also condemning people who don't look like you to deprivation, misery, and eventual death. It is no joke. It is no hyperbole. We need to abandon the very notion of taxpayer dollars, taxpayer dollars, taxpayer dollars at the federal level, because it's not how it works, and it's racist as hell, and it needs to stop.
Well, and I think it's also almost kind of granting home field advantage to our opponents in these debates, because we're operating in their framework, right? That it's this tax to spend. Yeah. It's almost conceding a point in a sense. I got a question here again from Jonathan Cadman, who's one of our fantastic writers. I'll direct this one at Yeva. He asks, what prescription does MMT have to replace the lost productivity and demand of the millions of jobs that would go away when the insurance industry is eliminated? And why is the federal government more suited to pull it off? I think he might be teasing the job guarantee there. If you could go ahead and dive in on that.
Sure. So I mentioned of course, there is the job guarantee, which is a part and parcel of MMT, has always been. But you could also bring in a Green New Deal into this, right? And I think the comprehensive Green New Deal, at least the way I think of a Green New Deal, includes greening the economy. It includes Medicare for all. It includes childcare and education and so on and so forth. So Randy Ray and I wrote a paper a few years ago on how to pay for the Green New Deal. And our argument was that this comprehensive approach where you combine different policies is actually a benefit, because in this case, you are withdrawing spending with one hand and you're injecting it with the other hand, right? So yes, you're going to need fewer of those administrative jobs for healthcare, but you're going to need more of them to administer the greening side of the economy, right? So now, of course, there is the issue of skills mismatch, right? Somebody who's working in a billing department might not be well suited to build wind turbines. So there is that, of course, issue. And that's where the job guarantee comes into the picture, right? To pick up all of the people, at least temporarily, who are unable to retool and find a job elsewhere in the private sector. But I would say combining it with something like a greening the economy, where you do require resources, right? And then with Medicare for all, where you're going to take away some of that spending, I think that's a good idea. And of course, in the current environment, you could say, if we're so worried about inflation, right, that everybody keeps thinking that the current inflation is a demand side issue, which I actually disagree with. I don't think that's the case. But you could say, okay, right now some disinflationary policy could actually be useful, right? And some people have floated the idea that if we do want to control inflation, at least the inflation that is felt by American people, then controlling healthcare costs would be an important step toward that. And of course, Medicare for all, one of the main things that it does is controlling the healthcare costs of Americans, right?
Absolutely. And Rohan, you had mentioned the sort of the order of operations of this all, how the policy is constructed in terms of when does the finances come into question. And this may seem a rather naive question, but I'm just curious, what do you think distinguishes the different issues in terms of when we seem to care about the financing right off the bat? On a Green New Deal or Medicare for all, we certainly highlight the financing right off the bat. But when it comes to military spending, things like this, there doesn't seem to be much debate or discussion about that at all.
Yeah, I mean, I think it's a question of who gets to set the conversation, right? There are people who, whenever they want to have spending on things they care about, either just don't talk about pay-fors, or they come up with a very glib response and everybody accepts that as acceptable and moves on. I mean, when Paul Ryan wanted the tax cuts that got passed early on in the Trump administration, what did they say? They said it pays for itself. That's it. That was it. That was all they needed to say. It was two sentences, and they just moved on. And massive hole in the budget, but don't worry, some point, yada, 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 in the future, it'll pay for itself. Now, the exact same argument can be made by all sorts of deficit spending, that it'll increase growth and that'll increase tax revenues. The deficit will come down on the back end. We're even seeing the deficit come down even now as a result of the spending that happened a year ago. But why is that not an acceptable answer? Because the same people that thought it was an acceptable answer for the things they want to spend don't want to spend on these things. So they just create a double standard. And the problem is, everybody else thinks that the right way to fight that is to play within that paradigm. And I understand it. It comes from, I think, decades of hegemony where those people do control the narrative. And if you don't play within that paradigm, you don't get paid attention to. But it's a losing framework. It's a position of weakness from which to argue. And it will always put them in the driver's seat. Why? Because they set the agenda. They set the narrative. If you have an answer to a question or an argument they make, they just come up with another one. Why? Because they're always in the position to change the subject. They have the power to do that. If they don't like that you've boxed them into a corner, they don't have to stay in that corner. You don't have any power to keep them there. The only way that we get out of this double standard is to stop starting from whatever the start of the conversation they do and to challenge that. And that means if they say, how are you going to pay for it? You don't start pulling out your envelope and doing the mathematical calculations and find your favorite pay-fors off the shelf. You start treating the question with the contempt it deserves and then talking about the things that really matter. But I think the flip side of that is that we do need to have answers to what really matters here. And, one example of this, I think, is we talk about one of the benefits of a public healthcare system is that it reduces healthcare costs on average people. The assumption there is, I think, that if we do this right, people will have more money in their pockets than they have today that is currently going to healthcare spending. Now, does that mean that that's going to be inflationary because all that money that was currently going to healthcare is being kept in people's pockets, plus there's more money coming from public spending? I don't think so. In part because right now a lot of people fund that by going into debt, that the actors on the other side of that debt-based healthcare system are not necessarily spending that money the same way, but also that there would be more productive capacity in the rest of the economy if we unleashed that spending that's currently being suppressed because it's going towards healthcare spending. But that's a kind of much richer conversation to be having than to constantly be pointing out why this other stuff is wrong. Because even then you're still kind of centering the enemy, if only to be antagonistic towards it. So I think there's a lot of really constructive conversations that people interested in a public healthcare system could be having, especially experts, especially healthcare providers in this kind of summit, that go beyond them playing macroeconomist and trying to do the budget envelope calculations and say, look, I've fixed the fiscal ship, as Brookings says, and instead focus on things that they know about because they've been in these industries and saying, hey, we could make it easier to provide this, provide that, if we did this change. How could we fund pharmaceuticals in a different way? How could we encourage people out into rural provided services? How could we change the quality of living for the average nurse so that people really, really wanted to be a nurse even when they had options to go to Silicon Valley and all that other stuff, and didn't feel like it was a sort of profession that never in a million years would they consider? Those are questions, I think, that if we can keep the conversation there, we'll be much more productive, and then we can dismiss these silly pay-for questions because we're talking about a much richer set of problems.
Absolutely. And I hopefully for the audience after these presentations, it's obvious that there should not be any morality applied to a deficit or a surplus. But Jeff, I'm hoping that you can maybe touch on how do we get through this sense from voters, I think, that advocating to spend more publicly is irresponsible. They're operating from their own framework in their lives, where in their household, if they're deficit spending every month, that probably is inherently irresponsible. Can you just help break down that paradigm a little, or break through that, I guess, a little bit?
Yeah, the best way that I've gone through this, and it can't be done online. I'm off social media. I have been off social media for 6 months, and my mental health has never been better. But when you actually have conversations with people, that's where the change happens. So if you're an introvert, then it's not going to be you. I get that. But write something, write a song, write a poem, write anything. We need more avenues of communication of this information. But when you're having conversations with people, you meet them where they are, understand your audience. There's no point in beating them over the head if that's only going to make them get angry. My overarching philosophy is there are some people who will not wake up if you're shaking them. They will just get angry. And there are some people who won't wake up until you shake them. Know who you're dealing with, know where they are, and give them the information that will, either in that moment or in days, weeks, and months to come, will eventually get through. And if you're not getting anywhere with one person, don't take it personally, move on to the next. We don't need everyone. We just need enough people. When I say that we need a general strike, I'm very serious that the only way we're going to get the policies that we need is not just from people waking up one day and realizing how we finance it and then pushing for it. Pushing for it is going to take the form of disruptive behavior. You're not going to do it at the ballot box. You're not going to do it with a sternly worded letter campaign. You're going to do it with a general strike or something like that, something that will bring people to the negotiating table and give them no other option than to listen to us for the first time in their pathetic lives, other than corporations, which is what they do right now. And in that dynamic, we don't need everyone to be disruptive. We don't need everyone to strike. We don't need everyone to take those kinds of risks. But we do need more people to provide cover for these people. These people are going to need homes. They're going to need food. They're going to need logistics. They're going to need lawyers working pro bono. There's going to need to be doctors and nurses who are willing to be street medics. There needs to be truckers who will allow medications to fall off the truck and be discovered. There's going to need to be all manner of things. We don't need everyone doing everything. So the same thing with MMT knowledge. We don't need everyone. So you don't need to convince every person you come into contact with. You just need to convince enough people. So whatever it is you're doing, just keep doing it, do more of it, get better at it, get better at communicating it. Watch videos from Rowan and Yiva and myself and Steve Grumbine and Stephanie Kelton and Scott Fulweiler, et cetera, because each one of these excellent people have a different story to tell. They have a different way of communicating. And the more ways you can say the same thing that means the same thing, but you're wording it in a different way, one of those ways is going to reach the person you haven't been reaching.
Yeah,
so,
I think it's really important to it's interesting. We talk sometimes at Real Progressives about like who kind of got through to us, and it's interesting to me how it's a little bit different for everybody, right?
Yeah,
I digested a lot of MMT content, and it happened to be a lecture by Randall Ray when it kind of all clicked. At least the rudimentary level kind of all clicked. I think for everybody, hearing it slightly differently is valuable. So you just have those discussions and know who you're talking to. Yeva, you talked a little bit there about inflation and how Medicare for All would be deflationary. Just because inflation is such a major topic right now, can you break through the sort of oversimplification that inflation is just a result of a demand side issue and overspending?
Sure.
Milton Freeman.
It's good that you asked, because Randy Ray and I just published a paper it's on the Levy website, and we also had an op-ed in The Hill basically arguing that the Fed is not going to solve our inflation problem because all the faith is in the Fed. And this stems from this simplistic idea that the current inflation we see is because of too much demand, right? This is the Larry Summers, and Paul Krugman has joined in as well, story that last round of stimulus checks just pushed us over the limit, and we've reached the limit of our economy, and that's why we are having this inflation problem. But when you dig a little deeper, you see that it's true that demand has returned to where it was in the to its pre-pandemic levels, and maybe has gone up a little bit. But there are just a few factors that are driving inflation, such as rent and oil and transportation in general. So out of the 7% inflation, something like 3% was just transportation, right? And it's crazy that it's 2022 and we're still talking about oil, and we're still talking about OPEC, right? and that, you think back to the 1970s where we had the inflation problem, and we were, driven by that as well. And so we invested in renewables back then, maybe today we would not be talking about that, and we would not be seeing this kind of inflation. So there are still supply chain disruptions, I would say. And in addition to that, there is also the pricing power that Fidel mentioned there, right? Companies taking advantage of the current situation to raise their prices. And they are openly admitting that in their earnings calls, where they have to tell the truth to their investors that this is a great time for them. Profits are going up, and the pandemic is a cover under which they are able to raise their margins and rack up the profits, right? So, that's basically what's happening. Now, you could always argue that had we not given as much relief to American people, we would probably not see as much inflation. So if Americans were poorer, they had less money to spend on those used cars, then there would be less of a price increase of the used cars, right? You could always make that case. But some people like Jason Furman were making that case, like if we had accepted somewhat slightly higher unemployment rate, then we wouldn't see this kind of inflation. But that somewhat higher unemployment rate is actual people, right, with actual lives, who would not have employment, who would not have incomes. And of course, and the rest of us could then enjoy a slightly lower price for our Starbucks, right? Even though it's Starbucks that decided twice to raise the prices, above the increase in their costs and so on. So yes, you could always argue that if we were poorer and there were more unemployed people, then we would have less inflation. That would be using the unemployment rate as a tool to fight inflation, which is the current practice. And our argument is that that's what the Fed would be doing as well if they were to try to raise the rates. Marginal changes to the rates aren't going to really do anything about the inflation. we're seeing, and if they want to, really solve that problem with rates, they would have to raise them a lot higher. And so basically cause a stagflation, and solve the inflation problem that way, which is the only way the Fed is able to solve the inflation problem, is by causing a recession and raising the unemployment rate.
Yeah, absolutely. And this is paraphrasing, but just a few months ago, to underscore your point about corporations, basically price gouging, the CEO, I believe it was of Kroger, came out, and the way that it was put was they were boasting about how they had passed on the price increases and then some to the customer, and that was how they boasted to their investors, right? So they're very open about this. It's price gouging. When you see record profits, you can't then say inflation is causing our price increase. That doesn't make any sense. And Rohan, I was hoping. Oh, go ahead.
Oh, I just want to add on that, which is that there's a lot of gaslighting going on right now from orthodox economists about this, saying, oh, you're crazy if you think that corporate pricing has anything to do with this. They had the ability to price higher beforehand. What's different about now? And the answer is, we provided a large stimulus to people in a way that they put money in their pockets, and corporations said, oh, we can charge more and get away with it, and absorb that price increase in that feeling that people have of getting more money right now. You get $1,200 that you haven't seen before, and you go, oh my gosh, I've actually got money for a change. You go out and buy a new TV, and the TV costs $50 more than it did the day before. You might not care because you finally got the money to buy a TV. Does that mean that price increase wasn't the result of corporate pricing power? No, of course it's the result of corporate pricing power. But the reason they can do it now is because there's more space to do it than when you're living hand to mouth the day beforehand in a very different kind of environment. I was just, as Yev was speaking, I was reminded of this Chris Rock comedy bit where he says, you know what they say when they're paying you minimum wage? They say, if I could pay you less, I would. I'm legally prohibited from paying you less. But if I could, I would. That's why I'm paying you the minimum. It's literally the least I can get away with paying you. Mm-hmm. And I think the same thing is true with these price increases. The reason they're charging more now than they did 2 years ago is because they can.
And they're using the pandemic as an excuse.
That's right. That's right. They can get away with it. It's not that they wouldn't have liked to charge more back then, but maybe there were social and political and broader economic limits of their ability to do that. Now, you can switch that causality and say, if we didn't give poor people some more money, they would have been able to raise prices. It's therefore the problem is, as you ever said, we don't have enough people staying poor. Or you can say they were waiting for the opportunity to do this. It became available and they did it. It's still their choice. It's still, as Jeff said, their record profits going up.
Yeah.
It's just,
this is one of the reasons why I think when we talk about inflation, we have to remember that inflation is neither good nor bad. Inflation is good for some people, bad for others. So my question when it comes to inflation, when we're talking about Medicare for all, Green New Deal, these things, it's going to cause inflation. It says, well, first, that's the burden of proof is on you to do that. The burden of proof is on me to design a system where we have actually prepared the resources to be in place so that when these things get implemented, it's not inflationary. But even if it is, I don't necessarily cry over inflation universally, because if we have 4, 5, 6% inflation, but at the other end of that, everyone has free education, everyone has housing, everyone has Medicare for all, and we have averted the worst disasters of the climate crisis. I'm not crying over the fact that we got 4 to 5, 6, or even 7% inflation as a result of that. Once we've done all these things, then we can tackle inflation a little bit more stringently. Than maybe we didn't do it well enough, maybe we did it the best we could, but these things need to get done. I'm not going to say we're not going to save lives because there might be inflation and your coffee and your Big Mac might go up a little bit. You can sit down and shut up with an argument like that. I'm trying to save lives. You're trying to pinch pennies. Which one of us is going to win this fight? And when everyone understands that it's about federal finance, we always have the money. It's about resource allocation. Your inflation argument is going to lose to my moral argument backed up with the knowledge about how we get it done. So from
fantastic explanation there, Jeff.
We need that.
That's excellent stuff. And I guess there have been some comments in the chat. I know that both Yeva and Rohan touched on this, but there have been some comments in the chat with a little bit of confusion about kind of the money story. Could you two maybe just give a very brief sort of explanation of how taxes drive demand for the currency and how the spending must come first?
Sure.
Either of you.
Yeah, I guess that's what I was trying to get at with the example of my classroom currency, the Franklins, right? So the first day I walk in there and I show them this like piece of paper which has 4 Franklins on it. They don't know what a Franklin is, and I asked them, you know, how much would you be willing to pay for this piece of paper? And they're looking at me like, why would we pay for it, right? And you know, some of them might say, okay, I'll give you $5 for it, just, you know, out of curiosity, because they don't know what's coming, right? Just to hedge their bets. But then, you know, after I tell them that, you know, you have to pay me a 25 Franklin tax, this 4 Franklins, and each week they earn 2 through participation, this piece of paper just became 2 weeks of their labor, right? So now they have a demand for it. Now they're willing to like go back and, you know, buy it from me. But at that point, of course, I mean, I was never intending to sell it to them, right? The goal is to make them work. So that's the goal. The goal is to make them participate in class discussions and do all other things. So you can see how by taxation, I'm creating demand for the currency, right? But my goal isn't to get those Franklins back, because I am the source of those Franklins, right? They're coming from me. The goal is to get them to participate, or you could say to make them work, right? Like in the real world. So that's the way it works in the real world as well, through taxation, which you can think of taxes as a form of debt, right? It's involuntary debt. By imposing a tax on us, the government then creates a need for demand for its own IOUs, because then it can say that this is the only thing that you can pay your taxes with. So you have demand for the government's currency, which is an IOU. And why do you need it? You need it to pay your taxes. And that's the main thing that's inherent in an IOU, the promise by the issuer to accept it back in payments to itself, right? That you'd return the government's IOU, you extinguish your debt that you have to the government, just like my students return the Franklins to me to pay their Franklin debts owed to me, right? And once it's back in my pocket, those Franklins are worthless. I can tear them up, I can throw them away, I can print new ones. And I actually don't print any, I just do it all electronically. So I just, you know, at the end of each week, I add a number next to their name. This is how many they earned that week. And at the end of the semester, I'm going to reduce that number by 25, and then their tax is paid, right? And I didn't really get anything. I just changed the number back down at the end of the semester. And next semester, I start over with a new class, with a new group of students who unknowingly subscribed to take my course, right? And I didn't need any Franklins from the previous semester to pay the students this semester. I don't know if that helps. Yeah.
Well, the key thing for everybody to understand. Oh, go ahead, Rohan. I'm sorry.
The way that I often try to sort of provide what I call the kind of legal extension to the basic kind of taxes drive money story, which I think is completely correct, is to think about all the other forms that of obligation that we incur that the law or the state enforces. And so you can walk down the street and have no tax bill. You can do everything you can to have stayed out of any system that might incur taxes. And someone can bump into you and they can trip over. And the next thing you know, you get sued. And you're getting sued for causing them injury. Or you're driving your car and you think you're participating, you think you're obeying all the road rules, and you get into an accident. Even though you think you're innocent, you're going to get sued, and there's no way you're going to get out of paying some money, whether that's your attorney's fees or court fees, even just to prove that you don't owe any more money. You could buy a piece of property and you're going to have to pay property taxes, but you could also have somebody step onto your land and get injured and sue you. And there's all these ways, whether it's contracts or torts or property laws or any other kind of way in which we inhabit society, where even if we think we've got a zero quote unquote tax burden, we are still likely facing a risk that we are going to have to pay dollars to somebody, and that the law, the state, is going to enforce those obligations. And
in dollars,
or that's right, in whatever the currency of account is. So you can't get away from debt, in this debt that is enforced by the state. You can't get it away from it either in a guaranteed sense or in a risk probability sense, right? This idea that even if there isn't 100% guarantee you're going to have to pay money, there's a risk every day that you could need money. How many of us want to walk around life with $200 in an account and going, "Oh, I'm accounted for any possible risk in the future"? Very few, right? The risk that anything could happen and your entire life could be completely upended if you don't have enough money to pay those debts or to pay to alleviate risk is very huge. And that, to me, is, I think, the bigger framework here, is that even if we can imagine a world where we might have a zero tax burden, we are not out of the realm of jurisdiction of the sovereign or of the legal system that imposes legal obligations onto us denominated.
So there's still even the threat of an obligation is itself enough to drive, in some sense, demand for a currency.
And the important thing there is that threat comes from private activity. If you want markets, if you want property rights, if you want contracts, if you want a system of liability for people who punch you in the face when you're walking down the street, if you want all of those things beyond just a sort of state up there taxing and redistributing or paying money or whatever it is, if you want the system of private enterprise, private activity that we have, private liability, that itself is part of that same public system that imposes taxes. It's part of that same circuit. Even if the money we're paying goes from me to another private actor, the fact that the state is in the middle, forcing me to pay that person in a certain unit, that is functionally the same as a tax obligation in the sense that it drives demand for our dollars.
It's coercion. It's either dollars or incarceration. Wonderful choice.
Yeah. Well, we do have to finish things up here, but I just, if the audience takes anything from this, please do understand that the debt and deficit fear mongering is incoherent and not rooted in economic reality. With Yeva's example there, what's important is that she has to give out those Franklins before she can collect them, and the students have no desire to acquire the Franklins until she's imposed an obligation in the form of, in this case, a tax. So I really want everyone to understand the order of operations and the money story, and encourage everybody to read The Deficit Myth by Stephanie Kelton. That's an excellent primer into modern monetary theory if you are not familiar with the concept. So thank you all so much for taking the time. I think this was an excellent panel. I really appreciate you all being here to describe the financing of Medicare for All.
It's our pleasure.
Thank you.
And we have Savage Joy. Oh, you're muted, Joy. You're still muted, Joy. I can't hear you.
Oh my God. I do that every time. I told Andy
That's
I
right.
want to see everyone before they leave. And then I was like muted.
And then
I'm
they
like,
left.
wait, don't go. But then, epic fail again. But we needed that panel. We needed it. We touched on it a little with Steve on the one I did prior, but oh my God. But I just want to ask you a question. You know what I'm going to ask you.
She's going to ask how are we going to pay for it, right? She's going to make me pull my hair out here on a live stream. If that's still not clear yet, you guys, Congress authorizes the spending and the spending occurs, just like with military spending. As I believe it's Stephanie Kelton puts it, when you have the votes, the spending is there. And that spending does, by definition, have to come before the taxation. So when we fearmonger about debts and deficits, that's just entirely incoherent. There would be no money supply if we didn't have a national debt. I like to say, instead of that counter in New York that has the national debt counter, it should say money supply counter. Here's how much money is in the economy for all of us to use as currency users.
Absolutely. And I want to remind everyone, if you haven't seen it, if you go to my YouTube, I interviewed AOC and we talked extensively about MMT. She was meeting with one of our comrades, Pavlina, for lunch all the time.
Pavlina Chernova?
Mm-hmm.
Okay.
So AOC and I had a legit discussion when she was on my show about MMT and how it works and everything. Shouldn't talk about it now, but so it doesn't mean that people in Congress are not educated about it. It means that sometimes they are trepidatious to bring it up because of how it'll be perceived, which is why I think it's important that people have an open mind to these discussions and be able to say, shit, I was lied to. It's no
Yeah.
fault of your own, but just be open to
Yeah.
learning about something new that you haven't known before. And it's okay to be wrong sometimes, but then learn and grow
Learn and
from
grow. And if I could just add on to what you were just saying, Joy, about Congress, I think one of the reasons it's so important for the general public to understand this, and for the narratives, the public discourse to be coherent as it pertains to debts and deficit and spending, is because I think a lot of members of Congress do understand this, but they fear being viewed as irresponsible by their constituents if they admit that they understand this, or if they advocate for increasing the deficit. So that's one of the reasons it's incredibly important that we're all using the right kind of language. If you use the term taxpayer dollars, no shame, we've all been there, but please try to cut that out of your vocabulary. They are public dollars, not taxpayer dollars. I just really want to reiterate all of that.
Absolutely. Well, great job as always, and great panel. Thanks so much for all the guests too.
Yeah, thank you. And I'll pass it over to you for what is going to be an exciting panel about how to organize and move forward on all this stuff, right?
Yes. Yep.
Thank you so much.
You. So I want to share, this is Duchess. We adopted her 12 years ago. It's her adoptiversary. She wanted to say she supports vet care for all. Right, baby? Yeah. Thank you for joining us, Dutchie. There was actually a request in the comments for Duchess to make an appearance, so I wanted to allow her to do that. So you're gonna hear me say it again because it's important. Okay, we need help to raise money to continue our actions. Yes, this is virtual, but we have other actions in the works that, unfortunately, are going to cost money. That is a part of nationwide organizing. So we could really use any help, no matter how, even if it's $3, $5, whatever. Any help is appreciated. However, and if you donate $20 or $20 increments, for each $20, you will receive a raffle ticket to win this badass basket of M for All swag and all kinds of treats. The Deficit Myth by Stephanie Kelton, you just heard about, and just some awesome things, and we'll include shipping and everything. So, I mean, each $20 you get an entry. So, and we really, really need the help. I'm not too humble to say, to pretty much beg. But anyway, thank you to everyone who's watching, commenting, everything. These past 3 days have been amazing, but it's not over. We have more, but wait, there's more. So, Andy, if you want to bring in our panelists for this panel. Hello, everyone. So we have another great panel. So it's pronounced Lara. Is that correct?
Yes, thank you for asking, Laura.
Absolutely. So you are a doctor and an activist. So this is a very good perspective to have. We have Edwin De Jesus, who was our lead organizer in New York, March for Medicare for All. And we have Ed, who is on our organizing team for this weekend. So thank you all so much for joining us here. And what an important discussion. And there's a reason why we put this at the end, because everything we've learned for the past 3 days, how are we going to implement it into action? Some people say vote harder. Some people say direct action. Some people say both. So we're going to have the discussion of what is the most beneficial as far as our takes, and what we can do to try to reach our goals. So I'm going to go around. What do you think well, let's put it this way. In other countries, we see people, industries by the thousands, sometimes hundreds of thousands. And what do you think is the biggest obstacle in why in America we're still asking and not demanding?
Well, I would say we lack, number one, we lack a coherent leadership. So there's like this huge political disconnect. So the mass of people in general are sympathetic to what we're for. And the question comes up, well, how could there be so many people that are sympathetic to this, but they're not really in motion? How can we get people in motion? And then you can look at, well, who are the titular heads of the movement and what the role does the media play, the ruling class and all the other organizations that tamp down activism, that confuse people, disorient them, make them feel they're ineffectual or powerless. And that's what we face. We face the system, and we don't really have what we're trying to do, I would say, is get an organized expression that represents our interests, that can move in coalition with other like-minded people. We don't have that yet because we have a neutered labor movement. That normally in most countries you have a class labor movement that's fighting for big things. In this country, which what I like to talk about when we get on, is that's one of our weaknesses. We have a labor movement that's been destroyed by McCarthyism, so they don't even know how to fight. So anyway, that's kind of like my beginning take.
Right. And if we go around, so Edwin, we'll just go around that way. Well, it might be opposite from the way you guys are seeing it, but yeah.
Yeah, so I think wealth and income inequality is one of the biggest reasons we have so much infighting, not just as activists, but as neighbors. And the difficult thing about that is the more infighting we have, the more wealth and income inequality we allow to continue happening. So it's a vicious cycle that as the American empire continues to decline, we the people begin to fight and become more angry and hateful at each other than at the ruling class or the oligarchs or the top 1% or whatever you want to call it. So until we can actually gain some sort of monetary and financial power as ordinary people, we're more than likely going to keep allowing ourselves to succumb to these same tropes where it's either the fault of immigrants or the fault of the Republicans or whatever it is. But when in reality, it's the military industrial complex, the large corporations, Wall Street, the big fossil fuel industry, big pharma, private health insurance companies. These are the actual sources of the suffering. It's a little bit harder to articulate and visualize that these entities are the sources of suffering because nobody on CNN, MSNBC, or Fox is going to tell you outright that these are your enemy. They're going to tell you that your neighbor is your enemy.
Thanks, Edwin. And I think, to name the elephant in the room is racial capitalism is a huge part of this, right? So I think part of what racial capitalism does is also make certain things legible to us and others not. So we do have a labor movement happening. It might be disjointed in many different ways. And I'm not sure that has to be a failure, right? We see, especially during the pandemic, how many folks, both locally and then on a national level, are working together to sort of fortify their communities and make sure that their communities are taken care of. The slogan, right? We take care of us. And I think that needs to be a legitimate movement that we see and hear and platform and make coalitions with across the board. And I think that's part of it. Part of it is sort of being rewired to think about labor movements in a particular way rather than seeing all the organizing that are happening. I mean, we saw with Amazon, right? If we were to just say, no, this is not, and because quote unquote, it failed. I think that language of failure is something that consistently brings us down rather than seeing how do we support people to seize those moments when they have them, and then how do we continue to move forward rather than sort of recapitulate these racial lines that the United States particularly is implicated in. These are fault lines that go way back, but they're also myths, right? There's labor organizing across racial lines that go way far back. And I think that, but we have to name racism, sexism, and labor movement, so on and so forth. structure some of this. And I think that's a starting point for us. Oh, you're muted. I can't hear you.
Can't hear
No,
you.
you're muted.
Okay, that's only the 20th time I've done that this weekend, in fairness. So I was saying, Ed, you brought up a point, and I'm not sure if you meant this literally, but you said the word leader. And I want to discuss that. Do we need a leader? Many of us were burners. Many of us. I mean, I moved to Iowa to volunteer for 5 weeks. I have a Bernie tattoo. Like a lot of us got our start with Bernie, but not me, us. Do we need a leader? We see so many people making posts like, who should be our next leader? Should it be AOC? Should it be Pramila Jayapal? Who gives a shit? So I want to just kind of go around and see what your takes are. Do we need that one person who's going to just be our savior?
Well, of course we don't need one leader, but the reality is we need, for a movement to move forward, we need a vision, and we need to have a collective understanding of what it's going to take us to get there, which is totally different than relying on a individual leader to guide us. What we're talking about, or what I'm talking about, is not deciding, but creating the conditions that workers, average citizens, will be able to see their power and embrace their power and understand what it means to make a change. And when they do that, they can become the leader. So when, like I spent my life organizing unions, you can't tell people that, well, let's organize a union so we can get better wages, hours, and conditions of employment, improve our lives in our community. But nobody is going to lead the people. We need an organizing committee. And that's the fundamental thing that we lack on the ground, number one. And we also lack a national poll that pulls together all of the individuals around the country that can push us forward. If you look at anything in the country that has ever happened positively on a mass scale, it's been a mass movement. Now, there were leaders in that movement, but it was basically common, ordinary people that pushed the agenda. And so however you want to phrase that, but you got to dismiss the idea of individual leaders. And I'm sorry that you got hoodwinked by Bernie Sanders, because he allegedly was a revolutionary, but he turned his movement off. No movement can be turned off by people who are conscious. You can't turn off a revolutionary movement because one person says so. So, well, let's just disabuse ourselves of that and kind of work together. That's really that's really what everybody fears who has the power. They fear everyday people getting active.
I will say to that, my many issues with Bernard, but I will say that I will always, always, always be grateful to that man for waking me up, for giving me a free education, for making me an activist, for inspiring me to do a show, for teaching me what Medicare for All is, teaching me, like, that man changed many lives. And he also made things like Medicare for All a household talking term. So I respect my roots. No matter how bad he pisses me off, I respect my roots, and I will always love him for that.
Could I just say one more thing? Is whenever I was in my early 20s, I got my first job. I was working in the steel mill, and I got a job working for 1199, the Hospital Workers Union. It was and I went to my grandfather, who was a steel worker, and I said, you know what? I got a job working with the union. And he looked at me and he said, you mean the CIO? And I said, no, a union. And he couldn't figure it out. That's my whole point. You talk about learning something. You learn from the fact that when they organized a union in the 30s, they organized a movement. They were part of an upheaval of society, and not some bureaucratic organization that that went out and organized 10 workers and then they hired a lawyer to do something. It was a bigger issue. So when you say Sanders did all those things, but I have to say that opened my eyes up. I thought I was really cool. 22 years old, I thought I knew everything, and I thought, how in the hell does this guy tell me what a real union is? And it kind of wakes you up. So that's my story.
Edwin?
Yeah, I have a similar sentiment about Bernie as you do. I was national advance on his 2020 presidential campaign, and I was also heartbroken in the final days when he was calling Joe Biden his friend, kind of refused to really attack him at his weakest points, and ultimately didn't give the closure to the millions of people that were supporting him that we so desperately wanted. And I think that all the people that came out in droves by the tens of thousands to his rallies, those are the real leaders. Those are the people who came together under the common purpose of Bernie's movement. But at the end of the day, it is really us and the next generation of activists who are going to carry that torch and hopefully take his ideas and try to isolate them from the two-party duopoly and try to do what the OG Bernie did, which is run as an independent, do these sorts of street actions, and not always pretend that the lesser of two evils narrative is something that we need to be putting our focus onto. So do we need a centralized leader? No, I think we need decentralized entities of authority where we can come together and not actually have to rely on a figure or a set of figures that can easily become corrupted. Chris Smalls is a great example of a labor leader with the Amazon Labor Union, and we've worked together. And what he's doing is crucial in getting the Staten Island warehouse workers some sense of justice, because not only have they been abused by Amazon, they've also been abused by law enforcement as well. So the more that we can support more grassroots efforts like the ones that Chris Smalls is doing and other efforts on the ground, I think that's how we're actually going to build the power so that we have different leaders in different regions, but no one person, if they were to either drop from the face of the earth, that would have any impact on the rest of the movement, that it can be self-sustainable regardless of a particular person or entity or group or political party.
Absolutely. Lara?
Yeah, I mean, I agree. My political alignment is very much to decentralize power and not have a sort of cult of personality. I think where we really need to put, ourselves and where rubber hits the road is saying, if that's the case, then we also have to make space for more radical parts of this movement. And I think that's often what we end up seeing, is that these movements cannibalize themselves and end up sort of moving more center anyway. So if we're saying we want to decentralize, I think it's incumbent upon us, the movements, the sort of local movements, the grassroots effort, to say all strategies have to be on the table, right? And because we understand how structures work, right? Because we understand that a structure, if we're needing people inside and we're needing people on the street and we're needing people in all these spaces to organize, and if we know that systems themselves end up slowly sort of making their way to center, then we also have to be okay with all strategies that have a really large understanding of what a leftist movement looks like, which includes radical left. This is something that we might look at to different countries outside of the United States. It isn't looking at Bernie as the most left side of things, right? I think, again, what ends up happening is a sort of seduction or invitation in for radical leftists, anarchists, communists, to then become Bernie supporters or become sort of party line holders. We need everybody on board to start to do this. And I think that's the piece that I would like to invite us all to think about. How do we make a massive movement? And that means that we can't have people sidelined.
Absolutely. And that actually brings us to our next question. So I want to reverse and start with you, Lara. We're on Twitter. Edwin, you're on Twitter. Ed, I don't know if you're on Twitter, but let's say Twitter can be a very good animal for organizing, promoting things, and then it could be straight up the devil. So what I want to discuss is, we have seen so much toxicity, as in, let's organize, but not that way. Not that way. I was the disabled spokesperson for Force the Vote. I shared my story for the very first time about going blind, and it had over 130,000 views. And the next day, Jimmy Dore trended. This is what we're seeing. We did 56 actions in one day, Medicare for all, in July. What happened? People in Florida, I'm not taking part in this because I don't like the one person who's speaking for 5 minutes in California. This is the problem. There's so much divisiveness. I just want to go around. What are your thoughts on that?
I mean, I think, part of it for me, I'm going to put my clinical hat on as a clinical psychologist and say, what is the structure that's underlying this, and what are the issues that people are speaking to that end up materializing in these ways, right? And I'm not sure that we're really speaking to these issues. Racism in this movement is real. Sexism in this movement is real. Ableism in this movement is real. Transphobia in this movement is real, right? And I think we really get into problems when we start to disconnect labor movements from these other liberation struggles. And so sometimes I think listening to the symptom, if we're seeing these things happen over and over again, what is the symptom that we need to be really looking at and attending to internally as we continue to move forward with building networks and coalitions? For us to just stop and say, this is just divisiveness, let's put it, and I don't think that's what you're saying, but I hear that sometimes, right? Oh, this is divisive. If we just stopped fighting, we would make something work. But I think there's something to be said in what people are raising flags about. And we really do ourselves a disservice when we're not looking at these things that replicate themselves in our movement, just like in the oppressive structures we're trying to push up against.
Absolutely. Ed?
Oh, okay. I think as far as our role is to take people where their consciousness is at the moment and try to move them, what I would say, up their class consciousness, their racial consciousness, their consciousness that they're workers, that everybody is in this together, and use wherever they're at and take that and try to make conscious arguments to move them forward or uplift them, take them away from their backwardness. And that's just the reality. Unfortunately, that's just life. We have to be able to understand what we're for, what we're trying to promote, what are our arguments, what are the negatives that people, and be the best spokespeople for that. And I think that there's always going to be that. I mean, we had the Medicare for All rally in Pittsburgh, and it was exactly the same thing. We had a group of people that literally would come to the meeting and they say, well, there's somebody in Fort Wayne, Indiana. We don't really like them. So therefore, you should cancel the rally in Pittsburgh, Pennsylvania, because there's some person in Fort Wayne that we think is really bad. And I said, well, what the hell are you talking about? This is like ridiculous. We're going to move ahead. You're always going to find an issue, something like that. So I think we have to just work at it and try to remember. And again, from my experience, and I'll go back again, I'll just say, you all talk about Bernie Sanders. Well, I was Jesse Jackson. Now, you guys might think he's an old timer. He is. I was Jesse Jackson's labor coordinator in Pennsylvania in 1988. And he was trying to build he had the Rainbow Coalition. And then a la Bernie Sanders, right after his run in 1988, he dropped the Rainbow Coalition. And we thought, holy cow, this was a good vehicle to keep moving. It was a mass-based class, women, gays, everything in there together. And then later, I also was Dennis Kucinich's Pennsylvania coordinator. He talked about Medicare for all way before Bernie Sanders did. So all we're saying is that the history is very important to understand. And I think if you look at the history of how things have evolved and how we've gotten to where we're at today, you can learn a lot and maybe learn how to deal with the ins and outs of people's attitudes and changes in what they think is important, because It'll also give you a steady path to follow.
Edwin?
Yeah, one thing I always like to share about the March for Medicare for All in New York City in particular was that we didn't just have progressives or leftists come out to this event. We had people who are very libertarian, Republican, even conservative people who came out and volunteered to put this event together. And for some people, they couldn't wrap their minds around that because unless they're kind of within that same ideological bubble, they would view that person as their enemy. And I think that's one of the hardest things to get across to people is that that's the biggest deception, is that because somebody is on the other end of the political aisle than you, that they are very different from you. When in fact, if you're a member of the working class, you likely have 99% of things in common with someone. And that 1% of things that you disagree with is what always gets blown out and exaggerated in the media and on social media platforms. And I will highly recommend this documentary that I watched about Twitter and its algorithms. It's called The Social Dilemma, and it goes in depth about how what really gets engagement on social media platforms are things that provoke anger, are buzzwords that get people riled up with their emotions. And these algorithms, they stay there, they're ingrained in your account. If you post something today versus if you post something, months ago with certain keywords, you'll likely get the same audience and you'll have the same people liking that tweet and the same people trying to ratio and comment hateful things on that tweet, because that's what generates engagement. And the more engagement that a platform like Twitter gets, eventually the more monetary value that they get out of that through ads. So I think it's important that when we do communicate on these online platforms, it might be more convenient to have a snarky one-liner that generates a lot of retweets. But when you actually try to be less vague and go more into detail about specifics, okay, yes, that's not going to circulate as much through the algorithm, but that's how you can actually maybe connect to one or two people who disagree with you on a deeper level. And I think that if you can level with others and show some compassion and show some humility, and nobody likes to be told that they're wrong, and nobody will ever really want to admit that they're wrong, even if there's data or evidence right in front of them. I think the best thing that you can do is tell people where they are correct and where that you think that there could be further dialogue. And really, Twitter's just not the best platform for that kind of dialogue. It's really more of an arena for fighting, like a coliseum. It's really not the place to come together and build coalitions. I think a better place for people to come together, and I might be getting a little ahead of myself here, would be through something like a decentralized autonomous organization or a DAO, where people can have equal amounts of say and transparency in their decision making within activism and organizing, through something like a blockchain or a public ledger, where everyone has some sort of equal input into the group's strategy. And that way you won't get this sort of infighting and purity tests that ultimately destroy movements from the inside.
And
One,
I'm sorry.
Yeah, can I just say, I mean, in theory, I agree about coalition building, but I want to just push up a little bit about this, because I think that there's ways in which we can also be very cavalier about asking people to fundamentally compromise who they are in their identity and the very real material effects of these things when we're saying you should be able to come and march in the street with Republicans or conservatives. I'm not saying that that's not, that some people don't do that, but I think there's a way in which we mobilize shame to have people sort of join in these efforts. And that is psychically is not going to work, because fundamentally that 1% of their thing that they disagree on, for that one person might actually be a dividing line between true safety and not. And so I think we need to push ourselves on this and not sort of mobilize. The reason why people don't show up with Republicans or conservatives is not because they don't understand themselves as workers. It's because there's very real material impact, and we have seen who this falls on over and over and over and over again, and who is tasked with organizing the actual material effects of these positions that are taken as though, oh, this is just an opinion or ideology, when what we're seeing, particularly in the context of the United States, is these things actually translate into real issues. We're seeing it in Texas, in Florida, in Alabama, when we're talking about trans health rights for kids, for example. This is not a small thing. This might be one sliver of somebody's identity, but that one sliver is a central piece that might allow them to have actual care or actual dignity in life versus not, right? And so I think we have to be, I'm not sure that that's the right answer. Actually, I'm not going to say I'm not sure. I'm sure that's not the right answer, to mobilize shame and say, just dialogue a little further, because there are some things that can't be dialogued about, because fundamentally ask people to compromise their being to even insert themselves into that dialogue.
Well, look, could I just say, I think there's tens of millions of people that we have to reach. And our goal here should be talking about how are we going to reach these tens of millions of people who need Medicare for all, who need national health care, and who are basically victims of the system. And it's like, that's our role. How are we going to organize them into a broad popular movement? To me, that's really what we should be talking about, right? Isn't that what we're supposed to be doing? How do we move people into our orbit, so to speak, because we think that we need a movement? So how are we going to reach them? And what's our message to reach them? And because there's tens of millions that we don't have the capability of reaching. If all the public opinion polls are true, that's what we have to focus on. And we shouldn't be worried about, fighting among each other, because there's a lot of people who are ready to gravitate to this message. Then I think organizationally, to me, that's really the focus for if we're going to organize in the future.
Edwin?
I will say one of the most profound images I've seen in recent years was, excuse my dog barking in the background, was an image of a Trump supporter and a BLM protester, two groups coming together hand in hand. And they were actually both protesting against certain mandates and restrictions that the government was levying on them. And to me, I found this to be quite revolutionary in a time where there is so much division, that people were able to come together in this sort of way and have some sort of mutual respect for each other. And this kind of act of love, I think personally, is revolutionary. And I completely agree with what you are saying, that there is some sort of limit to where it could become actual threats of violence. And I agree wholeheartedly with that. I guess for me, the only pushback would be, if you're going to look at it through the paradigm of, Democrat and Republican, I would say that they're both anti-choice to a degree, because Democrats could have fought to codify Roe v. Wade, for example, but they didn't. And I think that they kind of egg each other on. And when it comes to these certain issues, like to kind of point the finger at the respective boogeyman. But at the end of the day, it's really the politicians of these parties who are the ones that kind of create these laws. And I think that when it comes to the grassroots organizers, whether they are Democrat or Republican, you tend to see much more of an anti-establishment alignment that really doesn't it doesn't go far in our current society, because it's usually shame to see, hey, why are you guys coming together on this issue of, like for the mandates, for example. I think the trucker protest in particular is what a working class movement looks like. It's not pretty. There's going to be infiltrators. There's going to be people within that movement who have hateful ideologies. But overall, just people coming together and, blocking supply chain lines as a matter of protest, and having a stand when it comes to multiple demands in terms of labor rights. It was kind of saddening to see so many people on the left kind of talk negatively about it, because I thought, well, if we're ever going to have a general strike, this is it. This is what it would look like. And to call it fascism, I think it's the antithesis of fascism. I think the government, the Trudeau regime, the Biden administration, that is more aligned with actual fascism. And I'll end on this note. I think when it comes to, and this kind of goes back to the leadership topic we were talking about earlier, I don't think it's really, I don't really think it's worth debating, Trump versus Biden or Biden versus Obama or whatever it is. I think at the end of the day, you have to look at how do people react to these people when they get elected into power. Because when Trump was in power, we had all these groups, moderates, leftists, even Republicans, coming together on a common goal of wanting to put a check on Trump's power. And we saw a lot of grassroots movements and street actions occur under his administration that led to more change. And we saw a lot of activism and people getting radicalized. But now that Biden is in power, we're starting to see a much larger pacification of the masses and less activism and less direct action because of the fear of censorship and the fear of ostracization from society and isolation, and also punishment in the form of your social reputation or even your ability to function properly at a workplace without being discredited or put at a disadvantage.
I'm sorry. I can't not push up against you about the trucker movement. It is a fascist movement. You have one Nazi or one Confederate flag, and that's going to spoil the whole lot. And I'm sorry. There's no way I'm going to stand behind having swastikas, which were in the DC area, and anyone aligned with that movement. That's the hard line that we have to push. And that's what I mean about that. We need to be able to take these positions and not take the reactionary route. Any position, any anti-establishment movement with no material or political analysis and no underlining or underpinning movement towards justice and liberation for all is a reactionary movement. And that it's okay for us to say these things. That's part of why we need to have these conversations. And don't get me wrong, I'm never going to stand in line with Democrats or with Republicans. I would never do that. But I think these false binaries that we end up being, because we're against Trump and we're against Biden, then let's stand with the truckers. I'm not seeing any coherent argument about that. And again, when I see one swastika and one Confederate flag, I think it's okay for us to take that position. Now, is there consciousness raising, like Ed, you were saying? I respect old school labor organizing that I think we need more of. Absolutely. But I think there needs to be a massive redistribution of the responsibility who does that and who goes into those spaces, right?
Well, I'll tell you,
I'm not going to show up to a.
Okay. I would say, as far as, divisiveness, just sorry to interject, is that's like a straw man. I would look at it as a straw man. How could there be divisiveness in a society when what are we trying to organize? We're trying to organize a mass movement for healthcare. Millions don't have it. You look at every poll, majority of people want Medicare for all. You look at all the polls, we'll forget about modern monetary theory, but the Wall Street Journal had a poll 2 or 3 years ago. People were screaming they wanted to tax the rich. There's everything that people wanted, even in Biden's weak, tepid agenda. It all had popular support. My point is that if we're going to move forward in this next period, we have to realize that all of the things that we want are there. We have to figure out the mechanisms to mobilize people to move a critical mass so that we can begin to change the power equation in the street and in the electoral arena. The people are there. We have to figure out how we're going to organize them and what's the method we're going to use to get them, because I think our issues remain. And that's where the Democrats and Republicans, they're interested in creating these cultural wars, fighting against each other, this and that, on issues that don't matter to most people. I'm sorry, but the reality is the class issue is the main issue, and that's what we have to focus on. People who don't have Medicare for all are mostly poor people. And if we got Medicare for all, that would be the biggest uplifting of justice, economic and racial justice in the society. Yet nobody talks about that. That's what we have to talk about. And our alleged leaders in the Medicare for All movement, whether it was the ones that tanked the forced to vote, and you have Jayapal. Jayapal says, well, we can't even have a vote on Medicare for All. It will destroy our movement. Yet she's the leader of the movement. She's supposedly the leader. And it's kind of like we have to come to grips with some of these things as so we can figure out what we can do as, I would say, the real organizers, the real people. And but it's like dismissing some of these other things. It's just, we're just going to get into a circular firing squad and we're going to kill ourselves. Yet there's millions of people that need what we're fighting for. And that's who we ought to focus on.
And I just want to say that the thing is, Lara was speaking about racial equality, and I don't want to conflate that with everything, because that is so important, and that is its own inequity within an inequity. And I think, let's look at something like the Women's March. Okay, it's a parade. It's not a march. It's a parade. It happens one day a year. Most speakers are white, well-off women. And there is absolute racial disparities within movements. So many times people do things and they do not give people of color, they do not give LGBTQ people the mic, things like that. And that is such a huge component of what we need to do as white people when we are organizing. We need to make sure that people are represented, and we need to make sure that they have a voice and that those things are considered. Because while it may be easy for us to be like, yeah, but let's just work with everyone. Not that I'm saying you said that. That brings up a great point. There were swastikas. There were Confederate flags. Now, Edwin, I totally see what you're saying as far as it was a mass movement and it was working class. Absolutely. But Lara, you are right. Once you have something hateful in that, absolutely taints everything. So, I mean, Lara, if you'd like to continue, I don't want to speak for you, but
No, I appreciate that. I think just to speak to Ed is, I don't think we can unlink class from race, gender, ability, and sexuality. I think that's what gets us in trouble to begin with. So that if we're just saying, class is a central issue, which I happen to agree with you, class cuts across everything. Right. But then we're saying, and then we need, like, all these other things don't really matter to the average working person. We're imagining a particular type of average working person. And that's why we continue to only focus primarily, or movements overemphasize the white working class, when in this country, particularly in this settler colony, I will say, not just country, in this settler colony, Indigenous, brown, and Black women make up the primary working class that we have. And we can't keep this messaging of it's just class and then not focus on all these issues. This idea of delinking these issues is precisely what creates these problems to begin with. So then the white working class can't imagine a linking up with their siblings, with their Black, brown,
I think we're saying the same thing. That the working class is all, it's multiracial, multinational working class. And I think if you read, I guess one of the best examples of this is the book called The Long Deep Grudge. It's about the agricultural and agricultural implement workers in Louisville, Kentucky, who literally would go out and help integrate the parks. And this was a working class. This is what they did. Their union did that. That's the kind of labor movement we need. And it's no secret that they had the best contracts. They had the most integrated workforce. They did the right things because they had an ideology. They were fighters. And that's all we're saying is we have the capability of doing that now. That's necessary. People don't want to think about doing that. Why? because they think they could get an easy road. All they have to do is elect some person, AOC. She's going to be our leader. She says she's really a tough gal, which is just absurd, because we need to build the kinds of labor unions and the kind of organizations that did exist in the past. They did exist. The idea that somehow this is all new is sometimes not really true. Yeah, these unions fought. That's how the organization of many of these things had a historical example, and that we have to try to figure out what it was so we can move ourselves away from the current strategy, which is let's focus on who's elected in Congress, which foundation is going to give us money, how can we get access to certain people in Congress, because if we piss them off, they're really never going to be on, and they're really on your side. And it would be the best example is you have 100-some people in Congress that claim they're for Medicare for all, yet 50 of them get awards from the Medicare Advantage industry. And yet the current leaders of our alleged movement, they don't want to raise that. They say, oh, well, that's not acceptable. That's what we have to focus on and tell people, these are the people that you have to look at as leaders. Do you really think they're your leaders? Are you going to follow them into battle? And I think that once we start doing practical things like that, we'll be better able to win people over, because they'll see us as honest people. And we won't make mistakes, but it's best to just be honest.
No, I agree with you, Ed. And I think this idea of that this is not new is really important for us, because that's just when we also go into this place of feeling hopeless, like we have to reinvent the wheel. I mean, Robin D.G. Kelly, of course, looks at, in his book, Hammer and Hoe, looks at Alabama unions, right? Mm-hmm. And how Black folks were primarily people who were organizing there. Yes. This has been a long time. Or Matewan in Appalachia, right? I mean, we have these examples that we can look to. What I'm trying to say is that disconnecting the class and the racial issue, especially in this country, right, is really where we go wrong. And we keep getting seduced into disconnecting both of them, but we go really wrong. And I'm going to bring it back to Medicare and mental health issues. I see this as a practicing clinician, how this falls on fault lines, who gets overdiagnosed, who doesn't have access, who is left to die at a higher rate, falls along racial lines in this country, particularly Indigenous and Black.
Yes, absolutely. And we can't move forward from day one, March 13th, to the next era until we figure out what kind of organizations do we need? What can be built that's sustainable? How can we get the funds necessary to do things, to reach out to more people? I'll give you an example. When I was in the labor movement, and you have to ask yourself, why would the labor movement eliminate a program like this? It was called Labor Neighbor, where the labor councils would literally go to neighborhoods and knock on doors. And they would knock on doors and say, are you for healthcare for all? Are you for this? And those were taxing issues that were gut level issues for people. And when they got those people, they would form an organization in their neighborhood, which is the foundation of kind of like what we're trying to do. Why? But the movement was shut down. It was shut down because it ran counter to the interests of some of the Democratic politicians and said, God, you're creating a power structure here that's kind of, it's gonna piss people off. And that's what we have to realize that we have to maybe do. How do we do that? People have to get involved in their unions. They have to change the leadership of their unions, because without that, without a new direction in the labor movement, we're not going to really go further. We're going to be stunted. We're going to, thanks.
And on that, I kind of want to switch it a little bit. And Edwin, I want to bring you in. One of my co-hosts, Logan, he talks a lot about how unions are good, but they still have a very big component of capitalism within them. So I kind of want to open that discussion. Edwin, what are your thoughts on that?
Yeah, well, I do think that, especially here in New York, a lot of the unions and the membership are really what drives so much of the productivity. But you have leadership that can actually squash some of these movements that the members are starting, because the leadership tends to be in the hands of these of the Democratic Party or Republican Party power players. And so it's important to actually have some sort of leadership that comes from unelected members of the unions. And I think that goes back to my previous point of how can we use something like a decentralized autonomous organization to empower those who are working paycheck to paycheck, because using some sort of technology like that, you are keeping full transparency of the way that money is flowing through an organization and how that relates to how people have equal amount of input into the direction of that organization. This is something that hasn't necessarily been done yet. It's something that I would like to work on and encourage others to try to explore, because we have a limited window between now and when central bank digital currency becomes the dominant monetary system in our near future. And before they begin to smear Bitcoin as some sort of right-wing thing or something that is always used for nefarious purposes, they're going to try to convince the masses why we need to rely on the Federal Reserve and their digital currencies in order to go about our daily lives. The problem with that is that all of our transactions will be tracked. And if they see that an ordinary person is spending too much money on, say, sound equipment for a rally that they want to do in front of City Hall, they can actually punish you. And so the more that we take our money outside of the current system, then we can actually have our own operations under the hood, not through any illegal activity, perfectly legal, but just not within the grasp of the powers that be to squash our movements. And so I think it's very important that now more than ever, we try to take utility out of blockchain technology for ordinary people and use that to empower labor movements and political parties, etc.
Ed, we'll go around this way.
All right. Okay. I would say that you kind of got the cart before the horse. Before we worry about the blockchain and all that, which I totally agree. And again, I go back to historical examples that people were spied on by the man. Let's quote the man, the industry, the CIA, anybody, the company spies. Workers were spied on. They were tracked. They were whatever through history. And I think we all unfortunately know that. A counter-intel program is just the last example of it. So what we need, though, is before we kind of worry about what they're going to do with that, we have to get ourselves organized as a political force. And to stop what you're talking about, to prevent the effect of what we're doing. And it's almost as if now they probably, at this point, they're probably thinking, well, what is it that these workers are going to do? And I think what I'm saying is, like, just because I've been in the union, and the unions are important, that we need to get people inside those labor unions that are not getting a fair deal, want their union to be more aggressive, want their union to be more representative of the industry and their interests, and they feel like they're being pushed aside. Once we do that, I think then we can figure out how to deal with the resources that are going to be necessary. Because yes, they will come down, because many times people would say, well, Ed, if you had a general strike, all they'll do is they'll take your bank account and you'll be done. And I think the answer is yes, they will do that. And we have to figure out to be one step ahead of that. But we're not ready. We don't have enough organizational critical mass of people. And that's really what we're facing now is how do we get this critical mass of people, keep those other things definitely in our toolbox, so to speak. But right now, Let's get these people together, because if they don't come together with us, they're going to go to the right wingers. They're going to go somewhere else. And I think this idea that we can sit around and think that people aren't going to drift to the right or they're going to be apathetic is wrong. We have to provide them with solutions, better word. And that's where we come in, I think.
Lara?
Yeah, I think, your question is, it's like, it's still capitalist, right? And I think part of it is that, the question of, are unions linked up to a larger labor movement, right? And that's why it's capitalist. So what are you actually fighting for in unions if you're not linked up to larger labor movements? And for us to be careful about when we speak about unions, for example, people are often like, well, how can you be against cops? They have unions. And like 80% of cop unions are independent. They're not linked up to any sort of larger labor organization or movement. And that's part of also what we need to be refocusing. So when we are talking about unions, and particularly if we're talking about unions to advocate or fight for Medicare for all, these questions have to be talked about. How do we link them up with actual coherent labor movements that cut across unions and have a coherent idea and political analysis about why labor, for example, and healthcare need to be linked up in a particular way, and why part of our struggle needs to be an anti-capitalist struggle. It needs to be, right? And for us to think about this question of Medicare for all is an entry point for redistribution of wealth. Right? And if we can sort of organize it that way, but many of the unions, the way that they're working today, are not taking up these questions. They're not pushing up against capitalism in any particular way. They're not talking about a sort of a larger movement of working class folks. They're talking about class mobility, right? At the expense of what? They're not talking about restructuring the way that capital flows in this country in any particular way.
Well, I think, excuse me, if you look at all, again, if you look at all of the unfortunate industries that have collapsed in this country, whether it was the rubber industry, the steel industry, the auto industry, it has a third of the workers or whatever, the airlines, half of them, they were all unionized. Every one of them were totally unionized up and down the ladder. So going to your point, Laura, that's the question. We need a labor movement that has some political ideology that understands what the forces are that are for and against them. And it's like, in my experience in Western Pennsylvania, the steel mill shut down and the union was basically just like sleeping. It was like sleepwalking. And why was that? That was simply because they didn't have the right direction. They didn't have any political direction. It was tied to the Democrats. So we don't want to keep our Medicare for all movement in that box. So we should learn from that and say, well, we can't just think that passing the ACA is a road to single payer. It's bullshit. It's a road to hell. It's a road to nowhere. And so anyway.
Lara, I want to actually switch gears a little bit. I want to ask you, as an actual doctor and healthcare provider, what it's like when you have to deal with patients who do not have the means to get services, medication, therapy, anything like that. What is it like on your end to have to, to deal with that and try and comfort them?
Yeah, I deal with that a lot, and as a clinical psychologist, there's an added level to that because mental health parity is never a conversation when it comes to this. And we're talking, right? It's very rarely talked about in these ways. A couple things, and I think this has to be part of the struggle. If we're talking about Medicare for all, sometimes we also get sort of bogged down by this idea that it needs to be, when we're talking about Medicare, it needs to be on the side of what insurance company. In the end, Medicare is an insurance company, right? And I think that's the question for me, is that anytime I am dealing with an insurance company, I know the people I care for are on the losing side, because I'm already on the back foot having to argue. And I worked for Medicaid for many years as a policy analyst and a policy writer. There are almost virtually no clinicians on the other side making these policies. So when we look at it and we're like, this makes no sense, you're all right. It makes no sense because there's no clinical people oftentimes making these decisions, and they're certainly not holding in mind who needs these services. So number one is sort of an education process about how do we really do a workaround. And quite frankly, I'm working with a large group of people nationally and internationally around mental health co-ops, for example, that allow us to divest from insurance companies that make the decisions for us. Because insurance companies, not only do they then set up the contract and allow you to have allow access to people's health information that I would never give to anybody else. The second I make a contract with an insurance company, they can ask me for my notes, they can ask me for diagnoses, they can ask me for notes to say if I'm allowed to see somebody for another session. They dictate the length of treatment, they dictate everything. So part of what I do is to sort of work with people in coalitions to say, what are ways that we can divest from insurance companies? And that needs to be a conversation when we're talking about Medicare for All. How do we do this in a way that puts people who are receiving care, whether it's patients or clients, however they identify, and their clinicians or healthcare providers as the decision-making people, not insurance companies, not Medicare, right? Because if we just sort of say Medicare for all and don't take up these questions, then it's just going to be Medicare making the decisions about how long a treatment can be, right? My working model is that folks come to me and name their price so that I don't have to use an insurance model. And it's a community process. Talk about redistribution of wealth. That's how I talk about it. If you have money, you pay more and you underwrite the person that I see or many folks that I might see for zero. And it's a range of seeing people. And we see a lot of people across this country, particularly, doing this more and more so that we can divest entirely from insurance companies. That needs to be part of the conversation when we're talking about Medicare for All. Who's the decision-making party in this? And that needs to be a collaborative communal process between people getting care and their doctors and their caregivers, not Medicare and not an insurance company.
Absolutely. And that's why we're pretty adamant about saying national improved Medicare for all, because we don't want everyone to have Medicare. We want Medicare expanded into no fees, no copays, no deductibles, no premiums. We want more like an NHS, and it's kind of it could be a misnomer. It does kind of lead people to think, well, Medicare has got a lot of issues. I don't know if I want that for everyone. So you're absolutely right. Oh, hi. Hello. Thank you so much for joining, Eric. This is Eric Kessner. Who is Ed, can you silence that? Is that your phone?
Yeah, that was me. Yeah.
Eric is joining us from DC. He actually went to DC to go to the White House, and he's been out there basically fighting for Medicare for all, standing on the side of the road at the White House with signs and trying to get people involved. So how's it going, Eric?
It's going great. Thanks for having me on, Joy.
Absolutely.
Yeah, my name's Eric Kessner. I'm from the Seattle area. I drove out here, and my son and I actually came out here. He flew back, but yeah, we're working on a couple things. So I'm with Real Progressives, and I work in the outreach and activism department, and I'm the creator of Yellow Vest Actions back in October of 2019. We're formerly called Burning Your Vest, but then after Super Tuesday, we changed the name of the group, and then finally met up with Real Progressives, and now the name of the group is Yellow Vest Actions for Real Progressives. So you can go check that out and join us if you'd like. Also, go to if you're new to MMT, go to realprogressives.org and click the media button on the drop-down menu, and there's a lot of great articles on MMT. But anyway, yeah, I'm here, and we've got a twofold mission, and that is to have direct actions for Medicare for All, to organize with the March for Medicare for All for a DC march, hopefully, and also to get people to start talking about MMT. It's kind of hush hush around here. There's only one person that is one congressperson that's come forward to, officially on the record talk about MMT, and that's John Yarmouth, a Democrat out of Kentucky, who sits opposite Mitch McConnell. And he did something amazing. He leapfrogged all of the squad as far as being a progressive, and he officially went on the record, talked about modern monetary theory, said the words, held up Stephanie Kelton's book, plugged it, and proceeded to tell us that Americans and a lot of members of Congress need a re-education on the way our economic system works, and that that everyone is asking the wrong questions, being how are you going to pay for it? That's the wrong question. But they teach us to ask the wrong questions. We've been propagandized from birth till death, right? And they tell us that where are you going to find the money? We're going to have to borrow it from China. This burden's going to be on our grandchildren, as we run this debt up, and it's all just lies. And that's not the set of questions we should be asking. We should be asking, what do the American people need? Is what John Yarmouth said, because we have the ability to do what the American people need. We can pay for whatever there's the political will for. So, oh yeah, this is me on the side of the road, and we've got a lot of support in DC here. There's people honking their butts off for Medicare for All. I'm over on the George Washington Bridge there. Can you see that clip?
Well, I can't, but
I think Andy put the clip up for everybody there.
I totally agree with your sentiments on MMT, and if you guys want to learn more, you can watch the panel prior. But I do want to keep it about activism, since we don't have much time left. But what are you finding? I know you said a lot of people are honking their horns, but are you hearing any stories? Are people telling you what would improve with their life if they had actual health care, or speaking to any homeless people, or anyone with some kind of impactful story?
Yeah, well, at one point, this conservative movement, the People's Convoy, was approaching town, and I was getting so many honks on the George Washington Bridge from passersby. I mean, that's not a lefty movement over there on the George Washington Bridge. That's an everybody movement, right? They're all just a bunch of random people driving by, and a majority of people would honk. And I started thinking that this is not just a progressive movement. This is a people movement. It left, right, communist, socialist, everybody needs healthcare. There's a lot of crossover here, and I think that this is the issue that Americans can all get behind, that we can unite on. And so I got curious, and I started wondering, what about this convoy? What do these guys think about Medicare for All and uniting the working class? And so I brought my signs over to an overpass there, and we set them up. And one sign said Medicare for All now, and the other one, giant signs, right? The other one says unite the working class. And everybody was honking for it. And it's not a left or right issue. It's a everybody issue. And I have the strong feeling just the people in Washington, D.C. alone is enough to start a coup around here for Medicare for All. There's a ton of people here. There's a lot of activists. There's a lot of supporters. But anyway, to get to your question, we were winding down that day, and a guy was walking by. I had the signs leaning up against the side of my car, and the first one, the only one that he could see, because they were stacked on top of each other, the only sign that he could see was to unite the working class. And he's like, yeah, let's do that. And And I was like, yeah, let's get some health care too, man. And he's like, oh, geez, I could retire. I mean, this guy was retirement age, right? And it's like, I could retire if I had health care. So what, what we're hearing is that that the lack of health care keeps people working shitty jobs. Um, they need the money and they can't retire, and the only reason that they're working, a lot of them, is just for health care. We've got a lot of families where one person in the family is just keeping a job just for health care. And there's a lot of better things that people could be doing besides working for the man, right? So I really think that a lot of people are ready for this. I think it's on the tip of everybody's tongue. I don't think we're in a bubble on this issue. I mean, there's some issues, like MMT. Sometimes we think, oh wow, we might be in a little bubble here, just with the people on social media that were around. But on Medicare for All, we are not in a bubble. Everybody wants it. Not everybody, but a majority of people want it. I think it's 70-75% in America. And I believe there's 120 co-sponsors on HR 676. And, people aren't going to stop talking about it until we get it. And so I really think that the time is now. And what really brought me out here now is I see our window shrinking for this. I see Biden trying to get on this REACH program that Trump started and trying to privatize Medicare for all. That's terrifying. I see this pandemic winding down, and in the back of my mind, I'm thinking, God, if we can't get Medicare for all during a frickin' pandemic, we might not get it at all. So I think now is really the time that we need to force this issue. And I think there's enough people in the Virginia, District of Columbia, Washington, D.C. area to have a lot of people for a march if we organize one. So lots of crossover. Everybody that I talk to about Medicare for all, sometimes when I'm protesting, I'll say the same thing over and over to people. I'll say, hey, you deserve health care. And people always come back at me with the same response, and that is, we all do, and we're not in a bubble. America is ready for this. We just need everybody in the same place at the same time to push it through and pressure these guys. I don't feel that politicians feel online pressure. I think that the only time they really feel pressure is when you're outside their window with your sign and you're screaming at them and they're trying to figure out how to get home. I mean, that's when we have the opportunity to move them left. And I don't think it's going to happen unless people get in the streets and make it happen. History has shown us over and over. This is a Bernie thing that I heard him say in 2015 at the Seattle rally. He said that every successful movement that's ever gained any traction, whether it's civil rights or women's rights or gay rights, any of those successful movements, none of them would have happened unless those movements were catalyzed in the streets. Masses of people coming out in the streets. People getting jailed. People. Sometimes dying. To say that in this country, things need to be fair, right? And so, as far as women's rights go, I mean, there was hunger strikes, and women died, and it was out on the streets where civil rights movement gained all the traction, and that's when politicians feel pressure. They don't feel pressure anything we do online, I don't think. So I think the only way that we're going to get what we want is in the streets. Not that I disagree with voting. I think voting is where our responsibility starts, not where it ends. But I don't think that our representatives, no matter who we vote for, no matter how we vote, I don't think that they're going to be able to push Medicare for all across the finish line because they're bought, right? So the only way to do it is mass direct actions. And so that's why I'm here.
And to touch on that, and I digress because it's not about healthcare, but I recently had an activist, a gentleman from Oahu, Hawaii, and he was talking about Red Hill contamination, which is, very much racist against indigenous peoples, and was contaminating people's water. They have 20 bunkers full of oil, and each one was about 25-story building in size, and their water line was 100 feet below it. So obviously it was leaking, people were getting sick, everything like that. Had this gentleman on, and 3 days later of last week, Red Hill was shut down after 80 years. Water protectors were there every day with signs chanting. It was shut down after 80 years. And that just happened a few days ago. It's incredible. So when people get defeatist, I get it. I have my days. I have my weeks sometimes. But it is possible. And also, if you haven't seen my Stephen Donziger interview, I asked him, and this man has been through hell and back and will probably keep going through hell. And I asked him, are the people in power greater than the power of the people? And I want people to watch what his answer was. It's pinned on my Twitter post. And if he can say the answer he gave, we can say it too. But in any case, I want to, I guess the last question will be, when we talk about what we want to do, and when we get pushed back like, what's the point? It's not going to work. Have you ever been given an actual suggestion of what maybe they do think would work? And also, what, as far as today forward, what do we need to do to actually make national improved Medicare for all a reality? I guess we'll go around again. Edwin?
So I think the most immediate step is fighting against the DCEs, the direct contracting entities, because that seems to be one of the most prominent obstacles in the short term. In the long term, and this is a little bit of a response to what Eric just said about tragedy, and if we're not going to get universal healthcare in a pandemic, when are we ever going to get it? Well, actually, I think that there is undoubtedly a Great Recession Part 2 that is incoming within the next year or so. And I think it's very important that we all prepare for it, because the oligarchs are preparing for it. And so we should be preparing for it as well. The main difference between the pandemic and the incoming recession is that during the pandemic, as long as you complied with the FDA, Pfizer axis of evil, you were able to maintain your employment and keep your employer-based healthcare. And only a minority of people who refused to comply lost their jobs and subsequently their health insurance plans, their private plans. But during a recession where there's going to be massive layoffs and higher unemployment, then you will start to see it actually crack down into what used to be middle-class voters who are no longer in the middle class and will start to actually join these actions and want to revolt and want to vote third party at the ballot box. And so this is something that we as a movement should be prepared for and take advantage of that tragedy to push for something like single payer Medicare for all, because we're going to see a lot of people who didn't lose their health insurance during this pandemic losing it as a result of economic turmoil.
So, I want to remind everyone, I've been saying it like all 16 hours I've been on the air this week, but Biden has the ability to give us an executive order, 1881A, literally could sign an executive order today, give us all national improved Medicare for all of us. No money, no payment. You're uninsured, you get it. You're underinsured, you get it. You're an immigrant, you get it. literally has that ability to do it today. We are watching eugenics of the poor start holding these people accountable. Please go to our website and look into our grievance that we are literally filing with the United Nations because of what they are doing and how they are ignoring that bill. So absolutely. Ed?
I think, first of all, I want to thank you for, having this opportunity to get on here and engage in this. Hopefully we can do it again. And I agree that online is good as an organizing tool, but we can't, we're not going to win this by this method. But what do we need to do? I would say we need to figure out how we can get ourselves organized in either local groups that are for national single payer Medicare for all. In other words, like why aren't there hundreds of local organizing committees for national Medicare for all around the country? Because we can't mobilize the mass of people that everybody says is for us unless we ourselves have a vehicle that they can get into. We have to be nonpartisan. We have to do direct action. We have to do smart electoral politics, and we have to basically persevere. We have to raise some money. We have to, because we can't do these things unless we have some resources. The task is immense. The ruling class has, unbelievable, obviously. They're going to be able to swipe down on us whenever we get stronger. Usually they don't attack us until they know we're getting stronger. And I think we already have shown that we have the capability of doing that, but we got to get ourselves organized. And local groups got to get organized so that we can then coalesce, whether it's in DC or whether in our capitals or our congressional districts. But that's really, to me, without being organized, we're just yapping around at ourselves and bitching and moaning, but we're not really going to be a political force. So if anything comes today, look at national single payer, think about getting yourselves organized, because that's really what we're trying to do in coalition with other groups.
And always, always, always have a list of demands.
Yes.
If you do an action without demands, it's a parade. Don't bother. Have demands. And demand. Don't ask. Demand. Clara?
Yeah. And then demand, don't take the playbook of like starting reasonable and making things digestible to people. That's not what works. People move to the right. So ask for everything. I laughed, Joy, because when you said that Red Hill is like a change in direction, I actually don't think it is. I think that's one of the things we need to do is stop thinking about this as a single issue. Our fight is alongside water protectors and land protectors, and all these issues are linked up in a way that when we can talk about people living in dignity and outside of oppressive structures, we're also talking about all those things. We're talking about climate catastrophe. We're talking about, people's right to dignity in terms of living their life aligned with how they want it to be. Those are all linked up. So that's one thing I would say is we need to stop making this just an issue about this. This is linked up across issues where we're fighting oppressive structures. The other thing I'll say is stop getting seduced into the conversation around how we fund this, right? I heard you say that before, and I love that you asked that question, sort of like tongue in cheek, because it is not our responsibility to decide where this funding comes from. We see that this government, particularly this settler colony, funds Israel to the tune of $3 billion every single year. There is funding that comes to us. So our getting bogged down in these fights around how are we going to find funding for is a deflective technique. This is the clinician speaking now. People use deflection to bog us down in these details and to disorganize us and discombobulate us from the central issue that we're working about. Don't succumb to those questions, because those questions are not ours to figure out. When people can figure out where funding comes from for everything else that they want under some particularly military and imperial wars, then we can demand that they find a way for everybody, not just people with jobs, to have adequate health care.
Edwin? Or no, wait. Yeah, you already went. Sorry. Sorry.
Eric.
No worries.
Yeah, I think that think we need to stoke outrage, and the best way to do that is get people learning MMT. Sorry to go back to that, but the money's there for whatever we need, whatever there's political will to accomplish. The money's there for it. As we see with this war budget, it seems that we have the political will to have a $750 billion war budget every year. So the money's there for whatever we need. But when you find out, when you learn MMT and you find out that the government isn't constrained like we thought it was, when people are asking themselves the question, how are you going to pay for it? And that's the wrong question. And the real question is, why are they trying to starve us out? Why are they trying to, not by the way they talk, but by the way they're voting? It seemingly that they're trying to like starve us out. I'm sorry, but that's just the way it seems. And Steve Grumbine has that austerity is murder tagline, and it's so true. So once people realize that the money is right there and it's been there all along, and that all of these deficit hawks are lying to us, that really makes it come full circle for a lot of folks, and they realize that the things that we want are within reach. And also, just to bounce off what Lara was saying, we do need to go for a whole bunch all at once. Bottle Kaboom, he says the three-layer cake, right? That is that the Green New Deal, which is what we want, that equals economic justice and environmental justice. That is what the Green New Deal equals. And so with the Green New Deal, that's a huge build out, right? Lots and lots of jobs. So we need a federal job guarantee with an attached healthcare benefits package, and establish a new base wage, whatever it is, $15 an hour, $20 an hour, whatever that base wage is, would be the new minimum wage. And we can kill a lot of birds with one bundle, So, attach a federal jobs guarantee to the Green New Deal, to that build out, and give everybody that signs up health care. And I think that's the best direction to go.
I was going to kind of end on this note, and Lara said it perfectly. I think, we have to realize everything is inextricably linked to healthcare. Everything. Like this weekend, for the past 3 days, you have seen panels on environment and healthcare, mental health and healthcare, disability and healthcare, economics and healthcare. You have literally seen panels, 11 different panels on different topics, all related to healthcare. This is the major issue. Yes, student debt is important. Yes, Green New Deal is important. Without healthcare, we have nothing. We need to be taken care of health-wise, not insurance-wise, health-wise. Everyone, meaning homeless, meaning low income, meaning people of color, meaning disabled, meaning everyone, national, and then everything else can fall into place, but that has to come first. MLK Jr. said it is the greatest form of violence. We are witnessing violence right now. So I've been on the air like 16 hours this weekend. I am so honored. This weekend was phenomenal. I cannot thank the four of you enough. All of our panelists. Stay tuned. We still have more. But wait, there's more. So thank the four of you so much for all you're doing, all you contributed. And I am so glad and honored to be in this fight with all of you.
Thank you.
Thank you.
Thanks, Troy.
Thank you. Much love. So I think we are going to bring in Luke. Yes, Luke, there you is.
How's it going?
Oh my God. I feel like I'm gonna cry. Like, this weekend was just so fucking awesome. Like, oh my God. I
Yeah,
just can't. Like, I'm trying to think of highlights and stuff, and it's not over, so don't take this as it's over. But like, I learned so much. Like, I really, really learned a lot. And I know all of you guys, it's not like, everything's foreign to me, but I still learned so much. And that is such a huge component to what we wanted to do this weekend.
Yeah, I feel the exact same way. It's, I as a commentator and I study social sciences, I figured I had a pretty decent grasp on a lot of this stuff, and yet at every panel that I conducted, I found myself learning a whole bunch of new things as I went about it, and I think that's a good indication that the audience probably feels the same way. So, what fantastic panelists we were able to put up here, and what a phenomenal summit this has been.
Oh my God, it really has. Do you have any moments that stuck out to you in particular?
Well, I'm biased, so the MMT panel, but really all of it. I think I honestly just think all of it was really fantastic. Healthcare can be such a complex thing when you approach it from all the different angles, and I think that we were able to do that. Highlighting how different communities are affected by our healthcare system, and how marginalized communities are often harmed by our healthcare system. I felt myself learning a lot, or found myself learning a lot about just the way that the system actually, some of the intricacies, the details of how the system actually operates, and how the profit incentive and privatization ends up in more ways than I even realized, creating a perverse incentive structure, and disallowing people from healthcare. It's amazing that we've created this system where the very companies and corporations that we task with providing healthcare seem more interested in denying people care than actually providing it. It's just completely ass backwards. And to learn even more details about that is both enraging and also yet inspirational, in the sense that I hope that some people that were watching this weekend, may have learned and be able to take that forward with their activism going forward.
Absolutely. I mean, I was inspired by so many people this weekend. I think, Mike Pappas really stands out to me. I just think he's just beautiful, and he's so intelligent in the way he speaks, and he makes so many great points about capitalism and just how that is the root of so many evils, which so many of us believe, but he breaks it down into something just so genius. Dr. Valerie McRae, it was great to talk to her again, having someone in the mental health field break down what it's like to have to tell people who need services,
no,
sorry,
I can't. Yeah.
I mean, just so many, I have goosebumps, like, seriously, thinking about some of these panels. I mean, yes, I know we're volunteers, but like, we are lucky as fuck to do this. Like, I'm just gonna say it right now. Like, I feel so fortunate.
I consider it an honor, and I also just wanted that last panel was absolutely fantastic. I didn't catch the entire thing, but I was so inspired by the activists who are going to take this fight forward. And a huge shout out to all the panelists, but Eric, I know is in DC, and I'm sure that you guys mentioned that. And major solidarity with Eric and anyone who's engaging in that kind of organizing and activism. Those are the doers among us. It's easy enough for me to sit up here in a studio and talk about this shit. I just really want to commend the people who are taking this to the street and taking our fight to the front lines. And that obviously includes the March for Medicare for All group, who have put together these kinds of events and highlighted these kinds of issues that unfortunately, even though it's such an important issue don't get enough time, certainly in the mainstream media, and even in my view among independent sources. So it's really important that we can continue to highlight this and fight for this. We have like 75% approval on this shit. I mean, name me another policy where you get that kind of support. It's very difficult. So once we're there, it's like, okay, if the remaining 20 or 25% are just the dogmatic right-wing nut jobs who are going to dig their heels in, we've kind of reached this, like, what happens now? We've earned the support. We've won people over. We've won this debate in the public discourse. So now it's all about action and doing. And I was inspired there by that last panel.
I think, we'd be at 100% of people if they realize they literally get no bills now. They get like no premiums taken out of their paychecks, things like that. I mean, who would be against that? Like, I'm just so rich. Let me pay for everyone's healthcare. I don't care. It's like, you are privileged as hell if you do not want this for everyone.
Yep.
And it's sad because we do see, being in this fight and being activists, we do see so much privilege and we see so much lack of empathy. But then, and lack of empathy and cognitive dissonance is a cancer. But then we also, see so much solidarity. Like, after I shared my story for the first time at the Force the Vote town hall, I mean, I literally got a couple hundred messages of support. I don't want to cry, but there are so many people going through what we have talked about this weekend. It's not an isolated incident. And I think that, people should not wait until it happens to you or someone you love. Healthcare is a human right. And I know we say that a lot, and it's kind of, it was Bernard's tagline and stuff. Don't get desensitized to that. It is a human right.
Yes.
We are part of humanity. We deserve to survive and to thrive. Not even just to survive, but we deserve a healthy life, an equitable life. I don't know. I just feel like I'm like, like I could just talk for like 5 hours.
Well, I think, and I think some of the reverberating effects of what Medicare for All would mean often get kind of lost in the weeds. And, I think we would be, in a sense, healthier from the start, because we wouldn't, like, a lot of people let a problem become a lot worse because they don't want to pay to go see a doctor. So I think a lot of the health issues that we're seeing would be like, they would be less prominent in a Medicare for All system because people would be quicker to go to their doctor. I talked a little bit about the reverberating effects of how much, unions would benefit in having resources to apply to other negotiations. There's just so many sort of reverberating effects from something like a single payer system that I think, people don't necessarily think of. And it would enhance our lives in so many different ways. It's really incredible to think about and inspirational to think about. And yet at the same time, kind of enraging that we're still in 2022 and we don't have it,
Absolutely. And, that kind of introduces our next section. We received cameos from numerous people. Some people you will absolutely know, but some people, just everyday people with medical needs who have been victimized by this violent, vulture class system. So I do want to give a trigger warning, both about what I'm going to say and about the videos, but you will see the way that healthcare is linked to everything from you cannot leave a job because you can't lose your healthcare. You can't leave an abusive relationship because you'll lose your healthcare. You can't you're homeless and living on the streets. You can't go to the doctor because you have no healthcare. You can't afford your rent because you have no healthcare. You can't go to college because you have to prove that you have healthcare to even be in college, which a lot of places started now. I know Pennsylvania doesn't. things like that. So, I mean, it is literally linked to everything.
Yeah.
So, any last thoughts, Luke, before we go to the cameos?
Well, I just want to encourage people to share this widely, and support the organizations that put this on. You know, March for Medicare for All, and Real Progressives, and Yellow Vest, and Indie Left Media, and I believe I'm forgetting one or two, unfortunately, off the top of my head. I just really. There it is, National Single Payer. I just encourage everybody to support all of these groups. Share this content widely. Obviously, you guys, the algorithms on the various tech sites are not going to love us. So I just encourage everybody, if you have maybe family members or friends or things that don't have a comprehensive understanding of our healthcare system, I think this was all such great material that you can send to them to try to educate them. And I just really want to encourage everybody to push this content out as far and wide as possible, because it's really, really important stuff.
It is. It really is. And Luke, I adore you to pieces. I'm so glad to work with you again. And everyone here, please don't forget about all the people behind the scenes. Like, there are
Yes.
I know I'm going to forget people, but Elizabeth, Dan, Shane, Virginia, I'm going to forget people, and I hate myself for it, but my mind is...
I definitely got to shout out Andy, who saves our ass on the back end all the time, left and right.
No,
Big
I'm
shout out to
him.
Andy.
He gets his own separate.
Okay, good.
Andy is the reason we did this shit for 3 days.
Yeah.
Like, without dude on the back end, and don't be perverted, without him on the back end, this shit would not be happening. He is the man behind the curtain. So, Andy, we love you. We cannot thank you enough. So we will get to the cameos again, trigger warning, but these are the stories we need to hear. Also, I'm gonna pimp that gift basket again. We need your donations. We do have other future actions in the works. So unfortunately, we do need help as far as donations go. Every $20 donated to us, you get a raffle ticket, meaning you donate $100, you get 5 tickets, and so on. $150 value, plus we will pay for shipping, all this rad stuff. So not only are you helping us, a true grassroots people-powered movement, no super PAC needed, you are helping us fight for humanity. You are helping us fight for national improved Medicare for all, and you are going to get a chance to win some rad stuff too. So
absolutely,
I mean, that's a win-win.
Yeah, I to bring out some nerdy humor and tie it back to the MMT. Unfortunately, we are not a currency issuer, so we do rely on money. We need your donations. That just is what it is. I wish we could print money and fund all of these actions that way, but obviously we cannot. And as much as it kind of sucks to ask people for money, I always hate that. This is a very good cause, and these kinds of actions are going to drive the discussion going forward, and we absolutely need to continue that discussion. So I encourage everybody to donate to the March to M for All, as well as organizations like Real Progressives and Yellow Vest Actions, where Eric is organizing in DC. Indie Left Media. What's the one I keep freaking forgetting? National Single Payer, is that what it is? There we go. We do have to ask, unfortunately, and anything you can do to help the cause, I strongly encourage the audience to do so.
So instead of donating your money to politicians who say they're going to fight for Medicare for all and then proving they don't, squad, please give to organizations like this, mutual aid, something like that is actually going to the cause. That's my spiel.
Absolutely.
So thank you so much, Luke. Much love. Thank you for everything.
It's been an honor. It's been an honor. I very much appreciate the opportunity to participate in this. Thank you to all of the viewers for tuning in. It's just been such a pleasure to be a part of this weekend. And again, just want to reiterate, thanks to all the people behind the scenes. You all did absolutely fantastic work, and it's very appreciated.
Absolutely. Again, trigger warning, but here go the cameos.
Everybody, I'm Robert Durden. I'm sorry I couldn't make it today, but I wanted to weigh in on the question that you guys are talking about today is, are we going to be able to figure out a way to get Medicare for all on a national basis? And do we do that by going to the ballot box harder, or do we need to focus more on mutual aid, stuff like that? Now, when I started PFC, I was fully on board with democratic reformationism and getting as many squad members as we could elected to Congress. And as the year has gone on over the last 14 months since Joe Biden took office, I have made an absolute flip, because I've been cataloging exactly where the squad could have utilized leverage to get what they want, and they haven't done anything to actually help the people. In fact, there's been over 10 times where there was a vote that they absolutely screwed up, or they voted just ever so correctly to allow something horrible to happen, and they could have used that as a leverage point to Joe Biden. Some examples of this are like the Capitol Police budget was close, Iron Dome, the Invest in America Act, which was the corporate giveaway Republican-written infrastructure bill, that was a narrow margin. I could go on and on. There's plenty of places where they could have used Tea Party tactics to get Biden to actually do executive order. There's a part of Obamacare, the Social Security Act, Section 1881 Alpha, where via executive order you can extend Medicare for all to the entire populace of the United States because there's a pandemic going on. They did this in Libby, Montana because of asbestos. They did it in Texas when the blizzard hit and it knocked out their electrical grid and there were people dying. They all got Medicare for all because you can do that. And the squad could have forced Joe Biden along the way, or at least fought for him to do that executive order if they wanted to. They have not even really tweeted about it over the last year. And so I do not believe that going to the ballot box is going to be the way to get us what we want. Putting more squad members in there, I don't think you're going to be able to do it because nobody really trusts the squad to get anything done anymore. In terms of Medicare for all, they already flubbed the force the vote. They didn't utilize leverage, and it would have been super easy to force the vote on Medicare for all. They didn't do that. They haven't used their leverage Tea Party tactics to make Joe Biden give us Medicare for all, and they certainly haven't done anything in Congress to actually push Pramila Jayapal's bill, meaning it already wasn't going to pass the House. They're not doing anything to get it to pass the House. They're also not leveraging any senators because they could. Via their social media apparatus is very big. If they wanted to make Joe Biden go after Joe Manchin, or even attack Joe Manchin publicly to get something like a Medicare for all bill, they could. They're not doing that. They're not doing that. Now, there is an answer, I believe, to how we can actually get Joe Biden leveraged, and it comes via going outside electoral politics. I imagine this summer will be filled with protests via anti-war protests if this thing with Russia and Ukraine keeps going on, anti-mandate protests similar to the trucker convoy up in Ottawa right now, and I think it's going to be maybe a very slim chance that we can get a general strike going. If we can figure out what the spark is and roll with it, sort of like what's happening in Canada right now. If there's a worker uprising, and I don't know what it's going to be about, it could be one of the two things I mentioned. It could be anything. Could be anything. If we get something large, like the Black Lives Matter protest going, but actually make it more targeted, like what's going on in Canada right now, shut down some transportation spots, use the ink blot military tactic and shutting down transportation areas to actually get what we want, theoretically the people via a general strike could actually get Joe Biden to give us Medicare for all via executive order. I think that more likely than the squad and the Democrats actually doing it. They're not going to pass it. They'll blame the parliamentarian or the filibuster, or somehow they'll blame the Republicans, or they'll blame the Supreme Court. They'll rotate the villain, Manchin, Sinema, whatever they have to do. They won't do it via Congress. We might be able to leverage Biden to do it if we do a general strike. Now, the last evidence I have that it's not going to work at a state level either is the recent filibuster-proof, if they had a filibuster, state assembly in California, which let Assembly Bill 1400 die. They have 70% Democrats and a supermajority, like a mega supermajority in California, and they didn't even bring it up for a vote. So any argument you have that we need to vote harder, put more Democrats in, or put more squad members in, I don't see any evidence displayed to me that that actually can work. I think that if you want to get it on a national level, we have to, in this next year, before the Republicans take over the House and the Senate, While they still have a majority, we need to exert as much leverage via protest this summer as possible. Perhaps we'll get some sort of general strike going, and we might be able to negotiate, if not universal health care, maybe he'll finally give us a public option. We'll meet in the middle. I don't know what's going to happen, but it's never going to work unless we have a very strong outside game. The inside game ain't working. There's no evidence you can give me that the squad has stood up to the Democratic elites even once. So to elect more squad members or vote harder is, to me, kind of a naive concept. It reveals to me that you have a lot of faith in the Democratic Party, who has not done a damn thing for us over the last year. So if we want to get this done, it has to be via mutual aid, direct action, and we have to ride protests and create and organize protests this summer, and maybe we'll get lucky. Thanks for having me, guys. I'll talk to you later.
Hey, Joy asked me to put this video together for her Medicare for All event this weekend. And I gladly accepted because I would like to see home and community-based supports, a universal home and community-based supports program put into a Medicare for All program in the United States. The reason being is, well, our family was wrongfully terminated from our home and community-based supports about 3 or 4 years ago by Amerigroup. And because of that, I started to look around and really started investigating the Medicare privatization of our Medicaid system. What I've found out, I'm not really happy with. I did some digging on the wait list increase. And our wait list here in Kansas, according to the Kansas Department for Aging and Disability Services, in January of 2021, it was at 4,493 people with IDD, intellectual and developmental disabilities, waiting for home and community-based supports. In November of 2021, which is pretty much the end of the reporting period, it ended at 4,622. So this waiting list grew by almost 200, just shy of 200 people, under 200 people, in just January, February, March, April, May, June, July, August, September, October, November, in just like 10 months' time. So, and that's just the people on the waiting list. That does not even address the time that people are spending on this waiting list here in Kansas. The people on this waiting list are spending at least 8+ years on this waiting list, which is ridiculous. Now, we need funding for this at a federal level because we cannot count on the states to do what is right by people with disabilities. In 2021, the budget analysis was released, and according to the budget analysis website, the agencies who are in charge of the IDD waiver requested $16,842,875 for the reduction of the wait list. It didn't get a dime from our governor, who is a Democratic governor, by the way. We have snakes on both sides of the aisle here. So the IDD waitlist got no money this year. And as far as I know, the IDD employment services also did not get any money. They agencies that administer employment services for people with IDD requested $21,980,880, and the governor did not give any money to these agencies also. And it looks like the PD, which is physical disabilities waiver, wait list reduction, did not get any money either, which they requested $3,180,995. So IDD employment and services agencies didn't get any money. IDD waiver, wait list reduction, management services, whatever you want to call them, didn't get any money. And physical disabilities wait list reduction agencies got no money. So didn't get any money. Sorry. So, like I said, we can't count on the states to do what is right for people with IDD. We need a federal program that, and for anybody who out there who may be a constitutionalist or a states' rights person or whatever, in this case, we need a system to where the states can be bypassed and people with intellectual developmental disabilities like my son and our family can get the help that they need further up the chain of command. Not only that, with a universal home and community-based supports system, we need better training for care attendants. We need a universal training model for them. They need better pay. And families like mine who can't work because we don't have a care attendant to help us with our disabled loved ones, we need some real help too. If we're not going to get able to get back on the waiver, then somebody needs to help us out too. So, I keep beating this drum here in Kansas, and I don't know what else to do. I just keep talking about it on social media. I've gone on then Hair of the Dog and talked about this. I've talked about it on the Lone Wolf podcast. I've talked about it during a disability panel with then Fred Hampton leftists with Jay Buffont. I talk about this anywhere and everywhere I can think of to talk about this, because people with intellectual and developmental disabilities in this country are getting left behind. My son is one of those people, and I'm fed up and pissed off, and families like ours need some help, need some results. So thank you again, Joy, for letting me come on and talk about this. I'm not a professional public speaker. I just speak from my heart, and I speak with facts. And I'm willing to provide links to where I got my information from to anybody that wants to see the information firsthand for themselves if they are in doubt that this is actually happening. And I look forward to hopefully seeing or connecting with people who may watch this video. So thank you. Bye.
Hello, everyone. My name is Andrew. You can find me on Twitter at RadicalPragmat1. And you also can find me on Savage Joy Show. You probably might recognize me on Postmortem Breakdown every Monday at 9:30. Anyway, I'm here just to quickly share why I support National Medicare for All. It's a couple of simple reasons, I think, that it just benefits anyone. First of all, under our current system, if you are employed by anyone, if you want to have affordable insurance and you don't qualify for Medicaid, right, you are most likely going to be put on your employer's insurance, right? And so that creates in a situation where you now feel indebted to your job. You can't quit your job because then you lose your health care, right? Medicare for All, already having insurance and not having to rely on your employer will change that, right? So that is one quick way that I support Medicare for All. Another is, say if you are seeing a doctor, say if you are seeing a therapist, and say if your doctor or therapist switch practices, right? If you are covered by an insurance that is out of network with the practice that your doctor switches to, you either can no longer see that doctor or you have to foot the whole bill, pay the whole costs out, right? With Medicare for All, you can actually keep your doctor. Unlike what Obama said under Obamacare, right? You actually can keep your doctor if you like your doctor under Medicare for All, right? And I think this really intersects into how, mental health and universal health care, Medicare for All in particular, really intersect. Right? Because if you feel like if you are in a job that's being abusive in one way or another, you can quit and not worry about losing your health insurance, right? That's good for your mental health, right? If you are seeing a therapist and your therapist has to switch practices, you can actually, with Medicare for All and being covered, right, and not having to pay out of network, you can switch with your doctor, right? Or your therapist, doctor, whatever, and not have to worry about being introduced when you are in a vulnerable state to someone else, right? And so, I could go on as to why I believe Medicare for All is the best option. But I think that really speaks for it, here in Massachusetts, right? Even with the most people covered, right? There are over 200,000 people who are not covered in Massachusetts, right? That's a mid-sized city. That's bigger than Worcester, which is the second biggest city in New England, right? That 200,000 is a much bigger population than Worcester is. So that is why I support Medicare for All on a national level. Everyone needs to have health care. It is a human right. Thank you very much, and appreciate Savage Joy for you doing this very necessary panels. Peace.
Howdy, y'all. My name is Novi, and here is why I support Medicare for All. Healthcare is a fundamental right as governed by the UN Charter, and it is guaranteed under our Constitution under the qualifiability and the right to pursue happiness. So, why don't we have it? Technically, we do for our kidneys back in the 70s, but even that's taken over by the for-profit industry. And if we had something like Medicare for All, a truly nationalized healthcare system, everybody would be covered. Also, there wouldn't be as long lines for doctors, because instead of having to mess around with insurance and trying to beg some bureaucrat to get them so that you can get the treatment that you need, they could just go and do what they do best, which is helping people. So it works out for doctors as well. The only people who wouldn't work out for is insurance companies, but I'm not too fond of them at all. Are you? I grew up in Texas. My dad has chronic health issues, so do I. And I have an intellectual and physical disability. So, before the passage of the ADA, it was very hard for him to get his medication, and as a result, he had seizures that were very dangerous. And at least on one occasion, he could have died. And because we were covered over our parents' insurance, He couldn't get his medication needed, and we couldn't get any treatment that we needed. With ADA, he was finally able to get his medication, but soon prices went back up, and you're in the same situation that you are before. I got accepted to go to school in Arkansas, and then I went without seeing a dentist for 7 years because I went from being on my parents' insurance but having to travel 5 hours to see a doctor when I didn't have a car to not having insurance at all when my father turned 65. During that time, I sustained many injuries that if I had been insured, I would have been treated and I wouldn't be in a role later today. And my story isn't uncommon. I finally went to Louisiana and I got for grad school and I got on Medicaid, and whereupon it saved my life. There's a good chance I would have died if I hadn't been on Medicaid at the time. And then lost it because I finally got a job where I made just slightly over the Medicaid limit. My story isn't unique. There are millions of people across the U.S. who are underinsured or not insured due to circumstances of employment and their family's history and other things like that. These are things that were supposed to have been made illegal back in 2012 and weren't. We need a national healthcare system. Everybody should be covered. Everybody has the right to live a long, healthy life and not have to deal with all these damn loopholes. So please, support Medicare for all. Thank you.
Great crowd. Thank you all for joining us in this march and in this fight. My name is Dan Gallagher. I want to introduce you to my mom. This is Ann Gallagher, and thank our graphic artist Shane Willis, who put together this awesome graphic that looks right out of Hollywood's golden age. So when we rang in 2020, I don't think any of us really knew what lay ahead of us. Beyond the daily challenges of dealing with COVID, I also learned that my mom would not make it to the end of 2021 and dealing with her end-of-life care. Mine is the story of discovery of a rigged and broken for-profit healthcare system where our seniors are prey to the health insurance predators. What I was about to discover shook me to my core and is a decision faced by millions of families all over this country. Simply put, how to care for a parent when Medicare does not cover long-term care. You probably recall Bernie Sanders talking about this during the primary. My mom was 93 and had dementia and lost her ability to swallow and was slowly wasting away. She needed 24-hour skilled care. After a short-term stay in a hospital and a rehab center, where I couldn't visit due to COVID protocol, I was told my mother was being released and to come pick her up. Although she had both Medicare and private insurance, if she wanted to stay beyond her official discharge date, it would cost $650 a day with a $20,000 deposit. I realized at that moment that I stood between my mom and a facility probably out of a Charles Dickens novel, or maybe even the street. However, this is the rigged part of our healthcare system. A good quality nursing home or rehab center is more than willing to keep your parent. All you need to do is sign over their assets like their home to the state. They even have all the forms ready to go, which I was kind of blown away by. You know, those same assets that your parents worked hard for all their life to hopefully leave to their children when they pass away. So our for-profit healthcare system now even targets middle and working class generational wealth. I then became my mother's unskilled 24-hour caretaker in her home until her death last October, with minimal visits from hospice nurses and caretakers. And let's face it, not everyone has the ability to drop everything and be your parents' full-time caretaker. And I did not know at that time what kind of commitment I was getting myself into. And I thought, why is that? Unless you're in the 1%, there truly are no good choices. And why do we have no good choices? And it's because our system is a broken for-profit healthcare system that's rigged for the health insurance industry executives. But the good thing, I suppose, is when you're in grief and you're stressed out, and every day you're just like you're living moment to moment. You lose your filter. So every doctor, nurse, home health aide, social worker that I came in contact during this process, I would say, our healthcare system is totally broken. And you know what? Not one of them disagreed with me. So in concluding, I just want to say our for-profit healthcare system is cruel, shameful, broken, inhumane, and totally unacceptable in what is the wealthiest country in the world. Healthcare should never, ever be for profit. It should be for the people. Thank you so much for hearing my story.
So that other video clip was from a longer video that I did about mutual aid crowdfunding that I do a lot of on Twitter. But as far as Medicare for all specifically, to focus on that for a minute, it is actually, to me, the most important issue, and that's for a lot of reasons. I do strongly, strongly believe that healthcare is a human right for every person, no matter what their situation or even their personal beliefs, whether vaccinated or unvaccinated. Either healthcare is a human right or it isn't, and I believe it is. And for me personally, Medicaid, in my opinion, has saved my life more than once. And I don't really think that I would be here today without Medicaid, which is one of the reasons that I strongly believe everyone needs it, everyone deserves it as a human right. I've dealt with a lot of physical and mental health conditions my entire life because of lifelong physical and mental abuse and psychological abuse for 20 years, and then even sexual abuse for the first 28 years of my life. So because of that, I ended up with more comorbidities than I can even count. Chronic major depression, severe anxiety, CPTSD, autoimmune celiac disease, fibromyalgia, malnutrition, anemia, but the thing that really prevented me from being able to work anymore was a physical condition that I wasn't even aware of. I didn't get diagnosed until my 30s. I had endometriosis for so many years, and it had gotten so bad that I could barely walk. I wasn't able to work anymore. I was waitressing, and I wasn't able to lift anything to waitress, so they had me rolling silverware, and then I got to a point where I couldn't even lift the bin of rolled silverware, which was only 10 pounds. And at that point, I realized that I just could not work anymore. And I was in my late 20s by then. I was still in an abusive relationship, an abusive family situation, was not able to be financially dependent. I've actually never been financially dependent in my life because of that. And at that point, I did stop working, and I dropped out of college. And honestly, that probably would have been it. Like, I would have worked myself to death not knowing that I had a non-cancerous tumor growing bigger and bigger in my abdomen because of endometriosis that had gone untreated for so many years. Literally almost a decade of severe endometriosis, fibroid tumors that just got bigger and bigger and bigger to the point that I could barely walk. I couldn't get any schoolwork done. So I quit college. I immediately went looking for Medicaid and food stamps. I never had the courage to do that before because my abusers wouldn't allow it. They had taught me that any government handout was even though I was an adult, they prevented me from taking care of myself with my physical or mental health or getting Social Security or getting food stamps. But when I became pregnant, I took the responsibility to seek those things out myself anyway. And because of that, I got approved for Medicaid and food stamps and was able to start taking better care of myself. I was able to see a psychotherapist for the first time in my life, and they diagnosed me with severe chronic depression that I've had since I was 12, and severe anxiety disorder, and CPTSD, and possibly OCD. And they put me on antidepressants, which a while later I changed the dosage, and they changed the dosage to like twice what it was before, and I'm finally in a place where I feel like my depression is managed because of those antidepressants, which I only was able to get because of Medicaid. And with food stamps, I was able to take better care of myself. And it also allowed me to see any doctor that I needed to pretty much was covered by Medicaid. And I was able to see a primary doctor that I really liked, and they set me up with all the specialists that I needed to find out that I had severe endometriosis and a tumor growing in my abdomen for years that then was getting worse because of my pregnancy. The pregnancy hormones actually caused this abdominal tumor to grow massive, and I had it through my pregnancy and after his birth. It was literally, by the time Grayson was born, it was a mass the size of an orange, according to the surgeon. And it was attached from my uterus to my abdominal wall to my bladder. And it was just a mess. The surgeon held up his hands and said it was like this big, the size of an orange. And that surgery, I can't even imagine what it cost. Having Grayson in the hospital, there was also some complications because I was a high-risk pregnancy the whole time. I didn't know that it was because I had this giant tumor this whole time that I was pregnant and going through labor and everything. It was like being pregnant with twins, and I didn't even realize it. So Grayson was fine. He was small. He was actually a week late and still very small. He was only 5 pounds, 11 ounces. But as soon as he was born, I had extremely dangerously high blood pressure. I can't remember the name of it now. But it was very high, very dangerous blood pressure, preeclampsia, I think. And it could have caused a stroke. So they put me on magnesium and kept me in the hospital for an extra 3 days. Having a baby without any complications in the United States is an average of $10,000, if you didn't know. Being there for an extra 3 days and having, extra medication and care, I have no idea what that cost because Medicaid covered it. Just like it covered my psychotherapy, and it covered my antidepressants, and it covered the specialists that I needed to see. It even covered some of my dental work because I had confirmation from my primary doctor that the number of comorbidities that I have affected my dental health. So I was able to get some dental work covered as well. which wasn't easy either. I had to fight that for a year just to get them to cover some basic things like basic deep cleaning and things like that. But in any case, I have no idea how many thousands of dollars it would have cost out of pocket without Medicaid. But I really truly believe that it saved my life and my child. So yeah, it is definitely the most important issue to me out of everything. I think I've come to realize that housing is probably the other most important issue to me, which is why I focus on crowdfunding mutual aid to help people with housing and just basic necessities and food. They should all be human rights, and every human being deserves it and needs it to live. And even just to live basically, not even to thrive and live a good life, but just to live a basic human existence, you need food and clean water and health care. When I finally got diagnosed and had Grayson, and my life significantly improved once I had health care. And today, I turned 35, and, we're still going, and Grayson just turned 4. So we're doing the best we can, but yeah, we've been in quarantine for 2 years now, living out in the desert. And we're doing the best we can, but we've tried to start a home business for income because we're still not able to work out of the house. My partner is also high risk. But I just wanted to say, absolutely, I believe that healthcare is a human right. And we should have it already. It's outrageous that we don't. So I hope we all keep fighting for it. I'll do what I can, even though I'm kind of mostly homebound, for now because of the pandemic. Best of luck to everyone, and my sincere appreciation and so much love and gratitude and solidarity with everyone still fighting for Medicare for all single payer. I love you guys. I appreciate you. And let me know whatever I can do to help make it happen. Thank you.
Hey there, guys. I'm Rick Overton, and I just want to remind everyone that we are in the perfect storm of circumstances that should remind us why we need Medicare for all. And that means all the Americans, even the ones you disagree with, and the ones that you feel are taking your tax dollars away for their issues and all of that, because they're human beings and they deserve to be kept alive in a civilized society, that which remains. So please, please, please support Medicare for all. It is really including you too, and that also includes the eyes, the nose, the teeth, and all the other things that we need, because that's all of us. So all of us, let's fight for Medicare for all of us.
For the last time, Joy, this
Oh my freaking God!
you had to go out like that.
It must, people must think it's a bit at this point. It's like a bit. Joy has to be muted on all 10 of her panels. Oh my God. So I swore I wasn't going to get emotional during those. But yeah, I just want to sum up a few of my thoughts. So I don't understand how you can watch a video like Joe Charest or a video like Tiffany Jewell and say state by state, I don't understand that. Everybody in, nobody out. All means all. How many Joe Charets and Tiffany's are going to be left out if you pass one state? How is that equity? How is that helping the millions of other Joe Charets and Tiffany's? It's not. It's incrementalist. It's ableist. It's sexist. It's racist. This has to be a national effort. Everyone, all of humanity deserves healthcare. Everyone. I don't care what arbitrary borders are around your state. I don't give a shit. Everyone deserves healthcare. And when I hear incrementalist and I hear means testing and stuff, to me, you are not thinking about the Joe Charets and the Tiffany Jewels. You're not thinking about that. Because helping 10 of them is not enough if there's 10,000. Stop settling. Stop asking for this. Ask for the whole fucking thing. Ask for everyone. Nobody deserves healthcare more than someone else. Nobody. And there is so much privilege in thinking that way. If everybody who fought 24/7 for their state fought more for actual national improved Medicare for all, we would have a huge movement and we could make some progress. But breadcrumbs are people's focus. We don't have time. 68,000 people die every year. So you get one state pass? Cool. What's that? Still 60,000 die? What are they? Expendable? Apparently. So stop thinking about it on a state-by-state level. Start thinking about it as everybody in, nobody out. This is humanity. No one person is worth more than another. They're not. And by saying all within these borders deserves it more than you do, that's exclusionary. And that's not what humanity is about. That's not going to help further healthcare in any respect. It's not. So I just want people to think about that. Think about what you are saying when you are really saying, I'm going to fight for this state. That's what you're saying. You are literally saying some people in, a lot of people out. And that's not okay. This weekend, being a host and a lead organizer this weekend was very impactful. Seeing so many people come together and share their personal stories about why this is life or death for so many people. This is the strongest part of violence. This right here. This is life or death. Everyone that came together this weekend, these 3 days, had the same goal. All of humanity. Everyone. And I really hope people understand the severity of how it needs to be everyone. everyone nationwide. I'm just going to keep fucking saying it. I don't care. Everyone. And honestly, like, oh, I can't see that. Oh, I love you, Mama. I want to thank my team, honestly, because having, becoming blind 2 years ago and being an activist for years prior to that, I wasn't sure how much am I going to be able to do still. Can I still do X, Y, and Z? I didn't know. And I sure didn't know I could host like 16 hours of fucking forums. But And Forever All believed in me. And they asked me to do this. Despite not being able to see, they still wanted me on the front lines. And it might not mean as much to people who are not disabled, but as an activist who is newly disabled, still feeling like you are worth something in this movement means so much more than I can quantify. So I just want to thank my team. I want to thank everyone behind the scenes. I want to thank the host. I want to thank the panelists. I know I was the one most on camera, but this was not just me by any means. And I just thank you all for believing that I could do this and for asking me to be part of this. It was an incredible experience. I learned so much, and I will truly treasure all 3 days as a highlight of being in this movement. Truly a highlight. I was so I was not gonna get emotional. I lasted 3 days. I swore I wasn't, and then watching those cameos, that's why we do this. That's why. So I want to give love to everyone out there who is fighting, everyone out there who is hurting, everyone out there who is victim to this disgusting, violent, capitalist system, and everyone who's feeling defeated. I just want to send you love and respect and support, and know that even if you can't fight, we will be fighting for you. And I hope that people, who watch this learn as much as I did, and I hope that you will follow us and donate if you can, and also join our future events. And we have other stuff coming up, so I do hope you guys will continue to support our effort. Please smash the like button. Please share. Don't just share me bawling. Share the whole 3 days. But yeah, and this seems kind of like weird to mention now after I'm so emotional. But yes, if you can donate, please do. This is, unfortunately, we need donations to do our actions, which are not virtual. But yes, I do want to thank our sponsors, M for All, obviously, Indie News Network, Real Progressives, Real Progress in Action, Yellow Vest Action, and National Single Payer. These groups have come together to support us and support our effort. And again, thank you so much to the team. And thank you so much to the panelists, the musician, those who did cameos, those who did interviews with me exclusively for this, everyone, just everyone who was involved. This 3 days took so many people to contribute. And I'm honored that I was a part of it. So thank you. And Andy, you're the reason we were able to do it. Literally,
I wouldn't have had it any other way.
Thank you so much. Is there anything you want to say about, all you witnessed and listened to and everything all weekend? Uh-oh.
I didn't know. I'm not going there. I just wanted to say that there was the only thing that I will say is that someone took a quote of mine that I said on the first night where I was talking about the only thing I needed to when I went to the doctor was $6 for parking. And I was grateful for that post that somebody quoted me, but there were some people that thought that I was bragging. And I just wanted to say that was never my intention. Like, kind of think about it. I'm a Canadian with healthcare, and I'm volunteering to try to get the same thing for Americans. I'm not looking down at you or saying, ha ha. I'm reaching down, trying to pull you up to where I am. Right. And that's the bragging. There was not the intention. I want Americans to know what's possible for you. You all should have what I have and what every other country in the world has. No excuses. Right? The enriching of a few billionaires in your country is not an excuse to deny basic human rights to your population. And whatever I can do to help with that, I will. And that's where I'm going to put it.
Absolutely.
And I love you so much, Joy. You're my sweetheart. And I will absolutely do this for you anytime you ask.
Thank you so much. And yeah, you bring up a great point. We really do. I mean, when I post about like my specific eye treatments and how it's like $12,000 each eye every 30 days and stuff, I have people from Switzerland be like, it's free for me. I don't take that as a ha 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 ha. I take that as you need it for free too. Absolutely. That's how I take it, because that is how they mean it. That they're coming from that point, like, why is it free for me and not for you? So no, I mean, I'm sorry somebody took it that way, but I mean, you're doing this volunteer from Canada, so you obviously care very much. And
absolutely.
You're amazing, and just thank you so much for all your help.
Absolutely. My pleasure.
And thank you so much to everyone who has watched, everyone who's donating, everyone who smashes that like button and shares it. Also, if you want to watch the prior 3 days, any panels, musicians, cameos you missed, you can see it on my channel as well, on my YouTube, and I'm going to be trying to upload it to my Rockfin as well. So just, I don't know, thank everyone. Thanks everyone I've ever met in my life.
Yeah. And to quote one of the very first guests of this summit, it's time for an adult beverage.
Oh, no. Already did that.
or call Uber drinks.
Well, thank you so much. Thank you, everyone. And if you can, please do donate. We could use the help. Thank you all so much.
Bye-bye.